The President. Address. Mr. Peter Shiu will address the Council on Public Accounts Committee Report number 82. Mr. Peter Shiu. Thank you, President. On behalf of the Public Accounts Committee, PAC, I hereby table PAC Report number 82, which covers the 8 chapters in Report number 82 of the Director of Audit. I will briefly speak on 2 chapters on which public hearings were held. On Chapter 2, Emergency Dental Services and Elderly Dental Care Support, the committee notes that government dental clinics are established for fulfilling the civil service terms of appointment to provide dental benefits for civil servants and their dependents. Since 1947, the government has been using around 2% of the service capacity of the dental clinics to provide free emergency dental services to the general public. Due to the epidemic and the shortage of dentists, the dental clinics are already operating at full capacity. These quotas for emergency dental services decreased from about 40,000 in 2018 to 2019 to about 20,000 in 2022 to 23. To avoid making patients queue overnight for this as a result of inadequate service capacity, the Department of Health, DH, implemented the preliminary registration arrangement in September 2022. DH commences registering patients' information at 0 a.m. of the day of the general public GP session, and the registered patients can then return to the clinic in the morning for obtaining a list to receive service. However, the arrangement failed to address the issue of long waiting time for the public. The committee expresses grave concern and dissatisfaction about the undesirable situation. The committee strongly recommends that the administration should review the current mode of provision of emergency dental services and explore the possibility of setting eligibility criteria, example income level, for patients to ensure the proper use of resources. The committee welcomes the collaboration of the administration with non-government organizations, NGOs, to provide emergency dental services under a new service model to the underprivileged groups with financial difficulties starting from next year. The quota will be gradually increased to 60,000. On improving the queuing arrangement, DH will introduce an online electronic distribution and registration system this year. Furthermore, DH has changed the preliminary registration time in June from 0 a.m. on the day of service to 8 p.m. the day before. After completing preliminary registration, patients need only return to the clinic half an hour before their research sessions to receive service. On a related matter, the Legislative Council has passed the Dentist Registration Amendment Bill 2024, which seeks to relieve the manpower shortage in dental care services in Hong Kong. On elderly dental care support, the committee expresses concern that the achievement rate of NGOs participating in the outreach dental care program for the elderly varies rather substantially. As for the Elderly Dental Assistance Program (EDAP) under the Community Care Fund, the actual numbers of beneficiaries were less than the numbers estimated for the service years 2018 to 2019 to 2022 to 23. The committee strongly recommends that the administration should actively enhance communication with NGOs and the implementing agent of EDAP to make sure that every elderly person with needs will be provided with service. On Chapter 5, Provision and Monitoring of Rehab Bus Services, the committee notes that since 1980, the government has been providing rehab bus services to persons with disabilities, PWDs, who are unable to use public transport services by means of giving subvention to operators. In 2022-23, subvention amounting to $125 million was provided to the operators. With the development of barrier-free public transport and car-hailing service, PWDs are given more choices of transportation mode. They also enjoy the concessionary fare of $2 per trip when taking public transport. Meanwhile, most rehab bus services require advance booking or application submission. Some services have experienced low usage over the past few years. To enable PWDs to commute at any time and to ensure the proper use of public funds, PAC strongly recommends that the administration should conduct a comprehensive review on the policy of rehab bus services and examine whether there are other more effective and flexible means to provide service, such as providing vouchers or direct subsidy for PWDs to use wheelchair-accessible modes of transport. To monitor the service provided by operators, the Transport Department (TD) has signed Memoranda of Understanding (MOU) with the operators to set out the general principles and governing guidelines, but the MOUs are not legally binding. The committee expresses serious concern and disappointment about the arrangement. According to the audit report, the two operators failed to comply with the requirements stipulated in the MOU on various issues. The committee observes that one of the operators used subvented vehicles to provide service in other self-financing activities that it operates. The committee expresses serious concern and finds the situation unacceptable. Although the issue was resolved after TD took follow-up actions, the committee strongly urges that the administration should review the current regulation of rehab bus services. The administration should consider adopting a regulatory approach that is legally binding. Pending the new approach, TD should strengthen its monitoring of the operators to ensure the compliance with the MOU requirements and the enhancement of operational efficiency. To improve rehab bus services, boost utilization, and ensure the best use of public funds, the committee strongly urges that TD should review the operation of various types of rehab bus services with the two operators to consider, for instance, the wider adoption of the shared use arrangement, enhancement of existing routes, shortening of the waiting and advance booking time, setting of a limit on the maximum number of accompanying carriers, and imposition of sanctions on users who cancel bookings without a reasonable explanation. Lastly, I wish to express my appreciation for the contribution made by all members of the committee. I also wish to thank the witnesses who attended the public hearings, and not least the Director of Audit and his colleagues for their cooperation and support. Thank you.
Questions. Question 1. Dr. Chow Man Kong. President, it is learned that the frequent occurrence of power supply incidents in recent years has aroused public concern about the stability of the power supply systems of the two power companies and their capability to respond to incidents in a timely manner. In this connection, will the government inform this Council, one, of the number of power supply incidents of the two power companies since July 2021, with a breakdown by cause such as impact of inclement weather, aging of facilities and human factors, and the respective percentages in respect of each incident, the districts and the number of customers affected, the time taken from the outage to the full resumption of normal power supply, the manpower deployed for emergency repair, as well as the measures taken for the full resumption of normal power supply. 2. As it is learned that in the past 3 months, the power supply system of CLP Power Hong Kong Limited broke down twice when the thunderstorm warning was enforced, of the contingency measures put in place by the authorities and the two power companies at the present stage to enhance the capability of the power supply systems to withstand the impact of thunderstorms and other inclement weather conditions, and the relevant measures in the long term, the estimated cost of such measures and whether the cost will be passed on to the customers. And 3, as there are views that with the government's promotion of the development of digital infrastructure, including data centers, and the increasing popularity of electric vehicles in recent years, the demand for power in the community is increasing, whether the government will, apart from urging the two power companies to enhance the capability of their power supply systems to cope with incidents, consider introducing other proposals to enhance the reliability and stability of power supply. Secretary for Environment and Ecology. President, a stable and reliable power supply is very important to the daily lives of the public and every level of economic activities in Hong Kong. Recently, there have been a number of voltage dips and power supply interruption incidents of CLP, Hong Kong Power Limited (CLP), and the frequency of these incidents has led to concerns about whether CLP service quality is on the decline. The government is of the view that CLP needs to examine its company culture and management system for the entire power supply system to identify the root causes of the problem, make fundamental improvements to reduce the chances of similar incidents in the future, and maintain the stable and reliable power supply that Hong Kong has always been proud of. On this, the government has requested CLP To allocate resources for an independent consultant, the EMSD will be responsible for engaging an independent consultant to conduct a comprehensive examination of the causes of all voltage dips and power supply interruption incidents in the past 3 years and the capability of the entire power system to withstand the impact of external factors and provide comprehensive recommendations on how to enhance the stability and reliability of the power supply. The Hong Kong Electric Company Limited (HEC) has also pledged to take adequate measures to enhance the capability of power supply system to withstand adverse weather. In response to Dr. Chow Meng Kong's question, our reply is as follows. From July 2021 till now, according to the reporting mechanism between the EMSD and the two power companies, there were 26 significant power outage incidents in the power system of the CLP and 5 for HEC. Members may refer to NS for details of each incident. The causes for power outage incidents are mainly classified into external factors such as adverse weather and third-party interference, and internal factors such as equipment fault. Among the 26 power outages for CLP, 10 were caused by external factors accounting for 38%, 15 were caused by internal factors accounting for 58%, and the cause of one incident is still under review and is to be confirmed by the EMSD. Among the 5 power outage incidents of the HEC, 3 were caused by external factors accounting for 60%, and 2 were caused by internal factors accounting for 40%. To restore power supply as soon as possible after power outages, the two power companies would assess the situation instantly and deploy suitable professionals to the scene in order to identify the location of the incident and arrange for repair. The power companies would, based on the actual situations, adopt the most appropriate and effective power supply restoration plan, such as emergency repair, remote switching of alternative power, arranging temporary mobile generators, and laying temporary power cables, etc. Regarding measures in response to the increasingly frequent extreme weather, the Director of Electrical and Mechanical Services visited the two power companies earlier to receive briefings on the relevant work of the two power companies. In response to the Director's requests, the two power companies have pledged to take adequate measures to enhance the capability of power supply systems to withstand adverse weather. The CLP stated that it would 1. Further increase manpower and adopt innovative technology to conduct inspections and maintenance of key facilities. 2. Install lightning protection systems on some outdoor power facilities and flood prevention devices and electrical substations and expedite renewal of power supply equipment. And 3. Carry out a comprehensive review of the CLP's power supply system. HEC stated that although most of its high-voltage cables are buried underground and are in general not affected by thunderstorm, in light of the more frequent extreme weather recently, HEC has gradually installed bund walls and flooding alarm or sump pump systems in relevant electrical substations which may be affected. After the voltage dip incident occurred in CLP's 400 kV overhead line power supply system connecting Yuen Long and Shenzhen in the early morning on the 23rd of June 2024, the EMSD immediately followed up with the CLP on how to enhance the lightning protection capability of power supply system. In addition, the EMSD has established a task force to solemnly follow up on the improvement measures proposed by CLP, with an aim to mitigate the impact of extreme weather on the power supply system. CLP stated that to ensure a reliable power supply during peak demand periods, especially during scorching summer days with surging demand, the CLP will continue to monitor the demand of the power supply system. On the capital projects of the two power companies to enhance their power supply system to withstand adverse weather, the government has been stringently carrying out gatekeeping duties under the framework of the Scheme of Control Agreements and scrutinizes the capital expenditure of the two companies to avoid increase in profits through premature, excessive, or unnecessary investments, as well as requests the power companies to exercise stringent control over operating costs to prevent them from passing unnecessary costs on to citizens. The objective of the government's energy policies are to ensure energy needs of the community are met safely, reliably, and efficiently at reasonable prices, in order to minimize the environmental impact of energy production and use and to promote the efficient use of conservation of energy. We keep an open mind to any technically and financially feasible plans which enhance the reliability and stability of the power supply. In addition to monitoring the performances of the two power companies, we are also actively exploring the enhancement of collaboration with neighboring regions and the directions of cooperation on zero-carbon energy projects near Hong Kong, as well as identifying more sources of zero-carbon energy supplies which will help stabilize tariff in the long run while ensuring stable and clean energy supply for Hong Kong. The EMSD will continue to monitor the operation of the power companies, including strengthening the routine regulation and inspection of the two power companies' facilities to ensure that the two power companies provide safe and reliable power supply to the public. The EMSD has requested the two power companies to adopt various innovative technologies to analyze the health conditions of power supply equipment. Thank you. Dr. Chao-Man Kong. 14 incidents were related to equipment faults. According to the main paper, it is expected that the demand will continue to surge. In relation to the two power incidents that happened in the evening or in the small hours, how can the administration make sure that the power companies have sufficient manpower in response to these incidents that take place in the evening or the small hours? For example, would there be any regulation on the minimum power required to handle the unforeseen or the emergency events? Secretary. President, I'm very much concerned about the power incidents of the CLP. I noticed an increase in the power incidents. So in the reply, I said that I would request that the CLP conduct a comprehensive review of the cases, but it is not going to be conducted by the CLP alone. It will have to pay to the EMSD for a review. On this, I once again met with the CLP, that is the managing director. We discussed the progress on the improvement plans, which includes the questions raised by Dr. Chow. I think the CLP needs to expedite response to the site as a result of any accidents. On the one hand, the CLP will increase manpower supply. On the other hand, there will also be enhanced internal communication. The purpose is to allow manpower to arrive at the scene more quickly. There are also mobile generator vehicles. In emergency situations, mobile generators can be deployed to provide power supply. This can help provide power to the affected citizens. Apart from that, we also requested that the CLP set any indicator on the time taken to arrive at the site. The purpose is to provide more information to the administration. I have been in close liaison with the CLP, and I have made requests to the CLP. I hope that their performance will continue to improve in the future. Mr. Jeffrey Lam. Thank you, President. We can forecast weather in the future accurately. There have been extreme weathers unseen in 100 years or even 500 years. There are typhoons, for example. It poses challenges to the power supply systems, without doubt. For commercial customers or hospitals, there are regular inspections. With technological advancements, not just data centers, AI or cryptocurrencies also have a high demand for power. I'd like to know whether the administration has requested the power companies to adopt more advanced technologies to predict the power demand in order to ensure a stable supply as well as a safe supply of power supply in Hong Kong. Secretary. Thank you, President. On this, in the reply, it touched upon the EMSD has already requested using innovative technologies to enhance power supply as well as the efficiency of maintenance alongside the stable supply of power in Hong Kong. When I met with the managing director of the CLP, I asked him about the concrete measures to be taken. There are two main fronts. First of all, they use innovative technologies such as new equipment to check the reliability of the system. For instance, in Wong Tai Sin, in a power outage incident, they found that the two underground cables had a fault at the same time. they are supposedly they shouldn't have any fault at the same time. Excavation work affected the underground cable, thus the damage. If they need to excavate in order to check the condition of the power cables, it's not very technically feasible. So they have installed new equipment or new technologies to check the conditions of the power cables. They didn't have to go to the site. They can check the conditions of the power cables in the control center. They can check whether there are any external impacts on the power cables. So with new technologies, they can check the conditions of the power cables, whether they suffer from any external damage which affect the reliability and the safety of the power cables. They also introduce AI or digital technologies in order to keep monitoring the system. They accord priority to areas which they need to visit. The CLP thinks the measures on these two fronts will enhance their repair and maintenance work. They adopt new and innovative concepts as well as technologies. Thank you, Professor William Wong. Thank you, President. Many cables of the CLP are actually overhead cables. They are subject to hailfire, thunderstorms, and so on. They are also susceptible to lightning. Will more space be set aside for underground power cables so that other power companies or companies can also put in place facilities for common use? Thank you, President. In all new towns, in the course of development, not just power supply systems as well as utility systems such as sewage treatment plants, all these are part of the new development, the development of the new town. The Water Services Department and the Drainage Services Department have sufficient communication. So in the urban area, many power cables are laid underground. However, we also came to notice the power grid or the network of the CLP is mainly in the new territories. There are also many power towers on the ground. I talked to the CLP and I expressed concern about this matter. The CLP has plans to install lightning protection facilities to existing facilities that can enhance the lightning protection capability in view of adverse weather. But the plans are not taken forward fast enough. They are expecting in 2 years' time they can install 100 more such installations, but I think this is a bit too slow. So I advised whether they can install even more installations in 2 years that will allow a more significant improvement. Mr. Robert Lee, President, in order to enhance the stability and safety of power supply, has the administration advised the CLP and the HEC to draw reference from overseas jurisdictions and to check the supply of power using more innovative technologies in order to identify aging facilities as well as maintenance issues. In 2024, in the first half, the power supply of the two power companies, how did they fare with neighboring regions? Secretary, thank you, President. On the one hand, in our communication with the CLP, we have been encouraging it to draw reference from new technologies in overseas jurisdictions. In relation to innovative technologies, they will consider using new technologies. As mentioned, they will use new technologies. They will also use automated or AI system to enhance their management. On these two fronts, they will try to make enhancements and they will draw reference from overseas experience. Just now you asked about the actual performance comparing with other neighboring regions. In this regard, without doubt, the power supply stability in Hong Kong, it's doing quite well internationally. Last year, the CLP and the HEC achieved 99.999% in relation to the stability of power supply. Having said that, in recent years, I noticed the incidents that took place in Hong Kong. On average, 2,000 to 3,000 incidents of the CLP in the community. So we have noted a marked increase in the past 2 years for incidents that affected more residents. We notice an increasing trend in this connection. On the cause of the incidents, among these incidents of the CLP, internal factors accounted for 58%. The percentage is on the high side. So the CLP may have to review the management and their power supply system in a detailed manner in order to identify room for improvement. When I met with the managing director of the CLP, I also gave them some suggestions. On incidents that have already happened, they need to target the causes in order to make enhancements. The power supply stability is already very high internationally, but I believe that will further improve the ranking. Mr. Lee Chen-kang, facilities are aging, so there will be power supply incidents. In recent years, there are different causes for voltage dips and power supply interruptions. In relation to power outages, we do need to identify the causes and restore power supply in no time in order to minimize the convenience cost to citizens. On SCA scheme of control agreement that is signed between power companies and the administration, there are penalty systems. They should have been, supposedly they are well thought out. We need to respect the penalty system. We need to learn from the lessons. So how can we arrive at a penalty system and a scheme of control agreement with reasonable electricity prices alongside stable power supply? Thank you, President. Secretary. Thank you, President. In my reply to members' questions and in my main reply, I focused on what we need to do in actual fact, what we can do in order to enhance the stability of power supply in Hong Kong. And in case any incidents happen, how can we help members of the public in no time in order to restore power supply? How can we ensure power supply in the case of any power outages? For example, they have mobile generators or power supply vehicles that can generate power supply for citizens in Hong Kong. All these will help stabilize power supply in Hong Kong. These are the real measures that can help members of the public. In this regard, through the EMSD and the dedicated task force, we will continue to communicate with the two power companies, and we expect in the comprehensive and detailed review, we will be able to help the two power companies to enhance their performance in order that we can identify the causes of the power outages or power supply incidents so that the two power companies can make improvements. And this will contribute to the stable power supply in Hong Kong. Thank you.
Question 2, Ms. Jovi Chen. Thank you, President. It has been reported that a 4-year-old girl developed cardiac arrest after she received wound sutures at the Accident and Emergency Department of Yan Chai Hospital. During the suturing process, her head was positioned with the assistance of non-healthcare personnel. It took 18 minutes from the discovery of the girl's loss of consciousness and pulse to the return of spontaneous circulation after emergency treatment. There are views that before the outcome of a formal investigation into the incident is known and before full communication with the girl's family takes place, the hospital is suspected of misleading the public by unilaterally convening a press conference and indicating that it will find out whether the girl has hidden diseases. In this connection, will the government inform this council, first, whether it knows if the hospital authority currently has sufficient mechanisms or guidelines covering different clinical procedures and specifying the duties of different personnel, including non-healthcare personnel, in carrying out such procedures? If the HA has other details, whether the HA will update those guidelines after this incident, if so, of the details, if not, the reasons for that. Second, whether it knows the HA's mechanisms or guidelines for external reporting of medical incidents, and whether the mechanisms or guidelines specify the circumstances under which information on such incidents should be disseminated externally, as well as the form and material contents of the necessary communication with the affected patients and their families before circulating information on such incidents. And third, of the measures put in place by the government and the HA to reduce medical incidents so as to safeguard the healthcare quality of Hong Kong and maintain public confidence in the public healthcare system. Secretary for Health. President, Ms. Zhou Chen mentioned an unfortunate and heartbreaking incident in her speech. I am deeply saddened by the cardiac arrest developed by the girl in this case. I extend my heartfelt sympathy to the patient and her family. The hospital authority is making every effort to take care of the patient and is actively providing assistance to the patient and her family. Dr. Tony Ko, the chief executive of the HA, had also visited the girl, met with her family, offered apologies, and met the press the day before yesterday, that's the 15th of July. Medical incidents involve patient safety. Out of respect for the patient and her family and to avoid causing secondary harm to them, and given the case is now under investigation, the matter is not suitable for a public discussion at the Legislative Council. Therefore, I will not comment on the case in question, and I hope that members will refrain from going into details of the case in questions and answers. The Health Bureau had also reported and discussed the overall quality and safety issues of public hospital services at the Panel on Health Services meeting last week on the 12th of July. In consultation with the hospital authority, I give my reply to Ms. Zhou Chen's question as follows. First, the safety of patients and staff is the prime concern of hospital operations. As such, when planning and delivering patient-oriented services, the HA accords prime consideration to service quality and safety, and establishes a governance structure, systems, procedures, and training covering different clinical services to ensure that these services meet stringent clinical standards. At present, the Quality and Safety Division of the Hospital Authority Head Office is responsible for steering the establishment and implementation of the clinical quality and standard system. The quality and safety teams at all levels in hospital clusters as well as individual hospitals implement and monitor relevant measures in various areas including credentialing, clinical audit, patient safety and risk management, and patient relations, etc., while maintaining close communication and collaboration with the HAHO to ensure that the HA provides quality and safe healthcare services. With the rapid and ever-changing development of clinical medicine, the HA has put in place systems and guidelines for different clinical diagnoses, treatments, and procedures. These systems and guidelines are continuously updated based on evidence to ensure that service quality and standards keep up with the times. The coordinating committees of various specialties and central committees under the HA are tasked with formulating various clinical procedures. For example, bedside application of cardiopulmonary resuscitation and clinical guidelines for treating diabetes and hypertension. They also play a key role in clinical audit and implementation of best practices. There are also service guidelines on nursing care covering clinical procedures, such as blood transfusion and distribution of medicine. Nursing audit is also conducted regularly to identify potential issues and improve the situation. For supporting staff, the HA has also put in place guidelines and training requirements, such as caring skills for patients, workflow for feeding and manual handling of patients, guidance and support will also be provided alongside adoption of modern technology and equipment to ensure that supporting staff can effectively and safely assist the work of healthcare staff. On the second question, for the reporting of medical incidents, the HA has in place a full set of reporting and investigation procedures to cope with clinical risks. At present, all public hospitals have to report sentinel events and serious untoward events to the HAHO, including surgeries involving a wrong patient or body part, or misidentification of a patient that could have led to death or permanent harm. When an incident occurs in the hospital, a report will be made to the HAHO by that hospital afterwards. The hospital cluster, and HAHO will take various actions according to the nature of the incident, including follow-up investigation, risk assessment, review of the causes, and formulation of improvement measures to prevent recurrence of similar incidents in the future. Meanwhile, the hospital will disclose the incident to the patient and their family in an open and honest manner and determine the timing, mode, and content of the public announcement. While the incident is being handled, a patient relations officer serves as a bridge of communication and stays in touch with the patient and their family and keeps them informed of the latest information available and situation in a timely manner. Relevant hospital departments will also provide appropriate treatment and different assistance as needed. The hospital will also inform the affected patient and their family of the relevant arrangement before publicizing the details of the incident. 3. To reduce the risk of recurrence of incidents, the HA also regularly reviews, monitors, and evaluates specific risk mitigation and preventive measures to ensure that they can achieve the expected outcomes. The HA is committed to building a culture of analyzing and sharing the causes of medical incidents, as well as sharing relevant information in a timely manner through various channels and actively adopting advanced technologies such as clinical artificial intelligence to further enhance patient safety and risk management. The HA is also relaunching the hospital accreditation program to objectively and systematically assess the risks and deficiencies in areas such as management of facilities and operation of hospitals with the assistance of external and independent professional organizations and hospital accreditation in order to continuously improve service quality and safeguard patient safety. To further demonstrate the commitment of the government and the HA to continuous improvement of the public healthcare system and to address public concern on recent public incidents, the HHB has instructed the HA to actively follow up on recent individual incidents, review their causes, adopt improvement measures, and also to conduct a comprehensive and independent review of the systemic and structural issues involved in the overall management of public hospitals. The review covers multiple levels, including the HAHO, hospital clusters, hospitals, service units, teams, and staff, and involves multiple aspects, including governance, appraisal, accountability, operations, risk control, and compliance, etc. The review committee on the management of the public hospital system consists of members from various backgrounds. It will complete the review and submit improvement recommendations to the HA board within 3 months, that is, by the end of September. The HA board will consider the committee's recommendations and submit a report to the HHB. The HHB and the HA will consider taking appropriate follow-up actions based on the recommendations at different levels in various aspects in the report to continuously improve public healthcare services and maintain public trust. Thank you, President. Ms. Zhou Fichan. President, on the recent medical incident of Yanchai Hospital, the hospital did not talk to the family first. Instead, the hospital held a press conference and hinted at a hidden disease. That press conference re-traumatized the family. I will not go into the details of the case because that's subject to an investigation. But the Bureau has a greater role to play in other aspects. After my intervention, the hospital authority finally apologized. The HA senior management finally met with the family. A medical mishap puts lives at stake and affects the family involved. Last week, we passed a bill on mandatory reporting of child abuse. But from the Yanchai Hospital incident, medical professionals are the ones apparently at fault. Ms. Zhou Chen, please get to your supplementary question. I don't see any review of the guidelines. My question is, will there be standards that the review committee has to finish the review by a certain deadline? Secretary. On this incident, Dr. Tony Cole met with the family, offered apologies, and then held a press conference afterwards. I want to reiterate the point that this matter is now under investigation by law enforcement. I will not comment on the specifics of the case, and that includes the work of certain workers in this case. On guidelines over medical procedures, those procedures are updated from time to time. Say when a child is at the A&E, certain procedures are performed. The HA has enlisted pediatricians and specialists in emergency medicine to form a panel and come up with recommendations. The updated guidelines and recommendations will be publicized to ensure timely improvement of the procedures. Dr. David Lam. Which question went unanswered? The Secretary did not say when those updated guidelines will come out. Any supplement from the Secretary? The recommendations have been made. The hospital authority will issue those guidelines to its staff internally. Dr. David Lam. I'm a member of that review committee. This tragedy is a wake-up call for the hospital authority. We focused on guidelines and whether the healthcare workers followed the guidelines. If someone did not follow the rules, we step up penalties. My question is, the work environment is changing. Nurses are taking on some tasks of doctors, and patient care assistants are taking on tasks of nurses. The doctor fills out the form, but the operation falls on the shoulders of nurses and someone else helps out. Given this division of labor, how do we ensure professionals, medical professionals, have the duty, the primary duty for patients' well-being? How do we ensure workers, healthcare workers, have that sort of mindset and awareness through training? Secretary. The guidelines are just letters. People can adapt to situations. We cannot rely on guidelines alone. In real life, human actions play a role. Dr. David Lam mentioned the consent form. In hospitals, the workers function as a team. The doctor signed the consent form. The work is executed by the nurses. Sometimes a doctor signs the form and another doctor performs the surgery. These healthcare professionals are trained professionals. They perform procedures in line with their job functions and responsibility. We should have faith in these procedures. Dr. Junius Ho. We have a shortage of healthcare professionals, and the improvement measures are being put in place. I believe medical incidents will decrease over time. Stress is one of the factors behind medical incidents. My question is, We want to allay public concerns. We will be open about the internal records. Can we have a rate of medical incidents at various hospitals? Can we give people a sense of the incident rate? In horse racing, there are leaderboards showing the performance of different jockeys. Will we have such a leaderboard for public hospitals, and can we make that public? I thank Dr. Ho for his question. Indeed, the labor shortage is one factor weighing on the quality of healthcare. The HA has stepped up its efforts in its work, such as recruiting non-locally trained doctors and also retaining local healthcare workers. Now, here's some good news. We have seen some positive changes. In 2021 to 22, up to 2023 to 24, over 2 years, we have taken on more than 1,000 staff members. Doctors alone have seen an increase of 323 doctors. That's 5% increase. The wastage rate of doctors fell from 8.1% to 5.2%. On the rate of medical incidents, when an incident occurs, that hospital reports the matter to the hospital authority. Every quarter, the HA announces the number of incidents. Let's look at the past 10 years. In terms of sentinel events and serious untoward events, we don't see any signs of declining healthcare quality at public hospitals. We don't see major changes over the past 10 years. Let's look at serious untoward events. Over the last 6 months, there were 42 reports. The yearly average over the past 10 years was 70 to 90 events. So the current figure is comparable to past levels. But of course, every single serious untoward incident is one too many. We strive towards continuous improvement to reduce such events. Mr. Eric Yim. Thank you, President. Hong Kong has just a small number of medical incidents. How many cases have we seen involving settlements between the hospital authority and the affected family members? How many cases of medical misconduct have we seen? That is, medical misconduct as found by the medical council. I don't have information at hand on the number of settlements between the HA and the family members of patients. I will talk to the HA to obtain the information. Mr. Jesse Shang. There were 84 cases of civil claims. More than $80 million were paid by the HA in compensation, and more than $100 million in legal fees were incurred by the HA. Say, when we find medical misconduct on the part of a doctor, will there be civil liability for that doctor involved? Thank you. We have to look at the circumstances of each case. When the public healthcare system is involved, individual healthcare workers will not be liable. There are other ways for a patient to file complaints. When a particular healthcare worker is involved, a complaint can be made with the statutory body for that particular profession. We have the medical council for doctors and the nursing council for nurses. A patient can also file civil claims against individual healthcare workers. In that case, the HA is not involved.
Question number 3, Honorable Kingsley Wong. Thank you, Mr. President. The Guangdong scheme and the Fujian scheme under the Social Security Allowance Scheme allow eligible Hong Kong elderly persons who have moved to reside in these two provinces to receive the old age living allowance OALA or the OH allowance OAA. On the hand, it's been reported that according to a survey, nearly 400,000 Hong Kong residents are of Hainan origin. Among them, 85,000 are elderly persons aged above 65. And due to the beautiful environment, good air quality, and low cost of living in the Hainan province, many Hainanese who responded to the survey have expressed their intention to settle in their home province after retirement. In this connection, will government inform this council? A, whether you will study introducing Hainan scheme to allow eligible Hong Kong elderly persons who have moved to reside in the province to receive OALA or OAA so as to meet the keen demand? If so, of the details, if not, the reasons for that. Second, in addition to the portable social security allowance and a series of schemes relating to residential care services and healthcare, of other policy initiatives put in place by the authorities to facilitate elderly persons to settle in the mainland after retirement, in order to provide them with an additional option for quality aging. And third, of the current respective numbers of beneficiaries of the Guangdong scheme and the Fujian scheme, and what new measures are in place to step up publicity on the two schemes. Secretary for Labour and Welfare. President, the government currently implements a number of measures to facilitate Hong Kong elderly persons' retirement on the mainland and provide them with more choices. Amongst them, portable cash assistance initiatives include the Guangdong scheme, the Fujian scheme, and the Portable Comprehensive Social Security Assistance PCSSA scheme. Under the Guangdong scheme and the Fujian scheme, eligible Hong Kong elderly persons who choose to retire in Guangdong and Fujian can receive the old age allowance OAA or the old age living allowance OALA without returning to Hong Kong every year. As at March 2024, there were 25,011 and 2,447 elderly persons benefiting from the Guangdong scheme and the Fujian scheme, respectively. Portable cash assistance only covers eligible elderly persons retiring in Guangdong and Fujian because there are relatively more Hong Kong residents residing in these two provinces, and they are usually and closely connected with Hong Kong on social, economic, and transport fronts. According to the data of the Census and Statistics Department and the National Bureau of Statistics, most Hong Kong elderly persons or residents residing on the mainland stay in Guangdong and Fujian, accounting for about 80% of the total number of such persons. At present, the Social Welfare Department has appointed agents to assist in the implementation of the portable cash assistance initiatives and provide a range of services like submitting applications for elderly persons who cannot return to Hong Kong, conducting case reviews, providing inquiry and declaration services to recipients, assisting the SWD in recovering the overpaid allowances from recipients, and investigating into suspected fraud cases. Our country has a vast area, and Hong Kong elderly persons residing in other provinces or municipalities on the mainland are relatively small in number and scattered. If the scope of the portable cash assistance initiatives is to be expanded to more mainland provinces and municipalities, we need to carefully consider the administrative expenses involved in appointing agents to provide relevant services in these areas and associated cost effectiveness. Furthermore, we must point out that the portable cash assistance initiatives involve relaxing the requirement of residents in Hong Kong while they receive the cash allowance. The financial implications must be carefully considered. When the government considers expanding the cash assistance initiatives, it must take into account long-term fiscal sustainability and prudently use public funds to support Hong Kong elderly persons. Will carefully listen to the views of the community on portable cash assistance initiatives with a view to striking a balance between addressing the demands of our residents and making appropriate use of limited welfare resources, the government currently has no plan to expand the scope of the portable cash assistance initiatives to Hainan province. The members concerned about whether the government has other policy measures to facilitate elderly persons' retirement on the mainland. In order to strengthen the support for people retiring in Guangdong and Fujian, the Housing Bureau provides flexibility to elder persons who need to surrender their public rental housing units or delete their names from the tenancies upon receiving portable cash assistance. Considering that they may encounter adaptation issues after moving to mainland, the Hong Kong Housing Authority and the Hong Kong Housing Society currently allow elderly persons to keep their PRH units for no more than 3 months, with grace period starting from the date of departure from Hong Kong. If the recipients voluntarily surrender their PRH units, HA and HS will issue a letter of assurance to the recipients upon the request while recovering the units, provided that there's no breach of the tenancy agreement. In case they return to Hong Kong for good and redemption of the letter of assurance, the recipients will be allocated a refurbished PRH unit by HA or Hong Kong HS if they meet the eligibility criteria for application and the conditions as laid down in the letter of assurance subject to availability of resources. If they delete their names from the tenancies while their family members still live there, they can apply to HA for a letter of reinstatement. In the event of their return to Hong Kong for good and redemption of the letter of reinstatement from HA, subject to the prevailing housing policies, and the recipients may apply for reinstatement of the names in the tenancies as authorized family members, provided that the tenancies are still valid. The HS also puts in place similar arrangements. The SWD has set up thematic websites about the Guangdong scheme and the Fujian scheme to provide online application forms and information like eligibility criteria, application procedures, and FAQs. The government's cross-boundary public services thematic website also provides services and information to facilitate our residents' submission of applications on the mainland. From time to time, the SWD promotes the two schemes through various channels: promotional videos on TV, cross-boundary coaches, newspaper advertisements, posters, and flyers, etc. And our ETO in Guangdong also, and our agents on the mainland would also promote on their websites, etc. Mr. Kingsley Wong, we need to facilitate mutual access and integration. We've been greatly facilitated. We have the SSA, we have also got medical service, and we have also got subsidized residential homes that are limited to Guangdong province. There is a view that such facilitating measures for the elderly should be expanded and extended to other mainland provinces to benefit more elderly and Hong Kong residents. It has been said that if we only benefit the Hong Kong residents could reside on a long-term basis on the mainland and not to those residing in overseas countries, it is unfair. I want to know whether it is in line with the principle equity if it is only available to people residing on the mainland. Secretary, if we look at the Guangdong scheme as well as the Fujian scheme, I think the eligibility criteria are easy to understand. You need to be a Hong Kong resident. You must have resided in Hong Kong for 7 years or more. And of course, they must meet the asset and income criteria as well. In other words, in this case, they will be eligible for the Guangdong scheme and Fujian scheme. Before the application, they must have resided in Hong Kong for 275 days in the previous year. In other words, if they have not been residing in Hong Kong, either they stay overseas or on the mainland, as long as they meet the above-mentioned criteria, it will be fine. It has been so, and we believe that it will stay the same in the future. Dr. So Cheng-Wing, President, facilitating retirement of our elderly people on the mainland. We have already got a Guangdong scheme for people retiring in residential care homes there. I think it is a very effective arrangement. I want to know how many such residential care homes in Guangdong has taken part in the scheme and how many Hong Kong elderly citizens have been admitted. I know there is a 6-month trial scheme or temporary scheme. I want to know how many elderly residents have resigned from the scheme after trying it for a few months, and I want to know whether we're able to meet the demand. Well, you asked a number of questions. Secretary. Thank you, President. I would like to thank Mr. So, Dr. So for his question. Though it is not directly related, let me answer the question. 2 weeks ago, I answered a similar question. We have not covered residential care homes purely operating in the GBA. We are in the final leg of our negotiation. We expect a few such homes will join. Then there will be more choices. Other than homes run by Hong Kong organizations, homes run purely by local or mainland organizations may join the scheme. I haven't got the figures with me. That can be made available afterwards. Mr. Leung Kong, we have close interflow of persons between the two places, and we have a lot of sentiments towards the mainland. I think more and more people will choose the mainland as the place for retirement. I think it is also good for us to tell the story of Hong Kong to the mainland citizens. I don't think we should restrict the scheme to those who just reside in the two places. This is also not in line with the reality of the mainland development. The Secretary mentioned the need to restrict the schemes. We have got 16 offices, ETOs and liaison offices, etc. As long as we can apply the information technology, we can deal with the application inquiry services. It won't be difficult. For the portable cash assistance initiatives, if you are age 70 or above, you can get the OAA, OH allowance. It's a form of recognition. You don't have to pass the income or asset test. So can you sort of extend the OAA to other provinces than Guangdong and Fujian? So let's try it out so as to provide more support to our elderly citizens. Secretary, I'd like to thank Honorable Leung for his question. It is a matter of striking a balance and making a choice. I visited many mainland provinces and cities. Many elderly residents have raised the proposal. For Guangdong scheme, we have got about 25,000 participants, 1/3 on OAA and 2/3 on OALA. Fujian, 2,500 people only, 10% of the number of Guangdong. But then the administrative costs are more or less the same. So same cost for a 25,000 scheme and a 2,500 scheme. So we cannot rely on our own resources if we are to extend the scheme. We need to get the agents. So it will cost us a few $1 million minimum for any extension. We'll try to strike a balance whenever and wherever possible. 80% of our residents retiring on the mainland are staying in Guangdong or Fujian. So let's stay with Guangdong and Fujian for the moment. Mr. Lee, well, we have had discussion with the Secretary and his predecessors on this topic for a long time. We do understand the administrative arrangements. Guangdong and Fujian are to be included like on a pilot basis. We have received requests, inquiries from elderly people from other provinces and municipalities like Hainan, Beijing, Suzhou, and Shanghai. Well, they have a lot of expectations. They will urge the Secretary to think of a solution. Maybe it's not in the form of an extension of the scheme. As the Secretary has said, administrative costs would be a factor. But does it mean that you don't have a solution? I'm sure there is a way out. Can you not pledge and promise to study the feasibility or the possibility of introducing something more facilitating and whether they can look forward to the extension of welfare benefits being extended to them while they retire on the mainland? Secretary, I think Ms. Lee is right. and she's sort of telling us what's happening on ground. When I went to Fujian, I also visited the retirees there. At the moment, we don't intend to extend beyond Guangdong and Fujian, but meanwhile, we will study the matter. Indeed, there are many issues that have to be sorted out, but I'm not saying no altogether, but just that for the time being, we have no plan to extend it. We are trying to see if there are other possibilities. We'll be happy to look into that further. Ms. Lam So-wai, President, our population is aging, and that's getting worse and worse. I believe that in future, more elderly residents want to retire in their hometowns on the mainland. I just wonder if the departments and bureaus can consider assessing the demands there. And for the annual interviews, and for the sake to catch up with the inflation rate, would you be adjusting the rates appropriately? Secretary, well, for the OAA and OALA rates, they receive the same amount of money. The only difference is that they draw in Fujian or Guangdong and not in Hong Kong. I see no need to make a change. The amount of money involved is the same. I not think it is appropriate. Mr. Tony Chair. Thank you, President. As the Secretary has said, the Bureau has to strike a balance between the use of resources and cost effectiveness, but still we should provide as many policies and initiatives as possible to facilitate retirement on the mainland. I do subscribe to the point made in the main reply, that is the need to surrender the public rental housing unit by the recipient. Of course, we know that when someone retires on the mainland, they may have adaptation problems. It is good to have a mechanism for them to return to Hong Kong and continue to reside in a PRH unit. I want to know from the SWD as to the number of such cases. Are there many of them, and what measures have you got in place to help them to come back to Hong Kong and reside in a PRH unit as soon as possible? Secretary, I would like to thank Mr. Chair for his question. I don't have the figures with me. What happens is that the HA or the HAS would be responsible for the arrangements. The SWD would only provide assistance when needed, so I don't have the figures. But my understanding is that many elderly people are very used to retirement on the mainland. They have their relatives, they have their friends. They must have that networks before they decide to go to Guangdong or Fujian while receiving the same amount of assistance. I'll try to get the figures from the HA or the HS. Mr. Stanley Lee. Thank you, President. It is undeniable that it is a growing trend to retire on the mainland. It is a Chinese tradition. Many elderly people would like to have family reunion on the mainland in their own hometowns, but then the assistance must follow the recipients. For the elderly healthcare vouchers, I understand that 8 medical institutions in Shenzhen now allow the use of such vouchers. And then for the residential care homes, the Secretary said that more such homes will be offering the services. I think we should consider allowing the assistance to go with the recipients. If you have the absence rule, it is causing a restriction. I just wondered if you can waive the absence rule or the residence rule. Secretary, I think Mr. Stanley Lee is talking about an application to have portable cash assistance, that is for your OAA or OALA to be received in Guangdong or Fujian. Now, we have already relaxed the requirement. In a year's time, you can at most be absent from Hong Kong for 90 days. Previously, it was 56 days. Once they have settled in Guangdong or Fujian, you don't have to abide by this rule. You can at least be staying in Guangdong, Fujian for 60 days, and then you will qualify. You can go elsewhere during that period of time. Mr. Stanley Ng. Sorry, I pressed the button by mistake. I would like to ask a question in question 4. Mr. Lai Tong Kwok, I think the schemes are good, but then there aren't too many recipients. The government is only paying the money to the recipients. The government is entrusting the job with the mainland agents to carry out the vetting. Have you ever considered that money is not the only answer? For elderly people retiring on the mainland, they have other needs. Say, for example, they need someone to care for them. So would you request the agents to do more? That is, provide more services to the recipients so that they have the means and they have a sense of happiness, because your agents should be required to show more care to the recipients. Secretary, we are also concerned about that and we care for the recipients. But the agent's task is to carry out the vetting and carry out home visits upon request by us. My understanding is that most of the time they will provide assistance to the recipients. Yearly, they have to visit at least 20% of the recipients, and there should at least be one such home visit every 5 years. I can talk to them. In fact, the agents work both on the mainland and in Hong Kong. We'll see if they can make good use of their networks to provide better service to the elderly people. Ms. Eunice Yong, while we are on Fujian scheme, the Fujian group in Hong Kong has a close liaison with us. They have a huge network in Hong Kong. For you to retire on the mainland, you can't go on your own. As I have told the secretary, usually a few of them or a few families will go together. I just wonder if you will have a closer liaison with the Fujian Association in Hong Kong or other Fujian groups, so that you promote the idea that a few households or families will join together to make the decision to retire on the mainland. Yes, let's try it out. Last time I went to Fuzhou, I think I visited a few families. You are right. Usually it won't be a single elderly person deciding to retire on the mainland. Usually they will have a group of friends and they go together. We can promote the idea further by working together with the Fujian Association. Thank you.
Question for Mr. Stanley Lee. Thank you, President. Facing extreme weather, the government has been continuously strengthening its overall capability to respond to extreme weather through enhanced measures in four aspects. In recent years, there was severe flooding and landslides in many parts of Hong Kong under extreme and adverse weather conditions. Is this connection with the government informed this council, one, of the rainfall patterns in Hong Kong in the past 5 years, whether it has assessed if the design standards of the stormwater drainage systems in Hong Kong are sufficient to cope with extreme and adverse weather conditions in the future, and how the stormwater drainage systems can be upgraded to improve the flooding situation. Two, whether the government has assessed if the rise in sea level will affect the effectiveness of the stormwater drainage systems in Hong Kong, and how the government will solve the problem of coastal and low-lying areas being vulnerable to flooding and sea water intrusion or rainwater backflow under extreme and adverse weather conditions. And three, given that many districts were hard hit by flooding and landslides under extreme and adverse weather conditions, such as Chow Hua Hang and Marina Cove in Sai Kung, the outdoor car park outside Lohas Park, as well as Wan Choi Road in Taiwan, of the government's plans to improve the relevant infrastructure facilities and cope with emergencies. Secretary for Development. President, In the face of extreme weather, the government has been continuously strengthening its overall capability to respond to extreme weather through enhanced measures in 4 aspects, including advanced emergency preparedness, enhanced early warning, decisive emergency response, and speedy recovery. In response to each part of the question, my reply is as follows. 1. According to information provided by the Environment and Ecology Bureau and the Hong Kong Observatory, the annual rainfall recorded in the Hong Kong Observatory headquarters in the past 5 years ranged from about 2,200 millimeters to more than 2,700 meters, with detailed figures set out in the table. Against the background of global warming, there is an increasing trend in Hong Kong's annual rainfall over a longer period, and extreme rainfall events have become more frequent. Taking the hourly rainfall recorded at the Hong Kong Observatory headquarters as an example, a record-breaking hourly rainfall of 158.1 millimeters was recorded in September last year, breaking the previous record in 2008. In the past, record-breaking events of hourly rainfall used to occur once every few decades. However, the occurrence of these events have become more frequent in recent decades. Hong Kong's flood protection standards, including the design return period of 200 years for trunk drains, are on par with that of major cities in the mainland and overseas, including Beijing, Shanghai, Shenzhen, Singapore, Tokyo, London, Copenhagen, and Amsterdam. To cope with the impact of extreme rainstorms, the Drainage Services Department, DSD, made reference to the 6 assessment reports published by the Intergovernmental Panel on Climate Change, IPCC, of the United Nations and the results of its relevant studies, and updated the Stormwater Drainage Manual, SDM, in 2022. DSD also considered the heavy rainstorm that took place in Hong Kong last year. After the update, if we take the return period of 200 years as an example, the hourly design rainfall parameter has been increased from 145 millimeters to 155 millimeters. And then we consider design the new facilities. We will also have regard to the IPCC assessment report to make sure that our drainage capacity for newly built drainage systems can cope with sea level rise and increase in rainfall up to the mid-21st century. The DSD is currently taking forward 11 major drainage improvement works, and it is projects, and it is anticipated these projects will be completed progressively from 2024 to 2030 in batches. Subject to the funding approval from the Finance Committee of this Council, another 7 drainage improvement works will commence this year. The DSD is also conducting a study to further assess the impact of climate change on our stormwater drainage systems to the end of the century to formulate a long-term integrated flood management strategy. The study is expected to be completed in the 4th quarter of this year. 2. In response to sea level rise and storm surges caused by climate change, the Civil Engineering and Development Department, CEDD, completed a coastal hazard study in the end of 2021. The study identified 26 coastal, low-lying or windy residential areas with high risks for formulation of improvement works and management measures. All the improvement works will be progressively taken forward and are expected to be completed by 2027. In the long term, CEDD is also commenced a study on shoreline management plan, with an aim to providing guidelines on planning and implementing urban coastal development and protection measures so that long-term strategies and preventive measures can be formulated. The study is again expected to be completed in the 4th quarter of this year. 3. It is a consensus amongst the international communities that it is impossible to pursue infrastructure facilities that can completely eliminate flooding, as setting such an excessively high standard is neither practical nor cost-effective. The government continues to implement drainage improvement works and coastal improvement works across the territory. At the same time, it will adopt appropriate emergency response and management measures to deal with the challenges. The SD will keep in close liaison with the Hong Kong Observatory and make advanced arrangements and preparations. When a severe rainstorm is forecasted, DSD will plan in advance and deploy emergency teams early to inspect around 220 locations prone to flooding and clear the blocked drains to reduce flooding risk. The ASD will also review the causes of each flooding case and implement mitigation measures through minor improvement works in district areas. Now, the question mentioned a number of locations, taking them as examples. The minor drainage improvement works at Wan Choi Road in Taiwan have been completed. The minor improvement works to the outdoor car park opposite to Lohas Park will be completed in the third quarter of this year. The Sai Kung District Lands Office and the Home Affairs Department are now following up on drainage improvement works near Choi Wo Hang and Marina Cove in Sai Kung. This is providing technical support. In relation to landslides, we require government departments responsible for the maintenance of over 6,000 man-made slopes to conduct routine inspection and maintenance annually. Every 5 years, there must be inspection by engineers. On top of the regular inspection in response to extreme weather brought by climate change, we've also identified around 500 government man-made slopes adjacent to slow access to community or important livelihood facilities. The relevant departments are required to carry out a complete special inspection before the rainy seasons. Thank you. Mr. Stanley Lee. I see that the Bureau has done much. And they also other plans to be carried out, but then that may not address the immediate risk. Recently, in May, Chankaru recorded 390 millimeters of rainfall per hour. That's again a new record. So I'm worried that your plans cannot keep up with the latest developments. Now, there is a smart sewage monitoring scheme. Sensors are installed in manholes to monitor the change of the water level or the sewage level. Now, in the past few months, we've seen much rainfall. So how can this sensor scheme help technical staff or engineering staff to carry out emergency works? Secretary. Well, as the member pointed out, infrastructure facilities alone cannot cope with could not eliminate all flooding risks. That's why early warning systems and follow-up actions are important. Now, Chankado was cited as an example. A few months ago, after the extremely heavy rainfall, when we receive notice of flooding, until we're able to control the situation, usually it just takes 1 or 2 hours. So DSD is given early warning, and then it will deploy staff to the vicinity of the location. And so they will deploy the emergency team at an early stage to first clear the relevant drains. And then after the rainfall, DSC will still carry out a routine in monitoring using technology. So with the use of technology, we have more monitoring spots. There are over 300 in Hong Kong now. Still, DSD will continue with this R&D effort. Soon in Yuen Long and Tsim Sha Tsui, DSD will be trying out real-time AI monitoring devices. This is experiment, and with AI monitoring and quicker clearing of drains, hopefully, then the measures will help, and we will be deploying more technological solutions. Mr. Chen Yip-ming, while New Territories North is prone to flooding, there are various road and drainage projects. Hopefully, that will reduce the flooding risk. Still, the risk remain. So, and then the progress of different projects varies. In Ta Kwu Lane and Altame, then some of the drainage improvement works are not being carried out on schedule. So I think there's need to speed up progress. So will the government consider giving priority to drainage projects in the New Territories North? Then we could address the flooding problems properly. Secretary. Yes, near Northern Metropolis area, we are doing land planning, that includes Taku Lane and so on. The relevant plans will be announced in this year. Now, when we learn about the future land uses, then we will, of course, provide suitable drainage facilities. Of course, we're not going to wait till the planning is done and then we just sit on our hands for the time being. Now, we've been seeking funding from the Finance Committee. Last year, after the heavy rainstorms, we carried out minor improvement works. Quite a number of these projects are in areas covered by the Northern Metropolis strategy. So, for newly planned areas and existing areas, we are still carrying out drainage improvement works in tandem, and we'll press on with our effort. Dr. Loy Kwok. The Secretary mentioned landslides, and there are 60,000 government man-made slopes, so departments are required to carry out a routine inspection and maintenance every year. And in the light of extreme weather, another 500 government man-made slopes have been identified, and the departments are required to carry out inspection before the rainy season. Now, in the reply, there's no mention of natural slopes. I understand CDDs also carry out works on natural slopes, because with natural slopes, they also have landslide risks. And then that will affect residential areas, roads, and other facilities. So I'd like to know what the concrete measures are. Secretary. CEDD has a standing slope maintenance program. There are resources deployed each year. Now, our focus, of course, is on the man-made slopes. Still, every year, the department will take the initiative to identify natural slopes. If my memory serves me right, I think it's about 100 or so natural slopes. If I'm wrong, I will supply the correct figures later. Anyway, they will do assessment on these slopes every year. The man-made slopes means slopes that we have altered. Now, Hong Kong has a hilly terrain. So apart from man-made slopes, all the other slopes are, of course, natural slopes. Natural slopes have certain resilience against the elements because they've not been interfered with. So how do we choose natural slopes for assessment? We'll first look at whether the natural slopes are close to, say, major roads or facilities. If that's not the case, usually we will not disturb the natural slopes. But as I mentioned, CDD will identify a certain number of natural slopes for assessment and follow-up. Mr. Stanley Lee. In the eastern part of the Hong Kong Islands, the department carried out flood prevention works. But then in Taiwan, that is that eastern Hong Kong Island, is always overlooked. The Wan Chui Estate, the Ling Street underground car park, and then there are low-lying areas there too. There is need for communication and supervision mechanism. There's need to, say, install the devices to prevent seawater infusion. But then the department seems reluctant to deal with such issues in these areas. And then in Taiwan, there is actually space for a flood storage tank. For example, in Taiwan, there's a 7.13 hectares of underground space. that could be used for storm water tank. So why are you overlooking the needs of Taiwan? Now, I don't have all the information about all the measures in Taiwan. Actually, there are 7 projects, and we're going to seek funding from the Finance Committee, and that includes projects that will improve drainage in eastern part of Hong Kong Islands. And for minor improvement works, as I mentioned, when we reply that the works covered Taiwan. Now, if there is need to build a stormwater tank in Taiwan, I understand is in the next phase of our plan, and we are conducting studies on that project. Mr. Kingsley Wong. Thank you. Now, in old districts, we would think they have a lower risk of flooding, but then last year in To Kwa Wan there was serious flooding. Now there are more people moving to To Kwa Wan then, so there may be a need for larger capacity drainage systems. So, in say To Kwa Wan, have you considered the change of the population size? Will you do something about the drainage systems there so there won't be flooding again? Secretary. Now, as we plan drainage works, we will definitely have regard to the demographic changes in a particular area. In old districts such as To Kwa Wan, definitely demographic change is a factor we'll consider, because in these old districts there will be redevelopment, so we must take that opportunity to upgrade the drainage systems. Without redevelopment, if you want to add new facilities, there will be constraints in old districts. So whether we are building more drains and whether we're talking about facilities along the coast, we will seize the opportunities of redevelopment. Maybe with redevelopment, then we could set the development back, so there could be a promenade along the coast that serves as a buffer. Recently, there's mention of the Harbour Protection Ordinance. We are trying to see if there's room for relaxation. Maybe some minor projects. It's not possible to set back the development, inspect, and then we may be able to extend the coastline, and so that may require minor reclamation works. So that's why if we amend the Harbour Protection Ordinance, that may help us to take forward these projects. Thank you. Mr. Dominic Lee. President, last year there was serious flooding because of extremely heavy rainstorm. I and my other colleagues of the New People's Party who went to Sha Tin Wai to help with clearing up the debris and so on. We find that actually there's flooding because the drain outlet was blocked by leaves. So we just needed to remove the leaves, and then the drains will work fine. So will you have any measures to monitor the situation? So if you come across similar cases like this, then you could mobilize your colleagues or the community care teams to go and clear the drains as soon as possible. But the important one is how you monitor the situation so you become aware of such a blockage. Secretary, well, Ms. Lee is absolutely right. When there's rain, then slud and some sand grits or leaves may be washed to and block the drains. So we need to clear the drains before rainfall and afterwards. And so in the past, it's the Highways Department and the Food and Environmental Hygiene Department that will clear drains in the regular cleaning exercises. But then, because of recent experience, DSD will deploy additional teams as long as there is early warning about a rainstorm, and immediately after rainstorm, the DSD will deploy the emergency response teams to these locations, which are originally the responsibility of other departments. And also, we've identified about 200 flood-prone locations, and the DSD will immediately clear the drains there. So the Highways Department has prepared the list, and we know which are the flood-prone locations. DSD and Highways Department have also taken certain measures on the deployment of manpower. Of course, community care teams and the residents could help too, but then here we're talking about clearing drains, and we want our community care teams to focus on services for the people. So that's why the relevant government departments should take up the responsibility. But if we are not able to manage that, then we'll ask the care teams to help us. Thank you.
多謝主席。
Question 5, Mr. Stephen Ho. It has been reported that the frequent occurrence of extreme weather conditions in recent years has caused severe flooding problems in rural areas, and a pig farm in Takuning was even hit by flooding twice in 3 years, resulting in heavy losses. I've learned that one of the main causes of flooding in some rural areas last year was illegal landfilling of watercourses and the laying of drainage channels on top of certain landfilling locations by the government. As a solution to the problem has led to a much lower drainage capacity of the watercourses concerned than the original design, rendering them unable to withstand extreme weather conditions and hence the frequent flooding. In this connection, will the government inform this council, 1, of the monthly numbers of flooding reports in rural areas and residents' expression of views received by the Drainage Services Department in the past 5 years, with a breakdown by the 18 districts across the territory, whether it has reviewed if there is a need to update the flood protection standards for the drainage systems in rural area. 2, of the monthly number of complaints about illegal landfilling of watercourses in the 18 districts across the territory received by the authorities in the past 5 years, and the specific handling approach of such cases, including the average expenditure incurred in each case, and the parties responsible for the cost, whether it will review the recovery plans for such cases to ensure that the drainage capacity of the watercourses concerned is restored to the original level, and 3, of the number of instances where rural areas were hit by a once-in-a-century torrential rain or flooding in the past 5 years, the government's respective improvement measures in the 4 areas of planning and design of drainage facilities, disaster alert, emergency response capabilities, and disaster protection mechanisms so as to ensure that the rural areas can cope with the rising trend of extreme weather conditions. Thank you, President. Secretary for Development. President, regarding each part of the question, my reply is as follows. In the past 5 years, that are from 2019 to June 2024, the Drainage Services Department, DSD, received 150 flooding reports in rural areas. The monthly flooding report figures by district are provided in an appendix. The flood protection standards of main drainage channels in rural areas are generally based on a 50-year return period for design. The relative low population density and less economic and commercial activities in rural areas, striking a balance between the flooding risk involved and the corresponding social costs were considered. The drainage design standards for rural areas is similar to those adopted in other advanced cities. The DSD made reference to the 6th assessment report published by the Intergovernmental Panel on Climate Change, IPCC of the United Nations, and the results of its relevant studies, and had updated the Stormwater Design Drainage Manual, SDM, in 2022. In response to the heavy rainstorm in September 2023, the DSD further updated the design rainfall parameters for 50-year return periods from 128 mm per hour to 138 mm per hour in the SDM in March 2024 in order to enhance the design drainage capacity of new stormwater drainage systems in rural areas. On the other hand, the DSD is conducting a strategic planning study on flood management for coping sea level rise and extreme rainfall to assess the impact of climate change on Hong Kong's stormwater drainage systems till the end of the century so as to formulate a long-term integrated flood management strategy. It is anticipated that the study will be completed in the 4th quarter this year. 2. In the past 5 years, the DSD received a total of 39 cases of suspected illegal landfilling in watercourses, and had carried out an investigation and follow-up action on these cases. Reinstatement works at the watercourses for 6 cases that posed a higher potential flooding risk were completed. The remaining 33 cases were referred to the relevant departments for follow-up actions. For those illegal landfilling cases, the government would charge the relevant cost of watercourse reinstatement works to the persons concerned with the illegal landfilling works. 3. In the past 5 years, there were 2 rainstorms in the rural area with rainfall intensities larger than that of a 100-year return period. The DSD has been adopting various strategies to upgrade the flood protection ability of the stormwater drainage systems. The flood prevention works in rural area mainly involve river training works and village flood protection scheme. Over some 30 years in the past, the DSD completed a total length of over 100 kilometers river training works in rural areas and implemented village flood protection schemes for 27 low-lying villages. Upon the completion of the above drainage improvement works, widespread flooding situation in the relevant areas has been significantly reduced. In response to the new land planning and developments, the DSD has conducted the Drainage Master Plan review studies for the rural areas in phases and formulated and progressively commenced relevant drainage improvement works. Currently, 3 drainage improvement works in North District and Yuen Long are in progress. In addition, the 2 drainage improvement works in Taipo, Sha Tin, and Sai Kung districts are targeted for commencement in 2024 after attaining the funding approval from the Finance Committee. Upon completion, the risk of flooding in the relevant rural areas will be greatly reduced. In addition, the DSD keeps close liaison with the Hong Kong Observatory for areas where flooding is anticipated to be caused by heavy rainstorm. The DSD will early deploy emergency teams to inspect about 220 flood-prone locations and clear blocked drains. Of these locations, more than half are in rural areas. The DSD also proactively applied innovative technology by making use of approximately 320 remote flood control devices to collect rainfall, tidal level, and water level data for real-time monitoring to ascertain whether the water level would exceed the alert in order to take appropriate contingency measures in a timely manner, and if necessary, to notify relevant departments to prepare for rescue operation, evacuate residents, and operate temporary shelters. The department plans to conduct trial on artificial intelligence flood monitoring system in Yuen Long this year, analyzing real-time street footage to assist early detection and response to flooding incidents. In addition, the DSD has increased the number of emergency response teams and emergency support stations covering 18 districts to support the operation of the emergency response teams. The Development Bureau would integrate and allocate the contractors' resources in various public works departments, including labors, machines, and equipment, to ensure that sufficient resources could be flexibly deployed during emergency situations. Thank you, President. Mr. Stephen Ho. Thank you, President. According to the reply given by the administration, it is said that in the past 5 years, there were 2 rainstorms in the rural areas with rainfall intensities larger than that of a 100-year return period. However, for the peak storm in Yuen Long, it was flooded 2 times. The problem is that there are some land filling in the new territories. The government gave us some figures in reply to my questions. I asked how much the government spent to reinstate filled watercourses. However, the government does not reply to my question in their paper. Perhaps because the figures is not ideal, that is why they are not giving us the figures. I know that the violators were only fined some tens of thousands of dollars. Is it because the penalty is too light that is why the illegal landfillers continue to fill watercourses illegally? If the penalty is so light, well, I think that the administration should review their investigation or power or capabilities. Secretary, President, because of limited time, we are unable to summarize all the cases and give the member the figures. When we have collected all the data, I'm more than happy to share with the members the figures. Regarding illegal landfilling, well, New Territories spans across a large area. It's difficult for us to detect all illegal landfilling cases. For example, Planning's department, when they receive complaints of illegal landfilling, they will take enforcement action. For Lands Department, if illegal landfilling involves government site or a breach of leases of New Territories exempted houses, then they will also take action. As to whether or not we can enhance our monitoring, well, for the Lands Department, they have made use of drones to capture images to make comparisons. Can we make use of technology, for example, by installing CCTV near the watercourses? These are the measures that we will consider. I think that this will need the collaborative efforts of different departments. Next, Mr. Gary Chan. Thank you, President. The Secretary said that in Taipo Shatin Saikong, they will be installing a large-scale drainage system. However, for small villages, they need a small drainage to connect their system to the large trunk drains. They install such pipes and drainage through the HAD minor works scheme. It's difficult for the stormwater in the village to be discharged. For Tongqi village, Santikok village, that I have contact with very regularly, they face the same problems. Can the Development Bureau talk to the Home Affairs Department so that they can increase the subsidy that they have for the villages? Secretary, thank you. We will not just look at new development areas. When we need to enhance the drainage system in small villages, actually, the Home Affairs Department work with the DSD. If there are certain works that cannot be carried out by HAD because of technology or high expenditure involved, the DSD would provide assistance. There is a certain level of divisions of duties between the HAD and DSD. They still collaborate. We will talk to the HAD to see how we can reinforce communication. As we are developing new development areas, NDAs in new territories, we have actually improved the drainage system in the entire new territories, because when we are constructing infrastructures in the new territories to develop NDAs, we'll see if we can improve the infrastructure in the vicinity to create synergy. So we conduct minor and major improvement works in parallel. Thank you. Mrs. Regina Ip. President, I pressed by mistake. I was going to ask during question 6 session. Ms. Chen Yutming. The administration did not talk about the short and mid-term mitigation strategy for new territories. There is not enough infrastructure in the new territories. That is why when there is a prolonged rainstorm, the low-lying farms will sustain flooding. Every time when there's floods, the DSD arrange sandbags and ask their staff to pump the stormwater away. However, all these are mid-term or short-term measures. With the development of NDA, the government may improve some of the infrastructures in new territories, but I hope that the administration will allocate more resources to minimize the loss caused to the new territories' residents. Well, Secretary, thank you. We are conducting various drainage improvement works in the new territories. However, as I've mentioned, we have to keep working on it, and it's a progressive kind of work. If Ms. Chen identifies any flood-prone areas in the new territories, please refer them to the DSD. In recent years, in North District, I know that there are certain pig farms that were flooded. After that, DSD proposed improvement works to the drainage system near the farm. We sometimes also implement measures that are effective. We adopt short-term measures in parallel with large-scale improvement works. We have a list of locations that are flood-prone, and most of them are in new territories. Before the Hong Kong Observatory announced the rainstorm that is upcoming, the DSD, whenever they receive information, they immediately send their response team to the location. Thank you, President. Mr. Holden Chow. Thank you, President. According to the administration's reply, it is said that the administration has done much to improve the drainage system. It is said that the administration will conduct trial on AI flooding monitoring system in Yuen Long. I wonder how effective the system is. Can you share with us other places' experience in making use of such systems? Secretary. Thank you, President. Regarding this AI flood monitoring system that is used to analyze flooding situation, well, we have only adopted such technology in Yuen Long and Tsim Sha Tsui. There are other countries and places of the in the world that have adopted similar system. However, different cities have different density. The system will analyze real-time street footage, and if they capture some water seeping on the street, then they will predict in how many hours flooding would happen. Different districts have different density of buildings and layout of roads. That is why we have to conduct trials. However, there are still success cases for us to make reference from. We will conduct trials in Yuen Long and Tsim Sha Tsui first. Ms. Nixie Lam, thank you. I know that greening of city will be able to solve the flooding issue. So it seems that urban greening is not completely relevant to the work of your department. So how do you work with other departments and bureaus on urban greening? Secretary. Regarding urban carbon reduction, that's the duties of the Environment and Ecology Bureau. But as to how urban greening and urban planning design will help alleviate the flooding problem, that's the work of our bureau. in open space and other leisure activities, we have increased the design rainfall parameters. That is why you see that on the rooftop of the leisure facilities, there are greening features that absorb water. Also, we revitalize some of the rivers so that it can help us discharge water. For places in new territories without a river, sometimes we create a man-made river in order for us to discharge stormwater and to beautify the area. This is the work of our bureau. But as for setting standards of carbon reduction, we work on that with the EEB. Dr. Lo Wai Kwok. Thank you, President. I noticed that some people are criticize that the reason why there is flooding is because the natural river has been altered. However, I would like to point out that by having natural river, it does not mean that we can discharge the stormwater in a natural kind of way. So how do we maintain the natural environment while enhancing our flood prevention capabilities? Well, I have some questions. In the northern metropolis, there are IT sites and residential areas as well as rural areas. So in terms of design, have we incorporated any green and smart elements for us to create a place that is work-friendly and are suitable for people to stay in, and that is also resilient to extreme weather events? Do we have enough resources to achieve this goal? Are we forward-looking enough? Secretary. Thank you, President. When we plan for NDAs, we will try to incorporate the smart elements as mentioned by the member. Say, for Sentin Technopole and Hongshui Q NDAs, the members sometimes ask we only make use of 1/5 of the land to develop residential or commercial sites. We often answer the members by saying that we have to offer open space and river as well as infrastructures. The reason why we have to offer such facilities is that we don't want to just build buildings. We need to provide for such facilities. Apart from, well, for natural river, sometimes we have to train it, we have to clean it and desilt it. Thank you.
Last question seeking the oral reply, Mr. Frankie Yik. The government has introduced a taxi fleet regime with no more than 5 taxi fleet licenses intended to be issued. There are views that with a total of 15 applications for the licenses received by the Transport Department, it is clearly an indication of the industry's eagerness to enhance the quality of taxi services through a fleet-based operating model. In this connection, will the government inform this council, as some members of the industry have pointed out that even with the issuance of 5 licenses by the government, the number of taxis participating in the taxi fleets would merely account for 20% of the total number of taxis in Hong Kong at most, whether the government would consider increasing the number of licenses in view of the industry's overwhelming response to the licenses, if so, of the details. If not, whether the government would consider relaxing the cap on the fleet size to enable more taxis to join the fleets and facilitate the scalable operation of the fleets, if so, of the details, if not, the reasons for that. Secretary for Transport and Logistics. Mr. President, the government earlier reviewed the overall operation and management of taxis and introduced a series of measures to enhance the quality of taxi service and promote the healthy development of the trade in the long run. Such measures include the introduction of a taxi fleet regime. The taxi fleet regime is a new regulatory regime under which operators may assemble existing taxis to form fleets and apply to the Transport Department for a taxi fleet license. The Transport Department will regulate the operation and management of taxi fleets and specify the devices that are required to be installed on the fleet taxis through license conditions. These include specifying requirements in relation to fleet size, age of vehicles, services to be provided by fleet licensees, such as the provision of online booking channels and e-payment means, as well as the installation of CCTV systems and technological devices that enhance driving safety in the compartments of the fleet taxis. In addition, the taxis must not be more than 3 years old when they join the fleets, nor more than 10 years old throughout the license period. We believe that the set requirements will be conducive to ensuring the service quality of taxi fleets, thereby providing passengers with better booking and traveling experiences. Following the passage of the legislative amendments in relation to the introduction of taxi fleet regime by the LegCo last December, the Transport Department commenced the preparatory work immediately and invited applications for taxi fleet license in mid-April this year. The Transport Department received a total of 15 applications when the application period ended in late May, reflecting a positive response from the trade. The applicants come from a diverse background with members of other transport sectors in addition to the taxi trade. An assessment panel formed by representatives from the Transport and Logistics Bureau and the Transport Department is assessing the applications received in accordance with the marking scheme. The application results are expected to be announced within this month. With regard to the question raised by Mr. Frankie Yik, I hereby reply as follows. As I've just mentioned, the taxi fleet regime is a new regime, and it is an important step to foster the improvement of the taxi trade. The government aims at setting a good example of taxi fleet management through the introduction of this regulatory regime. By playing an exemplary and leading role in the trade, the taxi fleets will help enhance the overall taxi service quality and image, as well as boost passengers' confidence in the taxi services, thereby gradually improving the development prospect for the trade. To achieve this vision, we believe that a more prudent strategy should be adopted in the initial stage of introducing the regime. Licenses shall only be granted to those excellent operators showing a high level of commitment and competence in fleet operations, so as to ensure the operation quality of the first batch of taxi fleets, with which the taxi fleet regime will get off to a good start. Therefore, when inviting the trade to apply for taxi fleet licenses, we have stated that no more than 5 licenses will be issued under this exercise. Upon commencement of the taxi fleet services, the Transport Department will closely monitor the operations and service quality of the taxi fleets and conduct midterm appraisal of the performance of the fleet licensees. As regards whether more taxi fleet licenses are required to be issued in the future, the Transport Department will consider the market situation at the time, taking into account factors such as the demand for fleet taxi services from the public, the services provided by each taxi fleet, and the total number of fleet taxis. As for the fleet size, a mixed or urban taxi fleet is currently required to have 300 to 1,000 taxis, while a new territories taxi fleet shall have 100 to 350 taxis. The number of taxis under each taxi fleet will be prescribed in the license issued. If a fleet licensee wants to increase the number of taxis under its fleet, including expanding its fleet size beyond the current limit, that is to say 1,000 taxis for a mixed or urban fleet and 350 taxis for a new territories fleet, after being granted a taxi fleet license, it may apply to the Transport Department for license amendments. When processing the application, the Transport Department will consider such relevant factors, such as the market demand for fleet taxi services, the standard of the services provided by the taxi fleet, whether the fleet licensee will be able to give assurance of engaging enough taxi owners to join its fleet, and the licensee's plan of recruiting more fleet taxi drivers before deciding whether to grant an approval. Thank you. Mr. Frankie Yik. President, the Secretary already said no to the 2 questions I put to him. There won't be more than 5 taxi fleet licenses issued, and the number of taxis in a fleet will not go beyond the cap. Now, after licenses have been issued, if the fleet operator would like to increase the number of taxis under its fleet, the operator can apply for the increase. But there is no mentioning of when the applicant could file this application and how long it would take to process it. Secretary. Now, after we issue taxi fleet licenses, the operation will commence. By then, we will consider the quality of the taxi fleet services. And if such an application is made, we will also need to have regard to a number of factors, such as the market situation. At this point in time, we are not in position to confirm whether we will start taking applications of this nature 1 or 2 years on after commencement. There are many factors at play. For the drivers of fleet taxis, they would need to adjust to the new mode of operation as well. We need to give flexibility to the operators to make adjustments and for them to assess their own performance. At this point, I'm afraid I cannot give a time frame. Dr. Su Chongming, the government once mentioned that there is a marking scheme on vetting license applications, such as the quality of management, the quality of service, as well as the quality of taxi drivers. However, these are hypothetical, as at this point no fleet has been formed. There is no track record to follow. The government could only make reference to the tender submitted by bidders. Now the applications received have shown that there is an oversubscription of 2.5 times. How do you ensure that a level playing field can be provided? Secretary. At the time of inviting interested operators to apply for a license, we set out a number of criteria. In fact, there are 6 of them. Management capability, safety and quality of the taxis, the relevant devices, management and quality of taxi drivers, customer service, arrangements in relation to pre-booking trips, as well as the day-to-day operation, no matters. These are the 6 criteria we will adopt in the marking scheme. And the applicants are free to propose other ideas on top of the 6 criteria mentioned in the application form. An assessment panel has been formed. This panel will give out scores in relation to the criteria in the marking scheme and other proposals floated by the applicant. In fact, we do have fleets currently providing services, not only that they are not the taxi fleets to be included in the taxi fleet regime. So, in the future, the applicants are free to come up with ideas of how the fleet should be run, and that these ideas will be translated into the terms and conditions in the agreements to be signed with the government. So everything is very clear. Mr. Andrew Lam.
Secretary answered the follow-up question of Mr. Frankie Yik, and according to his response, the government will keep an eye on the performance of the fleet operators, but there is no timetable at this moment as to whether more such licenses will be issued. My understanding is that the taxi fleet is just part of the taxi trade, and the number of taxis in the fleets account for only a very low percentage. In fact, after World War II, there is this theory. If we only look at the performance of the fleet taxi drivers under this survivorship bias, we are only looking at the situation regarding fleet taxis, but not the overall situation of the taxi trade. Now, if the government only monitors the performance of the taxi fleets in deciding whether to grant more fleet licenses, I don't think this is a comprehensive approach. Secretary. I note Mr. Andrew Lam's comment. Now we are going to grant up to 5 taxi fleet licenses. However, we are not just considering the quality of performance of the fleet taxis. Rather, we monitor the quality of the service provided by the trade as a whole. We need to consider an array of factors, including the market situation and demand for quality taxi service. All these factors are important. So I don't agree with the suggestion that the government is only considering the quality of service provided by the fleets covered by the 5 licenses. We also need to monitor the performance of taxis in general. In fact, I agree with the honourable member that we are granting licenses that could only cover up to 20 or 30% of all taxis in the trade. What is important is that we want to get off to a good start with the exemplary performance of the taxi fleets. We can then drive an overall improvement of the quality of service in the trade. That means our review also includes the performance of non-fleet taxis as well as fleet taxis. We don't just consider the quality of service of taxi fleets. We need to get the big picture when considering whether more licenses should be issued. We also need to consider applications relating to expansion of the fleet size, and these are the things we need to consider. Mr. Jimmy Ng, what is important in introducing the taxi fleet regime is to offer quality taxi service to the public. Apart from the marking scheme and the relevant criteria, will KPIs be drawn up for the government to consider whether the quality of fleet service is up to standard? If during the license period, after assessment, the operator is found to be not up to standard, is there a mechanism to revoke the taxi fleet license? Secretary. There is a very crucial point. Under the taxi fleet regime, quality service should be provided to passengers, and it is equally important for feedback to be received from passengers, be it a complaint or a word of appreciation. So in their proposal, we consider any suggestion on collecting passengers' feedback. This is important because passengers may have a say on the attitude of driver, the quality of service, the driving demeanor. A mechanism should be put in place to allow passengers to either rate the service or to give feedback. After granting taxi fleet licenses, we don't just sit on our hands and do nothing. We continue to request information from operators. We monitor how they handle complaints and collect feedback from passengers. For operators with substandard performance, we will engage in discussions with them on ways to improve their service. Now, if it comes to a state where the operator is unable to provide quality service and there is no sign of improvement, we do have this harsh measure of revoking the license. Now, after all, for taxi fleet operators, it is a capital-intensive investment for them. So we do have this mechanism in place to monitor the performance of operators and to make sure that they play an exemplary and leading role in the trade. Mr. Kwok Wai-Keung, the taxi fleet regime is an opportunity to revamp the trade in the long run. Only 5 licenses will be granted, but if the result is good, I'm sure that the government will issue even more taxi fleet licenses. As I understand, the Transport Department will closely monitor the performance of taxi fleet operators after introducing the regime. But I need to point out that the performance of the operators will definitely be affected by unregulated online ride-hailing platforms and the so-called white license plate vehicles. Will the government expedite the regulation of the online ride-hailing platforms and unauthorized white license vehicles to provide a favorable business environment for the taxi fleet operators? On regulating car or ride-hailing platforms, last week I also answered a similar question in the Council. On other occasions, I also responded to the same. Now, there are 2 objectives to regulating these platforms. We need to ensure the rights of passengers. We also need to ensure a healthy development of our trade. In terms of public transport, we top the global chart. So we need to consider, without compromising efficient public transportation service, how we could meet the public demand for personalized point-to-point transport service. At the same time, we need to support the healthy development of the taxi trade. These are things that we need to consider. So we will continue to take forward various initiatives. By around 2025, we should be able to drop a bill. This is the undertaking I can give to members. We will see to that as quickly as possible. Mrs. Regina Ip, President, the government is going to introduce a taxi fleet regime. Now, each fleet will comprise several hundred taxis. It will come with different functions, such as online booking system. I envisage that some foreign operators will be interested in operating a fleet in Hong Kong. If you also allow ride-hailing platforms to continue in the future, wouldn't it be a duplication? For taxi fleets, we do require an online booking system to be set up because this is, after all, the trend. At the same time, we are considering the regulation of ride-hailing platforms, as I've told Mr. Kwok Wai-keung just now. So how should that dovetail with the taxi fleet regime? This is exactly what we are going to consider.
Government bills. This Council resumes the second reading debate on the Nurses Registration Amendment Bill 2023. Dr. David Lam, Chairman of the Bills Committee on the bill, will first address the Council on the committee's report. Dr. David Lam. President, I table a report to the Council in my capacity as the Chairman of the Bills Committee. Hong Kong has an increasingly serious shortage of nurses. The Nurses Registration Amendment Bill 2023 seeks to tap on non-local sources to introduce nurses, including providing for new pathways, special registration, special enrollment, limited registration, and limited enrollment to address the pressing manpower crunch in the public healthcare and social welfare sectors. The Bills Committee held 5 meetings with the administration and invited professional bodies of nurses to express their views in one of the meetings. Members in general expressed support for the bill, but considered that the administration must devise a rigorous and effective mechanism to ensure that the nurses introduced will meet the service demand and are up to a certain professional standard. Members noted that a nurse with special registration or enrollment, having worked full-time for 5 years in a specified institution with performance to a satisfaction, is eligible for migration to full registration or enrollment without having to take the licensing examination. Members are of the view that relying on the appraisal of performance by the employing institution or the supervisor is inevitably subjective. Therefore, the administration must draw up assessment criteria that are clear, objective, and comprehensive. That includes the assessment criteria that include the qualifications, experience, and training of the appraisers for their compliance. The purpose is to make sure the assessment is fair and neutral. As the regulatory body of the nursing profession, the Nursing Council of Hong Kong has a final decision on applications for migration. The administration explains that the healthcare sector has all along been adopting work-based assessment and that the Nursing Council would draw up criteria of the contents of the assessment, including the assessment method and arrangements, and invite third-party healthcare professionals to review the assessment when necessary to ensure the nurses with special registration or enrollment are on a par with those with limited registration or enrollment. On a different note, members noted that it may not be appropriate to empower the Council to examine whether or not designated institutions can employ limited registration or limited enrollment nurses. The administration said that the Nursing Council would formulate a comprehensive mechanism to assess and approve the relevant applications. The Council may impose conditions on approved application for the admission of non-locally trained nurses with which employing institution must comply to ensure their professional standards. Aside from the above concerns, members expected that the workload of the Nursing Council will significantly increase upon the passage of the bill. They have urged the administration to provide sufficient resources for the Council in order to fill the manpower gap of nurses with non-locally trained nurses as soon as possible. Last but not least, when the administration attracts non-locally trained nurses to Hong Kong, members hope that local talents can be retained and that the employment opportunities of local nurses will be safeguarded. In light of the views of members and the legal advisor, the administration has proposed a number of amendments, including the composition of the Nursing Council, as well as textual and technical amendments to improve the bill. Members of the Bills Committee raised no objection to the amendments proposed by the administration. President, that concludes my report on the work of the Bills Committee, and I now turn to my personal views on the bill. I thank members who proactively offer their insights on the bill as well as the clause-by-clause scrutiny of the bill. I also thank the legal advisor for giving his or her insights. It shows the good collaboration between legislature and executive. I also thank the Secretariat for arranging for a number of meetings when the time was tight. In a public hearing, the sector was concerned about the professional level of special and limited registration or enrollment. They expressed concern about the level of nurses. The Nursing Council of Hong Kong has submitted a comprehensive framework. The chairperson of the Nursing Council of Hong Kong attended almost all meetings. I am immensely grateful. Hong Kong has a seriously shortage of nurses. The workload has been significant to frontline staff workers. The bill will attract non-locally trained nurses to Hong Kong. It also allows non-locally trained nurses to come to Hong Kong to register to work on a permanent basis. This is of great significance, and I express support for it. The dressing of wounds, injections, checking of vital signs, to make sure ECMO, as well as other complicated equipment, is operating safely. That is the responsibilities of nurses. Nurses also have other responsibilities such as working in triage station, resuscitation, management of wards, as well as other residential care homes. This shows that nurses have great responsibilities. Any mistake can lead to serious consequences or even fatalities of patients. That's why the level of nurses is of great importance. It's not just about whether we have sufficient nurses. Their quality matters. Having a work-based assessment is a good answer to the solution. We look forward to the details. I believe nursing schools are willing to provide assistance. The nursing profession is professional and has a human touch. Experienced nurses serve as role models. There's a high attrition rate recently, so the number of experienced nurses is on the low side. With the bill, we can attract non-locally trained nurses, but we cannot make light of the challenges facing frontline workers, or nurses, I mean. We need to retain talents as far as we can. And that's also my requirement, my demand. If the administration overlooks the challenges of nurses, a lot of nurses will be let down. Limited registration or enrollment nurses can work in residential care homes for the elderly and for the disabled. These are vulnerable patients. They are feeble. They don't communicate well. So the professional level of nurses, their attitude, experience, and communication, there are great requirements. The threshold is high. Non-locally trained nurses may not be used to the interpersonal communication skills in Hong Kong. There's also a lack of experienced nurses working in care homes. In case of any accidents, the Nursing Council of Hong Kong, does it have to be held accountable? I suggest that the administration make good use of general outpatient clinic, district health centers, public hospitals, to provide training as well as monitoring for limited registration or enrollment nurses. These institutions can even employ nurses, and these nurses can be stationed in these care homes. There are some 3,000 nurses graduating every year in Hong Kong. The number is not low, but then the attrition rate is high. Some nurses do not want to be confined to one single profession. We encourage nurses to add value to their profile. They can self-improve, but they cannot forget the reasons why they started. We also need to encourage young nurses to realize their potential and to narrow the gap with the modern society. We need to have policies that retain talents. Then we will see great results. I support the passage of the bill.
Dr. Chong Meng Kong, President. We have a severe shortage of manpower in the nursing profession. We can't cope with our current needs, not to mention the aging population, as well as the growing demand for services as a result of chronic diseases. For every 1,000 people in Hong Kong, we've only got 9.2 nurses. When compared with similar figures elsewhere, this isn't the lowest, but again, we fall behind other advanced economies. In Japan, per 1,000 population, they have got 12.1 nurses. New Zealand, 10.9. Canada, 10.3. And then for Singapore, which we like to compare ourselves with, their ratio is lower than ours, 7.8. But then the Singaporean government has already admitted non-locally trained nurses. In the year 2022, 1/4 of the registered nurses are non-locally trained. Today, we resume the second reading debate of the Nurses Registration Amendment Bill 2023. It seeks to provide for 2 new pathways to admit non-locally trained nurses. We have got limited registration and limited enrollment, as well as the special registration and special enrollment. In one pathway, we're able to meet with the imminent need. The other is to address the long-term needs. The administration would like to admit nurses that can fill the gaps in our public health setting. We want them to have clinical experience. We hope that they can, in the long term, join our profession. I think our locally trained nurses is not adequate to meet our long-term demands. And I think this is indeed a good move. We indeed badly need to import more nurses. And primary health care is being developed. We can't wait. We must open up new pathways to admit non-locally trained nurses. Last month, the administration told us about the healthcare manpower projection. I think it is quite true that unless we import non-locally trained nurses, otherwise we cannot address the problem. In the year 2050, we will still be lacking 9,500 general nurses. In the year 2030, we still lack 8,700. We lack 9,500 in the year 2025, and they need time to accumulate clinical experience. So we can't wait, and we hope that there will be more subsidized nurse training places. We should encourage more self-financing institutions to provide more places. But then we have a dwindling population. We must retain the talents, and we must admit experienced non-locally trained nurses before we can address the problem. Well, in the bill, it is said that we should have a schedule to list out the recognized non-locally trained nurses' qualifications. Of course, it goes towards enhancing the transparency so that we know the quality of the non-locally trained nurses. On the other hand, for non-locally trained nurses outside of Hong Kong can have an idea as to whether their qualifications can meet our requirements. Understand that such a proposal would need time to be sort of implemented. And sometimes we may not have time to be exhaustive, and then there may be omissions. And as a result of the fact that the hospital authority and the TMHK will be admitting 300 to 500 non-locally trained nurses, I'm afraid the number is small. And I hope that in the future, for each and every nurse admitted, we should be stringent in vetting their qualifications and eligibility so that everyone admitted will be professionally ethic and can be of help to us. And the Hong Kong Nursing Council will be mandating continuing professional development. In this way, we can safeguard the nursing standards of our professionals. I'm sure the Nursing Council will be the gatekeeper. Well, to be frank, from time to time, we've seen that in public hospitals, nurses are running out of breath when they are busy going around the wards. And then in residential care homes, some of the elderly residents are not able to get help even though they are badly in need of help. So it is high time for us to admit more non-locally trained nurses. This is all because the shortage of nurses is harming our overall public interest. We mustn't allow protectionism to obstruct the admission of non-locally trained nurses. Otherwise, the society has to pay the price for such an act of selfishness. I support the second reading of the Nurses Registration Amendment Bill 2023. Reverend Canon Kun, Deputy President, it is undeniable that we have a shortage of nurses. Just for the year 2023-24, over 6,000 people left the profession, and the attrition rate is about 10%. My colleague has mentioned other figures, which I'm not going to repeat. Deputy President, we are facing an aging population, and in our hospitals, in our residential care homes, we need more nurses. And then there will be new planning ratios for the residential care homes. There is a growing demand for nurses. I believe, Madam Deputy, Hong Kong is unique. It isn't that easy for us to compete for nurses. Nowhere else in the world would require nurses to be trilingual and biliterate. We may want to admit non-locally trained nurses, but then if we look around, the majority of our patients, more than 90% of them, are mainly Cantonese speakers. Even if we are able to admit nurses, what about the language barrier? Would nurses be able to communicate in Cantonese with the patients? And even if they can they use English to fill out the records and to communicate with others? So the more I think about it, the more I'm convinced that it won't be easy. I do welcome the bill, but does it mean that with the enactment of the bill, we'll be able to get a panacea and we can resolve everything? I don't think so, and I'm not that optimistic. Well, to be frank, even if we allow mainland nurses to be admitted, how many of them can speak in Cantonese? It is doubtful. When you go to mainland hospitals, even if you go to one in Guangdong, the common language used would be Putonghua. So I'm afraid in future, the number of nurses available would be questionable. Now, let me come back to the speech. I think it all boils down to boosting our local training nurses. In the past, my observation and my idea was that the nursing profession was well respected by the society. However, in the past few years, nurses were having heavy workload. Many young people would not want to join this highly respected profession. Deputy President, I will take this opportunity to express my gratitude towards all the nurses, irrespective of their positions, for their contribution to our society. In recent years, as far as the social status of our nurses, perhaps we haven't done much or not enough to enhance the status. Well, such nurses, day in, day out, are serving our patients and they meet our needs. We should enhance their status. The administration should also increase the number of places for enrolled nurses. Today, we see the results of the DSE being announced. Some students may not be able to be admitted to a university or get an offer appropriate for their circumstances. I would like to advise them to consider nursing. They would never have problems with job security. They would never be made redundant. For students with less than satisfactory performance could consider nursing because there is a clear promotional career ladder, and eventually enrolled nurses can become registered nurses. At the same time, we should consider deploying more information technology to overcome the language barrier because we demand nurses to be trilingual. Some of the non-locally trained nurses may not speak our languages, so maybe we can use information technology to allow Chinese being used to fill out the medical records, can this not be extended throughout our public healthcare system so that non-English speaking nurses can come and they're able to get adapted to our setting? So for the future development of the nursing profession, so I speak and I spoke in support of the second reading of the bill. Thank you.
Mr. Duncan Chiu. Thank you, Deputy President. I'm a member of the Hospital Authority. The reason for the bill is to introduce new pathways to attract and import non-locally trained nurses in order to plug the manpower gap in the social welfare sectors as well as the public healthcare sector. I support the amendment, and I also support training and retraining of the nurses in Hong Kong. We need to proactively explore how we can attract non-locally trained nurses to stay in Hong Kong to serve Hong Kong. These new nurses will help us with primary health care as well as the need in residential care homes. There's no dispute that we have a serious shortage of nurses. We only have 9.2 nurses per 1,000 population. We are lagging behind many developed countries. Non-locally trained nurses can take part in the licensing examination organized by the Nursing Council of Hong Kong to get the qualifications, but they need to pass the examination in order to be qualified, so the number of applications has been on the low side. This bill allows non-locally trained nurses who would like to come to Hong Kong to serve in Hong Kong without having to take licensing examination, including special registration or enrollment as well as limited registration or enrollment. They need to have the relevant practicing certificate. For applicants of special registration or enrollment, they need to have 3 years post-qualification full-time experience in clinics or hospitals. They also need to be of good character as well as good conduct. For special limited registration and enrollment, they need to fulfill continuing nursing education in order to renew their licenses or qualifications, after which they will be given a practicing certificate. In the fourth quarter of 2022, the Healthcare Manpower Exchange Scheme was launched. It's been a couple of months. 2 batches, a total of 180 healthcare professionals from Guangdong came to Hong Kong for exchange. I had an opportunity to have exchange with nurses in the hospital. They said that they would like to stay in Hong Kong to continue to work. I also spoke with the local nurses or the nursing officers who were responsible for training them. They said these nurses were very helpful. They're very professional. The language barrier mentioned by Reverend Peter Cohen was not considered to be a major barrier. That's exactly why they could settle into the nursing profession in Hong Kong very easily. This bill does not target the nurses who were on the exchange tour. So for this batch of nurses who have experience working in Hong Kong, they could not be imported into Hong Kong. It's pitiful, but I hope that the administration can follow up on this. For example, you can have a record of the 180 nurses who came to Hong Kong to work. You can see how many of them are willing to come to Hong Kong again. If they have stable career in the mainland, they may not be willing to come to Hong Kong again. With the record, we'll then in a position to know which nurses would like to come to Hong Kong to serve. We can be proactive and we can invite these nurses to come to Hong Kong. They are exactly the nurses that we want to import into Hong Kong. After the passage of the bill, these nurses who were on the exchange tour can be the first batch of nurses being introduced into Hong Kong. So I hope the Secretary can take on board my suggestion. In the Bills Committee, during the scrutiny of the bill, I asked the administration upon the passage of the bill for the qualifications and the continuing nursing education on the register of nurses. They need to be updated on a regular basis. It's very important. But I'm also concerned about the nursing system. Has it been made electronic for the uploading of documents, management of the register, as well as in the information archive? Is it managed well? The administration said that they are preparing for the register digitalization. They want to make it digital for the nursing register, so the members of the public can access the information on the register. This shows that we have the resolve to turn the register online, and this speaks to the determination of the government to improve the situation so a lot of people in the sector can help solve the problem. I believe it's not a very difficult task. I speak in support of the bill of the nursing registration amendment, the second reading and third reading. Thank you. Ms. Connie Lam. Thank you, Deputy President. I speak in support of the Nurses Registration Amendment Bill 2023. There are from time to time medical blunders in Hong Kong. The reason behind it's about the lack of healthcare manpower. When you go to public hospitals, nurses have a very busy life. They have a lot on their plate. They are overwhelmed by the amount of work they have. It's easy to have mistakes or blunders. The healthcare manpower projection announced last month announced that for general nurses, the shortage is the most serious. In the report, up to 2030, the shortage of general nurses would be as much as 9,500, accounting for 17.1%. The number will drop, but it's still on the high side. In 2045, the gap is still as wide as 4,200. So importing non-locally trained nurses can solve the pressing problem. Some nurses can also be arranged to work in residential care homes for the elderly, where we can also identify a shortage of nurses. If the catheter, if there's any problem with a catheter, then the patients will have to be sent to the A&E department. But the quality is close to the heart of many members of the public. Quite many citizens in Hong Kong asked me, in which hospitals will these nurses be arranged to work in? Are the standards on the same par with those in Hong Kong? But actually, the quality of nurses does vary. In Hong Kong, there are two standards. Mainland China, other places, what about the standards? The duration of study, contents of their clinical training, these may vary from one to another. So while devising a mechanism for introduction, we need to make sure that the quality of non-locally trained nurses is on the same par with those in Hong Kong. We cannot allow to have a decline in the quality of services. We cannot say that when we have sufficient nurses, we cannot guarantee the services. I'm glad to see the Nursing Council of Hong Kong will scrutinize after the training of nurses. Are the programs comparable to the programs or training programs in Hong Kong? After obtaining qualifications, they need to have at least 3-year post-qualification experience in clinics or hospitals full-time. Only then can they apply to come to Hong Kong on special registration or enrollment. This can help us select nurses that are of high quality. This can also boost the confidence of the public. Some worry that these nurses may not be able to speak Cantonese, so communication might be difficult. Well, I agree with that. So I think we need to set a probationary period as well as linguistic proficiency in interviews. We need to make sure there is continuing education. It's not the case that we don't believe in the Nursing Council in its gatekeeping function, but we need to have objective criteria. We also need to have examinations to make sure non-locally trained nurses have the knowledge required as well as the code of ethics required. Special registration or enrollment nurses need to have 5 years of experience before they're eligible for migration to full registration or full enrollment. It's not about whether Hong Kong is attractive enough. So I can see what drawbacks examinations will bring to the system. Well, nurses are the bedrock of the healthcare system in Hong Kong. Whether day-to-day care, dressing of wounds, or any public health issues, nurses are in the front line. They safeguard the public health as well as the health of patients. They are helpful partners of doctors, and they also safeguard the health of patients. In the coming 2 decades, there will also be a shortage of nurses, so the administration needs to have long-term policies to attract talents on the one hand, and on the other hand, attract non-locally trained nurses. We need to enhance the mechanism to attract high-caliber nurses from overseas to Hong Kong. We need to increase the number of nurses in Hong Kong. We also need to retain nurses, improve their working environment so that they can feel that they are respected in society. They can also feel the support by members of the public. I hope the Secretary will come to notice that there is a program for enrollment nurses. Can we increase the number of enrollment nurses places? It's exactly the day of the announcement of results for DSE. For those who have an interest to join the enrollment nursing profession, I hope they will join the profession so that there will be more quality enrollment nurses in Hong Kong. I so submit, Deputy President. Thank you. I speak in support of the Nurses Registration Amendment Bill. Thank you.
Mr. Chen Kim-Paul. Thank you, Deputy President. We have a chronic shortage of healthcare manpower. With an aging population, the demand for healthcare will simply grow, and that means ever greater pressure on healthcare professionals. I support this amendment bill, and that is the Nurses Registration Amendment Bill. This bill covers a few proposals, and they will help address the manpower situation at healthcare institutions and care homes. To ensure professional standards, non-locally trained nurses will need relevant qualifications broadly comparable to the recognized programs of the Nursing Council of Hong Kong. There is also a requirement about 1 to 3 years of post-qualification clinical experience before those nurses can come here. Those nurses also have to provide employment history. That will help the NCHK get a sense of the situation and roll out measures accordingly. LegCo's data from 2023 shows the wastage rate rose from 5.8% to 11% between 2021 to 2023, and that means a loss of 290 nurses. Now, to bring in more non-locally trained nurses, there are a few things the government has to do. First, better support measures. We need better rostering arrangements, greater flexibility for deployment, ensure enough rest time for workers so as not to undermine the quality of healthcare. We need a better work environment and better career development. Let's provide staff quarters for non-locally trained nurses. Give them a better living environment. Let's also explore international cooperation. We need nursing training programs to enhance the quality of our healthcare. That also helps enhance the skills of our nurses and broaden their global perspectives, and this can help enhance their experience. The latest healthcare manpower projection shows general nurses will see even more acute shortage. By 2025 and 2030, we will see a gap of thousands of nurses. Psychiatric nurses will see a shortage of 320 and a surplus of 60. Midwives will see a surplus of more than 1,000 people. This means, in planning our future training programs, let's put resources from training for psychiatric nurses and midwives to general nurses instead. Now, retaining the hospital authorities' nurses also matters. Let's reduce wastage. That's something the government has to think about. That's how we can ensure we don't have a nurse shortage. Mr. Benson Look. Madam Deputy, I support the Nurses Registration Amendment Bill 2023. I was a member of the Bills Committee. I took part in the deliberations of the bill. This bill proposes to create new pathways to bring in non-locally trained nurses, so that these nurses can work in public healthcare systems and in the social welfare sector. CNE, or continuing nursing education, will be mandated as a prerequisite for renewing practicing certificates. We have an acute nurse shortage. For every 1,000 people, we have just 9.2 nurses. That ratio is worse than other developed regions. In the recent years, the wastage rate has been rising in the public sector. From the Health Bureau, that is the manpower projection for healthcare sectors, the short to medium range shortage of nurses will worsen. General nurses will see ever-growing demand. There is also rising demand for public hospital services, and this worsens the shortage of nurses. When the new elderly care initiatives and rehabilitation services are in place, there will be even higher demand for nurses. In 2030, 2035, and 2040, general nurses will see a gap of 8,700, 6,900, and 6,000 nurses respectively. From the Nursing Council of Hong Kong, we know that we had 40,000 enrolled nurses and registered nurses in 2010, but in recent years that number rose to 69,000. Our local nursing sector has worked hard on this issue, but we're still falling short to meet the demand. So bringing in non-locally trained nurses is the way to go. In the long run, though, we still have to ramp up the number of local nursing training places. That's the fundamental solution. I am a long-time champion of stronger support for training local nurses. Career opportunities for local nursing students matters. At the Bills Committee's meetings, I asked the government about the supply of local nursing students and their career prospects. The Health Bureau said local supply of nursing graduates is tight. That's one of the reasons for this bill. Every year, we have 2,500 to 3,000 nursing graduates every year. That supply will go up in the years to come. We're bringing in outside help to ease the local nurse shortage. Meanwhile, we must ensure local training goes on, keeps up with the demand, and that our local healthcare sector will prioritize local nursing graduates in hiring. The nursing sector and nursing schools have told me every year many young people sign up for nursing programs. There are more applicants than places. Given the shortage of nursing training places, some dedicated young people cannot join the nursing profession. Today, the HKDSC exam results came out. I think this shortage will continue. Our aging population is set to worsen. We will need more and more nurses for hospitals and care homes. So, we should continue to increase the number of training places in nursing. On retaining nurses, I know the government has rolled out different initiatives. The Health Bureau told me nursing graduates in recent years opted for other positions than frontline nursing. They took up jobs in other healthcare positions instead. If this situation continues, the government should find out why those graduates decide not to join a frontline role. we should offer better pay and conditions to retain local nurses. We have to reduce the wastage rate. Madam Deputy, I support the bill. I so submit.
Mr. Lam Chun Sing. Thank you, Deputy President. When we look at the healthcare manpower projection, we can see that the nurse shortage is very acute. Our colleagues have already mentioned the figures. I won't repeat them. Therefore, I support the bill so as to create new pathways to admit non-locally trained nurses so as to maintain our healthcare services. I spoke upon the resumption of the second reading debate of the Dentist Registration Amendment Bill. If we are to admit non-locally trained healthcare professionals, we mustn't forget the impact on the local professionals. There has been a call to cap the number of non-locally trained nurses. The administration would not promise to do so. I hope that the administration would take our heed. That is, when we have got a sufficient number of non-locally trained nurses, then we should adjust the pace. For any policies that would import foreign labor, there's always a requirement. Say, for example, paying the market rent, or you have to prove recruitment difficulties. But then on this occasion, we haven't got any similar requirements. I won't query that we don't have a shortage of nurses, but then for RCH to recruit nurses in particular, or enrolled nurses, the wage to be paid would not be high. And then if they don't pay the market rate, then local nurses would easily be replaced by the foreign nurses. And if we don't regulate the agents or the intermediaries, then perhaps the intermediaries or the agents would exploit the non-locally trained nurses, and they will be regarded as cheap labor. I'm afraid this may happen in the setting of residential care homes. I hope that upon the enactment of the bill, there should be administrative requirements in place to avoid this from happening. Not too long ago, the media exposed the exaggeration of figures of nurses employed. They try to get nurses going around the residential care homes to meet the manpower requirements. I hope the enactment of the bill can remove this excuse from people not following the requirements. In fact, this is a statutory requirement, and we hope that by that we can enhance the service standards of the residential care homes. In the long term, I hope that there won't be any weakening of the efforts to train local people. Well, as far as JUPAS is concerned, for certain nursing programs, the competition is keen. 5 or 6 applicants would fight for a place. In other words, it doesn't mean that the nursing profession is not attractive. The government should look at the need to expand the teaching facilities, and there should be an increase in the number of subsidized places so as to meet the local demand. Moreover, the bill doesn't say that who can apply for special registration or temporary registration as well as enrollment. Therefore, even before the enactment of the bill, if qualified people have already arrived in Hong Kong before the enactment of the bill, they may also apply. In fact, there might have been some qualified nurses who have come here as new arrivals in the past few years. According to the existing requirements, they must take the licensing examination. Some of them are not able to pass the exam, or they haven't taken the exam, and they're not able to take up jobs as nurses. They can only become health workers in the residential care homes. With the enactment of the bill, as long as they have clinical experience and as long as they are employed by RCH, they can become limited enrollment nurses. Or if they are employed by the DOH, they can, or as well as the HA, they can become a nurse under the special registration or enrollment scheme. The government should collect the data they are eligible and they are Hong Kong residents, I think the HA or the DFH should be encouraged to give priority to such. The general public is of the view that the admission of non-locally trained nurses mustn't allow the standards to be eroded. So they're more concerned about the waiving of the licensing examination, and that employers must assess their performance and be satisfied that the performance is satisfactory. Now, they have to be fully employed. They must have full-time experience for no less than 5 years. And the HA and the DFH must be satisfied that they are up to the standard. And such, upon gathering the necessary number of years of experience, can migrate to become fully registered or fully enrolled nurses. So the employer organizations will be the gatekeeper. If this is properly carried out, it won't be that easy to pass the 5-year continuous assessment. It won't be easier than the licensing examination. I hope the employer institution will be objective in the assessment and be a gatekeeper for our health. I would suggest that there should be third-party assessors sent to the DFH as well as the HA so as to check the quality of the assessment so that the public confidence will be enhanced. Finally, the Bureau is duty-bound to come up with a proper mechanism to help the newly admitted nurses to adapt to the local setting. The HA all along has got the preceptorship program so that more experienced nurses can be mentors for the newly recruited nurses so that they can adapt to the setting. In the past, we got GBA healthcare professionals coming to Hong Kong on an exchange basis. In the future, there will be many more non-locally trained nurses than GBA nurses, so the scale must be larger and we must have a much larger preceptorship program to help them. And then for new nurses, I think we should provide workshops to allow the nurses to be more aware of the code of practice under the jurisdiction of the SWD so that all the nurses, whether locally or non-locally trained, they will be up to the same standards. So I spoke in support of the bill. Professor Chen Ming-Kwong. Madam Deputy, I speak in support of the Nurses Registration Amendment Bill 2023. The bill seeks to create new pathways to admit qualified non-locally trained nurses so as to address the acute manpower shortage in our healthcare sector as well as the welfare sector. This will be good for the public. Therefore, it has my support. Everybody knows that we have an acute shortage of nurses in Hong Kong. For every 1,000 persons, we've only got 9.2 nurses. The ratio is much lower than that in Canada and France, among other advanced economies. The administration has provided more training places to turn out more nurses, but then the supply is much lower than the demand. In accordance with the 2023 healthcare manpower projection, for the years 2030, 2035, 2040, the manpower gap would be 87, 69, and 60-100. It is really worrying if we don't admit enough nurses to address the gap, then I'm afraid that in future our public healthcare system as well as the residential care homes will be much affected. Objectively, the facts tell us that there's an urgent need and justification to admit non-locally trained nurses. Therefore, I support the idea to admit non-locally trained nurses. For such nurses, they can help us to deal with the severe shortage. At the same time, they can share the heavy workload of our local nurses. In this way, the local nurses will have less pressure and the overall standards of our healthcare service can be enhanced. It will be good for patients and it will be good for the sector as a whole. It is a win-win situation. But just like in the case of admission of non-locally trained dentists, I am not too optimistic about the outcome of the admission of non-locally trained nurses. Globally, there is a manpower shortage. Everywhere you see enhanced measures to attract nurses. In particular, they try to offer better terms and conditions of service. In fact, the National Health Commission on the 12th of May has said that they will try to provide more nurses, and they will try their best to provide better working conditions, and they will improve the shift taking of nurses. If you have ever been to a mainland healthcare organization, well, in fact, the nurses there have got very handsome pay as well as terms and conditions of salary, and they enjoy retirement benefits. But in Hong Kong, everybody knows that nurses have heavy workload, and it is a difficult job, and some people would regard it as an offensive or obnoxious duty. And I think during an interview, it is said that the HA will go to Singapore and Malaysia to start recruitment exercises, hoping that the Chinese-speaking nurses can easily come to Hong Kong and be able to liaise and communicate with our patients. I'm glad to see that language hasn't been forgotten by the authority. But then in February this year, Singaporean government tried to retain the nurses. For the Singaporean nurses, if they stay there for long enough, they will get 100,000 Singaporean dollars as a bonus. You can see that all around the world, everyone is trying to train more nurses and retain the nurses. For us to succeed in poaching the nurses from elsewhere, it won't be easy. So please make good use of our salary advantage. Publicize our advantages. Do your utmost, do your best to recruit as many nurses to come to Hong Kong as possible. And the Hong Kong nurses should be given better pay so that we can reduce the attrition rate and we can keep the available and precious manpower. According to the Census and Statistics Department, in the year 2046, for the population above the age of 65, there will be more than 36% of us. In other words, 1 out of 3 of us will be an elderly person. So you can see that be it a RCH or the healthcare setting, there will be an ever increasing demand for nurses. So the government should prepare for the rainy days, other than creating new pathways to admit non-locally trained nurses. We should take the initiative to see whether we have to set up a additional medical school or an additional nursing school so that we can resolve the problem at root. Madam Deputy, the bill also says that for special registration and special enrollment nurses, they can stay with their employer for 5 years, and if they are assessed to be of good character, good professional conduct, they don't have to take the licensing examination, and they can migrate to the status of full registration or full enrollment. I won't object to this because I'm confident in the regulator's gatekeeping role. And then a 5-year clinical experience will be as good as a licensing examination. There are doubts as to the assessor's subjective factor. I hope the Nursing Council can issue the guidelines soon so that the employers, organizations, and the assessors can have something to follow, and we can ease the public concern. The bill also says that continuous professional training should be a prerequisite for getting a certificate of practice. It will become mandatory. I think it's important, and it will be helpful in maintaining and even increasing or enhancing the standards of the nurses. I think the nursing regulator should move with the times, and so I also support all the amendments to be introduced by the administration to the bill. Upon the third reading of the bill, I hope the government will start the overseas recruitment as soon as possible so as to import sufficient number of nurses to meet the manpower gap and make sure that we have got enough manpower resources to maintain quality service in our healthcare sector as well as the welfare sector. So I spoke in support. Thank you.
多謝主席。
Mr. Chen Pui-Lang, thank you, Deputy President. Nurses are frontline workers in the public healthcare system. They play a very important role in communication with patients, but we have an acute shortage of Hong Kong. As at late 2022, there were a total of 16,000 nurses. Per 1,000 population, there were only 9.1 nurses. The ratio is lagging behind some advanced countries. In the latest healthcare profession, in 2050, general nurses, we will have a lack of 9,500 general nurses. There will also be a shortage of 4,200 nurses. There's a lack of nurses in the social welfare sector. Despite the multi-pronged approach to enhance nursing training, as well as the increase in the number of places in UGC-funded programs as well as self-financing programs, there were also an annual 1,700 fully sponsored places in relation to enroll nurses in the social welfare sector, but it's difficult to solve the manpower crunch we have right now. Through the licensing examination, these imported nurses can work in Hong Kong. For non-locally trained nurses, the number has been on the low side. The number of enrolled nurses, the number of registered nurses. So we don't have sufficient nurses to cope with the demand in the public healthcare sector. Nurses are under great pressure. The importation of non-locally trained nurses will yield good results. We have seen examples in the past. The Guangdong province sent nurses to Hong Kong to work with nurses in Hong Kong. They fight COVID-19 together. For the exchange scheme with Guangdong, it is expected that we will invite as many as 300 nurses to Hong Kong. The first batch has already completed the exchange. Some nurses in Hong Kong said that these nurses can share the workload and they can render services to patients. We have already introduced non-locally trained dentists as well as doctors to Hong Kong. Nurses should also be allowed to be imported into Hong Kong. Non-locally trained nurses can work in the public healthcare as well as in the social welfare sectors. We have an acute shortage of nurses. It's necessary to introduce new pathways to import more nurses. For nurses who have full-time clinical experience, they can help ease the manpower crunch in Hong Kong. Some sectors mention that for special registration and enrollment, nurses can migrate to full registration and enrollment without having to take licensing examination. That will affect the well-being as well as the standard. I understand the concerns of the sector, but I'd like to point out for nurses who are imported through this scheme, they will have to work in specified institutions for no less than 5 years. The assessment criteria are formulated by the Nursing Council of Hong Kong. The appraisers will have to comply with the criteria set by the Nursing Council to assess these non-locally trained nurses. The work-based assessments have all along been adopted by the healthcare sector in Hong Kong. This also shows the gatekeeping function of the Nursing Council. It makes sure that these nurses can provide high-quality services. I support the bill. I hope the introduction of non-locally trained nurses can ease the work pressure of local nurses. I'd like to point out, however, that this is not a once-and-for-all solution. The attrition rate of public nurses is high as 9.5%. How to enhance the public healthcare sector, how to boost morale, how to retain talents, these are what the administration needs to do. These are problems to be solved by the administration. I support the Nurses Registration Amendment Bill 2023. I so submit. Thank you, President. Dr. Sari Lee. Thank you, President. I speak in support of the bill. The acute shortage of nurses has attracted public concern as well as the Council. As I understand, there are many different factors, such as the retirement wave as well as the emigration wave, contributing to the acute shortage of nurses in Hong Kong. Private doctors, private hospitals also poach nurses in the public healthcare sector, so we need to attach importance to solving the manpower crunch in public healthcare sector when it comes to nurses. If we have no solution to retain nursing talents in Hong Kong, it's difficult to avoid medical blunders. I speak in support of the bill today. I also believe the bill will be passed in the Council smoothly. Against the backdrop of the acute shortage, I agree with importing non-locally trained nurses to ease the manpower crunch in Hong Kong. However, as other members said, I urge the administration not to think that upon the passage of the bill, the manpower crunch will be significantly eased. We need to continue to do our level best to train local nurses, to retain local nurses. I need to mention we need to see the challenges posed to experienced nurses. We also need to understand the challenges in wards in the hospital. I ask experienced nurses in the community the work environment they're in, the work stress they have, and the reasons for the high attrition rate. To put it simply, we know experienced nurses have a heavy workload and burden. They undertake high-risk jobs. They need to train a lot of new blood. Despite the passage of the bill, there will be a lot more experienced nurses coming to Hong Kong, including graduates of nursing schools. For experienced nurses who come from overseas to settle into the work environment in Hong Kong, that will take time. Students, the same. They can join the workforce, but they will have to be guided and led by experienced nurses. Experienced nurses need to undertake high-risk jobs. They need to train nurses. There are also many clerical duties. As I understand, they are under great pressure at work. So I hope that the Health Bureau will listen to experienced nurses. And you need to try to retain these nurses. For each ward, we need experienced nurses to work in these wards so that we can keep the patients in these wards stable, so that they will receive appropriate services. I have some suggestions for the administration. As I understand, experienced nurses are very important, and they attach a lot of importance to the wards in the hospital. Upon the passage of the bill, I'm not sure if these new nurses will spend longer time in one single ward, or will there be any rotation arrangements. If there are rotation arrangements, there's going to be a lot of stress for these nurses. For new graduates, they need to go to different wards for learning in 3 years' time. This is a good arrangement. It's understandable. However, when the attrition rate is very high, when we need to retain talents, can we make suitable adjustments? I hope the administration will look into this matter. In the public hospitals in Hong Kong, medical staff and nurses will call it a battlefield. You can visit a hospital, you can see there are canvas beds, and the corridor is packed with hospital beds as well. The stress is really immense in public hospitals. If we need to solve the problem in relation to work stress, we need to reduce the patient-to-nurse ratio. However, that will even that will worsen the lack of nurses in Hong Kong right now. Work environment, salary, these are also factors at play. But as I understand, private nurses do not earn a lot more than public nurses. I hope the administration will see how you can retain talents with a package of measures. You need to retain hardworking nurses, not least those very experienced nurses. When it comes to nursing schools, as many members mentioned, is the day of result announcement of DSE examination. Many students apply for admission to nursing programs. The demand has been outstripping supply. They need to spend a lot of time on the programs before they can work in hospitals. Nursing schools have a different system. They have on-the-job training. For example, for a 3-year program, they have 3 months theory courses alongside clinical arrangements or clinical training. So probably nursing schools can play a bigger role. If many young people want to be nurses, is there only one pathway? Can we study how we can introduce more pathways to ease the manpower crunch in Hong Kong? Overall, I support the bill. Upon the passage of the bill, I hope the administration will attach great importance to the acute shortage of nurses. We need to retain nurses. We need to listen to nurses as well. That's because we need to retain talents. They play a very important role. We need to reduce medical blunders in Hong Kong. We need to give appropriate and immediate support to patients. We need the support of experienced nurses, without whom the risks will be much greater. I hope the administration will attach importance to this matter. I so submit. Thank you.
Mr. Tommy Chang. President, I support the Nurses Registration Amendment Bill 2023. We're resuming the second reading debate today. I hope this bill will receive its third reading and see its passage. The hospital authorities should recruit nurses from other places to benefit the public. Now, this bill is mostly about creating new pathways to bring in qualified, non-locally trained nurses to ease the labor crunch in the public healthcare sector and welfare sector. The bill also mandates continuing nursing education as a prerequisite for renewing practicing certificates. This is to enhance the professionalism of nurses. There are also other textual technical amendments to the Nurses Registration Ordinance so that the ordinance keeps up with the times. The public healthcare system sees a chronic labor shortage. The shortage of nurses can be seen in the latest healthcare manpower projection from the Health Bureau. In 2030, 2035, and 2040, general nurses will see gaps of 8,700, 6,900, and 6,000 nurses, respectively. With the bill's imminent passage, the government's priority should be publicity and promotion. We should let our targets know there is this new pathway. Elderly care homes need nurses. So the government should help the sector with promotion and recruitment. Let's attract more talent to come here so that the sector will have an easier time recruiting the nurses they need. After getting non-locally nurses to come here, we should help them adapt to the local environment. We should help them navigate life in Hong Kong so that they can settle down in a career here. We don't want them to leave because they struggle with adapting. I hope more nurses will join the local profession, and then that can take pressure off the work, and then we will see better morale. The Health Bureau should also think about other measures to retain healthcare professionals. Last week, we passed a bill about bringing in non-locally trained dentists. That bill was passed. It's now law. Today, we're set to pass this bill, which will bring in non-locally trained nurses. We will have doctors, dentists, nurses from outside Hong Kong. The government should make it a priority to recruit these healthcare professionals. The recruitment process, publicity, and helping these people find housing after they come here, all that requires departmental support. So, the Health Bureau should take the lead. Officials from the Healthcare Bureau should be proactive in making plans. We have to promote our schemes and get those professionals to come here. We should get local professionals to work with their non-locally trained peers and work together. On doctors, nurses, dentists, the Liberal Party has long recognized the shortage of these professionals, and we have been pushing for change. We have been pushing for the bills on non-locally trained doctors, dentists, and nurses. We want enough healthcare professionals to meet the needs of Hong Kong people. The government has put in the money, but we are short of people. The middle class pays taxes. This bill has the full support of the Liberal Party for its second and third reading and also the amendments. Thank you, Madam Deputy. Mr. Dennis Leung. Madam Deputy, I support the Nurses Registration Amendment Bill 2023. International standards tell us we should have one nurse for every 6 patients. As at the end of 2023, we had 68,000 or so nurses. Then there is 9.1 nurses for every 1,000 people in Hong Kong. That figure is lower than the level in OECD countries. The highest ratio is in Ireland, 1 to 15.2, Iceland next, and then followed by the US and also New Zealand. In the UK, it's 8.7. In August 2023, a survey shows we need more nurses at certain times of the day. In the US, Australia, and Singapore, there are rigorous requirements. In California, back in 2004, they tried to legislate on the minimum ratio of nurses to patients. In some departments, the ratio is as low as 1 to 3. You go below that level, you break the law. We don't have what it takes to legislate on nurse to patient ratios. We should be mindful of patients' rights and the workload for nurses. We need to keep enhancing the arrangements. I welcome the government's review of the schemes about nurses. We have been increasing the number of training places in nursing. We had 630 places that went up to 690, and then it went up to 750. So over 4 years, there has been a nearly 20% rise in the number of training places in nursing. Still, our nursing graduates fall short of the demand given the aging population. Our tertiary institutions have offered self-financing programs to train nurses that can help plug the loophole. The government should continue to review the education offered at different institutions. Let's offer subsidies for these students so that they become nurses upon graduation. The shortage of nurses is a global phenomenon. Different places are trying to get people to go there and become nurses. We should plan ahead To address the current nurse shortage, admitting non-locally trained nurses is one way to go. This bill will allow non-locally trained nurses to work at places like the Department of Health and Hospital Authority, and also licensed care homes, and also specified social welfare organizations. There are three kinds of registration: special registration or enrollment, limited registration or enrollment, and temporary registration or enrollment. These different channels help address the problem in different ways. For non-locally trained nurses to come here, they have to meet three requirements. First, they have to have qualifications from programs broadly comparable to a local program recognized by the NCHK. And second, these nurses have to have practicing certificates from bodies recognized by the NCHK. These nurses also have to have full-time clinical experience. These nurses also have to show proof of professional integrity and good character. Now, for a non-locally nurse to get full registration here, they have to work for a number of years full-time at specified institutions. Their performance has to be assessed to be satisfactory and competent by those institutions based on criteria set by the NCHK. People should have faith in these non-locally trained nurses because the NCHK will be the gatekeeper. The council will make sure those nurses are up to scratch. People should not worry about the quality of those nurses. Paragraph 49 of the Bills Committee's report says the NCHK will also release more detailed information on the assessment of non-locally trained nurses. There will be guidelines for those institutions to consult. The NCHK will also hire or engage third-party healthcare professionals to assess the non-locally trained nurses to make sure the needs of the healthcare sector are met. The government and the NCHK should keep an eye on this situation to make sure we have a fair and consistent assessment system. We will have to make sure nurses who pass the assessment are up to standard. Now, a key area in this bill is for nurses to meet the continuing nursing education requirement. This means nurses have to attend the training specified by the NCHK. Nurses seeking to renew their certificates have to use the specified forms and provide certain information. Nurses also have to declare whether they were convicted of offenses punishable with imprisonment. This is in line with Hong Kong's development. First, professionalism. Second, security. Now, this proposal can enhance nurses' professionalism and safeguard patient well-being. I also want to speak on behalf of our union. Nurses are a key part of Hong Kong's healthcare system. Nurses make key contributions to the prevention and control of diseases. The nurse shortage has undermined the quality of our healthcare system. The government should recognize the contribution of nurses. There's a global nurse shortage. Different places want top-quality healthcare professionals. Hong Kong's nurses are also targeted by other places. The government and the HA should improve the pay conditions for nurses. Let's keep our local nurses here. Our population is aging rapidly. Healthcare demand will keep growing. The high attrition rate in the public health sector means the government should make certain improvements. More nurses for patients is a place to start. bringing in non-locally trained nurses itself is not good enough. We should also increase the number of local training places in nursing. We need short, medium, and long-term policies to attract and retain talent. To ensure the quality of nurses, the non-locally trained nurses should be subject to gatekeeping from the NCHK. This means assessment from the NCHK. Those nurses shouldn't just get a local qualification automatically. Now, the 1997 Nurses Registration Amendment Bill contains certain provisions that have yet to take effect. Now, we will be repealing certain outdated provisions under this bill. This bill will strengthen the position of the NCHK. I hope the NCHK can turn out more professional nurses. I so submit. Mr. Chao Siu-chung, Deputy President, I thank the Health Bureau for their work so that LegCo can pass 2 bills in a row on healthcare professionals. This bill is good for nurses at public hospitals. Nurses wanted to seek professional development, but the staff shortage prevented that from happening. I welcome the government's remarks that once the labor shortage is eased, the government would improve the work environment. From April to December last year, 1,800 nurses left their jobs from public hospitals, a wastage rate at 9.5%. That number went slightly down from 10.9% from the year before, but still, that wastage is close to 10%. I hope that the hospital authority can set a KPI on the wastage rate of nurses and also review the success of the scheme. Without improvement in the work environment of public hospitals, locally trained nurses and their non-locally trained peers will want to switch to the private sector. That will hurt the success of this bill in easing the labor crunch. This means improving the work environment and also pay conditions for nurses will be a pressing task. Now, we will see new pathways to admit nurses. We should also watch the local employment situation of nurses. The 2023 manpower projection for healthcare professionals shows we will see a gap of 9,500 general nurses in 2025. By 2045, that gap will go down to 4,200 general nurses. The gap is worsening, but in the long run, that gap will improve. In February, there was a public hearing. We heard from nursing schools and the nursing profession. They agreed on the pressing need for bringing in outside nurses. But they also proposed a cap or a ratio of local versus non-local nurses. Once we have enough nurses to meet the local demand, the government should stop the admission schemes for outside nurses. Otherwise, you jeopardize the prospects of local nursing graduates. When young people see more and more outside nurses coming in, they will hesitate to join the local nursing profession. The number of training places for registered and enrolled nurses went up from 2018 to 19 to 2023 to 24. By 2045, we will have at least 70,000 registered nurses training places. The short-term nurse shortage is down to the failure to retain nurses. Our local nurses can meet the local demand. The Health Bureau promised that the Department of Health and the hospital authority will prioritize local nursing graduates in hiring. They will also work with local care homes to hire local graduates first. But trade unions worry about not just jobs. Quality also matters. Rigorous standards are in place in the public healthcare sector. We believe hiring criteria will be appropriate, but then for private operators, they may lack expertise in healthcare. So those private operators may struggle to tell when a good candidate comes forward. Private operators may struggle to tell what kind of candidate they should be hired. They may want to cut costs, and in doing so, they hire less than capable candidates. Private care homes signed contracts without imported workers for 9 hours of work every day, but the outside workers were made to work 12 hours every day. This means we need surprise inspections about non-locally trained nurses. When the nurse falls short of standards, they should not be allowed to work here. The Labor and Welfare Bureau should also look out for docking of wages and the charging of fees for intermediaries. We have to guard against exploitation of non-locally trained nurses. We should also safeguard their rights. This bill will allow non-locally trained nurses to work legally in Hong Kong. As for the details, the number of nurses to bring in and their pay, the government should talk to the sector and trade unions. As we bring in more nurses, we also have to secure the employment for local nurses, as I submit.
Mr. Michael Look, I speak in support of the Nurses Registration Amendment Bill 2023. Now, to me, this topic means something special to me. I used to be half a nurse, so to speak. I did study to become a registered nurse, but I didn't finish my study. But then I was a student nurse for a period of time. So I received some training, and I still know people who are nurses and who work in the public health sector. Generally speaking, I support the amendment bill. This is because in Hong Kong, we do have a manpower shortage when it comes to nurses. We have only got 50,000 or so RNs and then 15,000 ENs. On average, per 1,000 people, 9.1 nurses. Much lower than a dozen or so in advanced economies. In the year 2023, the attrition rate was more than 10%. I think for frontline nurses working in wards as well as the A&E department, when compared with what had happened 20 years ago while I was a student nurse, I think day in, day out, they are working in a battleground because they are subject to more stringent medical procedures, more paperwork, high expectations, etc. So for frontline nurses, they are under huge pressure. Now, for this amendment bill, it comes in time. During the pandemic, we have got a batch of mainland nurses helping us out. Now, we want to establish a system, a mechanism, so that we allow for special registration, special enrollment, as well as limited registration, limited enrollment. I won't go into the details. They will be certified and will recognize the university programs so that they will be exempted from sitting the licensing examination, and then they can come to work in Hong Kong. The licensing examination was known to be difficult. The number of candidates and the number of passing rate has always been low. Now, we impose a CNE requirement on the nurses so as to meet with the ever-evolving medical technology. Now, let me come back to the training of nurses. Many people have said that the key to the question is to boost our local supply. We need to train our local people. Well, in the case of the UGC, we have subvented tertiary places. We have currently 690 places a year. For self-financed places, there used to be 400. Now it is 1,380 per year. And then we have the enrolled nurses places for the social welfare department. In 5 years' time, it will go up to 1,700, and they are subsidized places. It means that we can absorb the newly arriving nurses. Today, the DSE results are out, and young people have to consider their career path. Nursing is a good profession. Back then, I wasn't able to complete my training, but I resolved to serve those who are in need, and that's why I went to study social work, and I have always been engaged in labor union work. So I just wonder if we can do more in terms of local training. Nurses, my experience and that of my friends is that professional knowledge, skills, and aptitude would be equally important. There are people who are most caring, but then they may not, but they are too absent-minded, like myself, are not suitable to become a nurse. It's better for them to be a social worker or a union leader. There are others who may not perform very well in the DSE, and then they may become health workers. For health workers, they've gained some experience. Maybe they can meet certain basic academic qualifications, and perhaps our tertiary institutions should give priority to such experienced health workers. They may want to have a career in a nursing profession and serve the vulnerable, like the elderly or the patients. So perhaps we should create such a career path for them to become a nurse, be an enrolled nurse or even a registered nurse. So when it comes to the vetting of the eligibility of the candidates, we shouldn't just look at the public exam qualification. Today, nursing as a discipline is a very popular one. The career prospect is good. The career ladder is attractive, and the salary is good, and you will never be out of a job if you are a nurse. So there's very keen competition for a place. There are people who don't perform very well academically, but then they are caring and they are good at clinical practice, so they're well adapted to become a nurse. So please reserve some places for them, so that either they're very caring or they have got the right aptitude, they have a strong sense of empathy. I remember that when I was a student nurse, our teacher always emphasized the need to have empathy. Don't get numbed by meeting the patients day in, day out. In that way, you can't be a good nurse. There are people who have got the right aptitude, but they may not have the academic qualifications. So why don't we open the door to them? Well, when it comes to manpower shortage, importation of labor or professionals would only be supplementary and complementary. The solution lies with having a local supply. So I spoke in support of the bill. Ms. Chen Hoi-yen, thank you, Deputy President. According to the manpower projection for general nurses, we have got the most severe scenario among all disciplines. Last week, we have the latest projection figures. I don't think we should look at that paper alone. We should look at the previous projection figures as well. Take next year as an example. For year 2025, In the 2017 report, it was projected that there would be a shortage of 1,383 general nurses in 2025. For the 2020 projection, a shortage of 3,235 nurses, general nurses. In the year 2025, we are seeing an increasing manpower gap. For the 2023 projection, the figure has gone up to 9,500. The trend is like a snowballing effect. I think the government must find an early solution. Let me talk about the case while we are having a discussion of this bill. I will say that I respect each and every nurse that remains. Now the workload is heavy, the pressure is huge, they are burnt out, but I believe that every frontline officer who chooses this profession must have a sense of mission and a sense of commitment. For those who have stayed despite the pandemic, they have our full respect. Now, for the Nurses Registration Amendment Bill 2023, there will be special limited and temporary registration or enrollment that opens the door for nurses from elsewhere to come. If they have taken a program that is broadly comparable to ours, they can come, and having worked here for 5 years in accordance with the criteria laid down by the Nursing Council, they can migrate to a full registration or full enrollment status, and they can stay to work in Hong Kong. I welcome such a move. This is one of the ways to overcome the shortage. Admission of non-locally trained nurses. I think the public is mindful about gatekeeping. While we waive the examination, we must be sure of the quality of the new nurses, newly admitted nurses. Yes, there will be a set of criteria and a set of standards to assess their qualification, their work experience, and whether they are qualified. When it comes to clinical practice, like tubing, injection, etc., for such skills, I think generally speaking, it would be the employer institution that would be doing the assessment. This can give rise to a problem if it is the employer that is doing the assessment, if there is a shortage, in order to make sure that they don't have a manpower problem and thus jeopardizing the benefits of the patients, they may adopt a different view. We must have a communication among the three parties involved. The assessment must be fair and open so that all the nurses are up to the clinical standards required. The Hong Kong Nursing Council must make sure that the criteria for assessment will be made public so that we know the criteria, so that we know that we can have confidence in the non-locally trained nurses. It's been said that upon enactment of the bill, the first stage will have the following objective. That is, between 300 and 500 non-locally trained nurses can be admitted without having to sit and pass the exam. When it comes to the salary and terms of service, I think our package should be enhanced to make it more attractive to the nurses in our neighboring regions so that they can come, and they will come. But then non-locally trained nurses cannot solve the problem at root. It is a long-standing problem. It will be an impossible task now for governance, for morale, for workload. All of them are integrated. We can't just solve the problem by relying on a single route. I think it is a long-standing problem. Nurse shortage is a result of the mistakes and myth of our public health planning. Well, for decades, when we deploy our resources, all the resources are focused on hospitals. It's more on treatment than prevention. And then we are unable to find the right solution. Yes, we know the importance of primary health care, and there has been a lot of discussion. It is only until the year 2022, end of the year, we have the first blueprint for healthcare, primary healthcare. As a result, people would have the idea that we only see a doctor when we fall ill. By that time, we have to be admitted to a hospital, and so hospital services are in high demand, and we're lacking behind all the time when it comes to primary health care. I think nurses would never be adequate in terms of the number. Long-term manpower shortage, and that gives rise to morale problem, and it gives rise to more serious problems like quality of service as well as safety. For the first 6 months of this year, there were at least 7 major medical blunders. One took place at UCH. A 89-year-old patient died as a result. A patient forgot to input the vital signs of this patient. Well, the hospital said that at that time there were 56 patients in that single ward. As to the number of nurses, 2. In other words, it's 1 nurse to 28 patients. It is most unacceptable and much lower than the international standard. There might have been some ward assistants helping out, but then they are not nurses. When it comes to patient care, 2 nurses just cannot take care of the heavy workload of attending to 28 patients each. So they cannot cope, and it is just not difficult to imagine why they have chosen to leave, and the attrition rate has always been the highest among the different disciplines. According to a special FC paper for the year 2023-24, the attrition rate was 9.5%, and in fact, over 80% of them are not leaving because of retirement, and we are losing 7,325 in total, and 84.4% of them are not retirement related. To overcome the shortage of nurses, I think we should stop the bleeding, so to speak. We should stop the gap of losing nurses. Now, we have been increasing our subvention to the hospital authority. In fact, it is as much as $95.4 billion. This is the highest ever. And then one of the major objectives is to deal with the manpower shortage and the attrition of manpower. But how come that nurses are still short in supply? Why it has become the norm? Has the HA considered the reasons behind that? While we set aside lots of public money to support HA, I think with more resources, we're supposed to spend more money on manpower, on patients. Are the right amount of manpower deployed to the right places? Are there sufficient supports given to the manpower? Is it a wise use of public money? Recently, we have had a number of medical blunders. The HA has been asked by the HSB to set up a committee to look into that. It is the best opportunity for the HA to look at its governance as well as executive efficiency, in particular human resources arrangements. I think we need to adopt a multi-pronged approach to resolve the problem. Admission of non-locally trained nurses would only see us through the short term. During short term, we need more retention measures for nurses, a better working environment, more support, and other than getting ward assistants and other helpers, there should be more reliance on technology to ease the burden. For inpatient services, we should have smart wristbands to check the vital signs of the patients. There should be smart systems. We should have AI assistance to reduce the chance of having incidents or medical blunders and to ease the workload. At the same time, we should consider having specialties for nurses, and we should encourage them to have continuous education, and then they can have a specialty, and we should have better promotional opportunities for them so that they have a brighter future. And at the same time, better primary health care should be developed, and then the planning should shift from treatment to prevention, and there should be better use of traditional Chinese medicine as well as other allied healthcare professionals and pharmacists, and then fewer admissions will be needed, and then we can ease the burden on the public healthcare system and on the hospitals, and then nurses and other healthcare professionals will have better working environments. So I spoke in support.
Mr. Dominic Lee. Thank you, Deputy President. We have a shortage of nurses in Hong Kong. This is acute right now. The public hospitals in Hong Kong service levels are affected. We want to safeguard the rights and interests of patients. We also want to shorten the wait for consultation. The Nurses Registration Amendment Bill 2023 is aimed at introducing non-locally trained nurses to Hong Kong. We absolutely support this bill. Nurses have a very heavy workload. Over the last few years, even during the fight against the pandemic, they are very respectable. They work very hard even in the midst of pandemic. Well, just now Mr. Lok Chung Hong mentioned that he was about to become a nurse. But believe it or not, I took part in one of the summer holidays, an internship scheme in the United Christian Hospital. I went to work in the UCH for 6 weeks. Well, the scheme is still around. It's still available right now. So back then, I had a taste of how tiring the work of nurses was. Right now, the manpower crunch is even tighter, is even more serious. So the work of nurses is definitely much heavier. So we need to introduce non-locally trained nurses to ease their workload. It's definitely worth our support. The government arranges for a 5-year mechanism or probationary period, so to speak, for them to migrate to full registration or enrollment. So a balance has been struck when it comes to settling into the work environment into Hong Kong, as well as the working mode in the Hong Kong nursing profession. After the introduction of non-locally trained nurses, not many people mention the continuous support for them. They come to a new environment, they have a different work environment, different cultures, different language, and so on. I hope there can be support on different fronts. This should be provided by the administration. There are news reports mentioning discrimination issues. Will that happen in the workplace? So for some nurses who want to come to Hong Kong, they were driven away. After the introduction of non-locally trained doctors, we have some policies, but we may not see the very enthusiastic response. We can see that from the number of applicants. I hope the administration, after implementing the policy, can step up publicity in overseas areas or even in mainland China. They can have job expos explaining the differences in the work in Hong Kong. They can attract these non-locally trained nurses to come to Hong Kong. Without doubt, when we introduce non-locally trained nurses, those locals in the local workforce may be afraid of a surplus of laborers, which may affect the rights and interests of local labor. We need to strike a balance, and we also need to show concern about it. So after the introduction of the scheme, the administration will have to set KPIs or take stock of the program, to have statistics, to review the situation. Do we have sufficient manpower? We need to make adjustments to the scheme. So in tandem with importing more nurses and improving the level of services, we also need to protect the rights and interests of the local labor workforce. Thank you.
Does any other member wish to speak? If not, I now call upon the Secretary for Health to reply, then the debate will come to a close. Madam Deputy, I sincerely thank Dr. David Lam, Chairman of the Bills Committee, Professor Chen Wen-Kwong, the Deputy Chairman, and other BEC members, also the Electrical Secretariat and Legal Advisor, the team from the Department of Justice, and colleagues from the Health Bureau. Their effort facilitated the smooth proceedings throughout the deliberations of the Nurses Registration Amendment Bill 2023. I also heartily thank the 16 members, in addition to Dr. Lam, who spoke in support of the bill and shared other great insights during the second reading debate just then. The bill was tabled at LegCo for its first and second reading last December, with its main proposals as follows. 1. Proposing new pathways for the admission of non-locally trained nurses who meet professional standards to practice in Hong Kong, to ease the nurse shortage in the public healthcare system and the social welfare sector. 2. Making continuing nursing education a prerequisite for renewing the practicing certificates renewed or enrolled nurses to enhance nurses' professional development in an effort to ensure the quality of nursing care. 3. Making technical amendments to enhance the Nursing Council of Hong Kong's functions in regulating the nursing profession. During the extensive consultations held between March and June last year, the government engaged with over 80 organizations and bodies from the healthcare and social welfare sectors, which broadly supported our proposals. On admitting non-locally trained nurses, just like other developed regions, Hong Kong has a growing size of aging population, which means ever-rising demand for healthcare services in the future. Given this, having enough healthcare workers is crucial to maintaining standards in healthcare services. The Healthcare Manpower Projection 2023, which just came out, shows even with a massive increase in the training places in nursing, general nurses will still see an acute shortage in the short to medium term. The shortfall of general nurses is projected to be 8,700, 6,900 and 6,000 in 2030, 2035, and 2040, respectively. Locally trained nurses have always been the bedrock of Hong Kong's healthcare system. Over the years, the government focused on committing vast resources to boosting the number of training places in nursing, with this figure going way up from 2,900 training places for registered and enrolled nurses in 2017 to 18 to 4,500 spots in 2023 to 24. The current amendments to the Nurses Registration Ordinance do not seek to change the role of locally trained healthcare professionals as the backbone of our healthcare system. Admitting non-locally trained nurses is an effective measure to address the local nurse shortage in the short term so that Hong Kong's shortfall of healthcare professionals does not undermine the quality of healthcare and care home services. Hong Kong's healthcare professionals uphold the principle of professional autonomy. The government fully respects the role of professional councils as regulators that process professional registration, set professional standards, and handle disciplinary matters in accordance with the law. The legislative proposal under the bill to admit non-locally trained nurses is the result of in-depth discussions involving the NCHK and the sectors. We propose to create the pathways, limited registration or enrollment, or LRNE, and special registration or enrollment, or SRE, to attract non-locally trained nurses who meet professional standards to work in Hong Kong's public healthcare system, that is, the Department of Health and the Hospital Authority and social welfare sector, including residential care homes for the elderly and persons with disabilities, and other social service units or organizations specified by the Director of Social Welfare. Under the principle of professional autonomy, the NCHK, as the regulator of the nursing profession, has been following the Nurses Registration Ordinance in handling nurses' registration or enrollment independently. The bill imposes certain requirements on the professional competency of incoming nurses. Whether these nurses meet the professional requirements will be for the NCHK to decide. The NCHK will also be able to impose conditions on a nurse under LR or E hired to work here based on the nurse's previous clinical experience. These arrangements fully reflect the NCHK's role as the regulator. To retain incoming nurses, we propose that nurses under SR or E who have worked for at least 5 years in total at one or more specified institutions, with their performance assessed by these institutions to be satisfactory and competent based on the criteria set by the NCHK, will be eligible to apply for full registration or enrollment. This arrangement reflects the NCHK's power to make decisions over nurses' registration. This practice will also ensure consistency and comprehensiveness in the assessment of nurses under SR or E and give the NCHK an idea of an applicant's professional competency for a registration or enrollment application to be processed. In actual operation, once the NCHK sets the criteria for assessment, it can also specify the form of assessment and its practicalities, such as the requirements for assessing officers, the form and frequency of assessing certain professional competencies. These criteria must be followed by the institutions hiring the nurses under SR or E in assessing their performance. The NCHK will release the standards and guidelines on assessment in due course for the reference of those institutions and assessing officers. After the bill's passage, the HA and the DH will uphold the principle of jobs for locally trained healthcare professionals first by prioritizing locally trained nurses in hiring. These bodies will offer non-locally trained nurses pay packages comparable to that of their local peers. We will also ask designated institutions other than the HA and the DH to hire locally trained nurses first. On making continuing nursing education a prerequisite for renewing the practicing certificate of registered or enrolled nurses, we take the amendment of the Nurses Registration Ordinance as an opportunity to propose making continuing nursing education as a prerequisite for renewing the practicing certificates of registered or enrolled nurses. This requires all practicing nurses to pursue continuous learning to keep up with the times. Failure to meet the CNE requirement will lead to the rejection of a renewal application. This will disqualify the applicant involved from practicing nursing. The NCHK, as the nursing professions regulator, will decide on CNE's content and form, including whether to add training on cross-disciplinary collaboration to ensure nurses keep up with the profession's demands and future development. It will take time for the NCHK to work out the detailed arrangements for implementing CNE and ensure nurses are informed of the requirement. Therefore, this proposal will take effect on a date to be specified by the Secretary for Health through a Gazette notice. Between the bill's passage and the implementation of this proposal, the NCHK will work on transitional matters for the practicing certificate currently in force to migrate smoothly to the new arrangement under this bill. President, the local nurse shortage is beyond question. While maintaining professional standards, we see a pressing need to admit non-locally trained nurses to ease the labor crunch in the public healthcare system and the social welfare sector. I hope members will support the second reading of the Nurses Registration Amendment Bill 2023 and the amendments I will move in a moment. Thank you, President. I so submit. I now put the question to you that the Nurses Registration Amendment Bill 2023 be read the second time. With those in favor, please raise their hands. Mr. Peter Hsu reclaimed the division. The divisional bell will be rung for 5 minutes.
Voting begins. Will members please check their votes? If there are no queries, voting shall now stop and the results will be displayed. 86 in attendance, 85 for. The question has been agreed by a majority of the members present. I declare the motion passed. Nurses Registration Amendment Bill 2023. This council now becomes committee of the whole council to consider the Nurses Registration Amendment Bill 2023. Members may refer to the appendix to the script for the debate and voting arrangements for the bill. Members have been informed that the committee will conduct a joint debate on the clauses and amendments, including new clauses and new schedule. I now propose the question to you that the following clauses stand part of the bill. Clauses 1 to 73. Secretary for Health will move amendments which seek to amend a number of clauses, including deleting Division 7 of Part 5, that is Clause 73, and adding new clauses in a new schedule. Members may refer to the appendix to the script for the details of the amendments. Members may now proceed to a joint debate on the clauses and amendments. I'll first call upon the Secretary for Health to speak, but he is not required to remove the amendments at this stage. Then I'll call upon members to speak. Upon the conclusion of the joint debate, the committee will first vote on the clauses with no amendments standing part of the bill, and then deal with the amendments according to the arrangements set out in the appendix to the script. Secretary for Health. Mr. Chairman, I now move the government's amendments to the clauses of the Nurses Registration Amendment Bill 2023. These amendments are mostly made in response to the Bills Committee's suggestions. This reflects the healthy interactions between the government and the BC members in a concerted effort to improve the amendments to the Nurses Registration Ordinance so that the non-locally trained nurses can be admitted to ease the nurse shortage in the public healthcare system and the social welfare sector while maintaining professional standards without harming the employment of locally trained nurses. Our amendments broadly fall into 7 areas, which I will go over one by one. The first area has to do with the establishment and composition of the Nursing Council of Hong Kong. During the deliberation of the Bills Committee members noted an outstanding legal issue about revoking the appointment of the Nursing Council's elected members prevented the body from making subsidiary legislation on electing members. That held up the commencement of Section 3(2)(ca) of the NRO, a provision on electing 6 members to the NCHK. Members expressed concern over the vacancies arising from the Council's failure to elect 6 members because the NRO's provision had yet to take effect, and saw the need to implement this requirement as soon as possible. Having liaised with the NCHK, we agreed on the real need to implement Section 3(2)(ca) of the NRO as soon as we could to ensure enough council members for the increase in limited registration enrollment and special registration enrollment applications and disciplinary cases. Achieving this will lead to more effective operation of the council. In view of this, we propose to address the legal issue as part of the amendments to the ordinance. Section 3(2)(ca) of the ordinance provides that 6 members of the council must be registered or enrolled nurses elected to the body. Based on the clauses of the Dentist Registration Amendment Bill 2024 on elected members, we propose to amend Section 3(2)(ca) of the NRO for consistency in the related arrangements of the 2 councils of healthcare professionals. Our proposed change is that at least 18 nurses under full registration or enrollment will be elected, with 6 among this group to be appointed by the Chief Executive. This amendment will resolve the legal issue involving the original Section 3(2)(ca). In light of the amendment to Section 3, Bracket 2, Bracket CA of the NRO and the need for consistency with the ordinances of other councils of the healthcare professionals, we must amend the ordinance to provide for the arrangements covering vacancies arising during the term of office of elected members and set out the cases where a person will be ineligible for appointment or reappointment as a NCHK member. Such changes will help the NRO keep up with the times and uphold the Council's professional standards. Besides, we also propose to amend Section 3, Bracket 6 of the NRO to allow the Council to have more than one legal advisor so that the body that can cope with the extra work I just mentioned. The second area has to do with good character as a criterion for registration or enrollment. Sections 8 and 14 of the ordinance state that good character is a criterion for the registration and enrollment of a nurse respectively. Such requirements will stay after the ordinance is amended. We propose amendments to sections 9 bracket 3 and 15 bracket 3 of the NRO to add the applicant is not of good character as a ground for the NCHK to reject a full registration or enrollment application after due inquiry of a case referred by the Preliminary Investigation Committee. This is to better reflect our legislative intent. These amendments expressly provide that if the Council believes that an applicant is not of good character, then this can be a reason for rejecting the registration or enrollment application of a nurse. This practice is consistent with that for an application for medical registration. The recently passed Dentist Registration Amendment Bill 2024 has a clause to the same effect. The third area has to do with applications for SR special registration or enrollment and limited registration or enrollment. The proposed new sections 9A, 9B, 15A, and 15B under the bill require an applicant to possess a valid certificate to practice nursing issued by a certifying body recognized by the Council from time to time. We propose amendments that this requirement will apply only to applicants who have never obtained special registration or enrollment or limited registration or enrollment. These changes serve a purpose. Non-locally trained nurses under special registration or enrollment or limited registration or enrollment may practice in Hong Kong for many years. This means prolonged absence from their places of origin. In the meantime, their practicing certificates in their home regions may have expired, a problem that will prevent these nurses from keeping their special registration or enrollment or limited enrollment and registration to practice here. This issue will be fixed by our amendments to avoid unnecessary disruption for such nurses. The fourth area has to do with the termination of the temporary registration or enrollment. We amend the proposed new sections 9C and 15C under the bill by providing that when an applicant of temporary registration or enrollment informs the NCHK in writing of the termination of the temporary registration or enrollment, such temporary registration or enrollment will no longer be enforced. These changes cover certain situations where an applicant no longer needs to invite non-locally trained nurses to Hong Kong under temporary registration or enrollment for clinical demonstrations or academic exchanges. In cases such as the cancellation of an academic exchange, the temporary registration or enrollment can be terminated. The Dentist Registration Amendment Bill 2024 has a clause to the same effect. The fifth area has to do with the appeal mechanism under Section 22 of the ordinance. We propose an amendment to this section by including the Council's decision to reject a nurse application for the restoration of the name to the register or roll as a ground of appeal through the existing appeal mechanism under the NRO. This change also entails consequential amendments to other related provisions. The sixth area concerns amendments to savings and transitional provisions. We propose changes to sections 1, 6, 7, 8, 10, 12, 13, and 14 of the proposed new Section 3 new Schedule 3 under the bill and the addition of Sections 8A and 10A to this schedule. Except for Section 1, which is a technical amendment, all other provisions aim to clearly provide for the transitional arrangements covering applications for registration or enrollment, applications for restoration of a nurse name to the register of role, applications for practicing certificates and appeals about those applications. In general, an application or appeal filed before the bill's passage will be handled under the NRO's current mechanism. On the other hand, an application or appeal filed after the bill's passage will be dealt with under the new mechanism set out in the bill. This arrangement follows the same principle that governs all the transitional provisions and the same practice under the Dentist Registration Amendment Bill 2024. The seventh area concerns amendments to subsidiary legislation. As the proposed new registration enrollment pathways will lead to more nurses under different forms of registration or enrollment, the Council is expected to handle more disciplinary cases. After considering the Bills Committee members' suggestions, we propose amendments to the Nurses Registration and Disciplinary Procedure Regulations Cap 164A, the Enrolled Nurses Enrollment and Disciplinary Procedure Regulations Cap 164B, and the relevant provisions of the NRO to empower the TMHK to establish more than one preliminary investigation committee. This means that there can be more PICs to handle the volume of disciplinary cases in the future. Apart from those 7 areas of amendments, we also move certain technical and textual amendments that do not alter the substance of provisions. The Bills Committee had no objection to these amendments. I urge members to support and pass my amendments. Thank you, Chairman.
Does any member wish to speak? If not, we now first vote on the clauses with no amendments setting part of the bill. I put the question to you that the clauses with no amendment is set out in the appendix to the script stand part of the bill. With those in favor, please raise your hands. Mr. Frankie Yik claims a division. The bell will be rung for 5 minutes.
開始表決。
Will members please proceed to vote? Dr. David Lam, do you wish to vote? Please check the votes. If there are no queries, voting shall now stop and the result will be displayed. 86 present, 85 in favor. The question is agreed by a majority of the members present. I declare the motion passed. Dr. Starry Lee. President, I move that in the event of further divisions being claimed in respect of the Government Bill Nurses Registration Amendment Bill 2023 or any amendments thereto, this Council to proceed to each of such divisions immediately after the division that has been run for 1 minute. I now propose a question to you. That is that the motion moved by Dr. Starry Lee be passed. Those in favor, please raise your hand. Those against, please raise your hand. The motion is agreed by a majority of the members present. I declare the motion passed. I order that in the event of further divisions being claimed in respect of the motion concerned or any amendments thereto, this Council do proceed to each of such divisions immediately after the division bell has been rung for 1 minute. Secretary for Health, you may move your amendments. We now deal with the clauses with amendments. Chairman, I move the amendment as set out in the appendix to the script, which include the amendment to delete Division 7 of Part 5, that is Clause 73. I propose a question to you that the Secretary's amendments be passed. I now put the question to you as stated. With those in favor, please raise their hands. Those against? I think the question is agreed by majorities of the members present. I declare the amendments passed. As the Secretary's amendments, including the amendment to delete Division 7 of Part 5, have been passed, the heading of the division and Clause 73 are deleted from the bill. Clauses 1 to 3, 5, 13, 14, 16, 24, 25, 27, 29 to 31, 35, 37, 46, 49, 50, 58, and 61 as amended. I now put the question to you that the clauses as amended just read out by the clerks and part of the bill. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. We now deal with new clauses and the new schedule. New Clause 5A, Sections 3B and 3C added. New Clause 37A, Regulation 2 amended, interpretation. New Clause 45A, Regulation 15 amended, preliminary investigation committee. New Clause 46A, Regulation 17 amended, complaint or information touching conduct. New Clause 46B, Regulation 18 amended, reference of the complaint or information to the committee. New Clause 46C, Regulation 19 amended, consideration of complaint or information by the committee. New Clause 46D, Regulation 20 amended, determination by committee that no inquiry be held. New Clause 46E, Regulation 21 amended, determination by committee that inquiry be held. New Clause 46F, Regulation 23 amended, reference back to committee. New Clause 46G, Regulation 31 amended, order of procedure. New Clause 46H, Regulation 37 amended, evidence. New Clause 46I, Regulation 38 amended, voting. New Clause 46J, Regulation 39 amended, attendance at disciplinary inquiries. New Clause 46K, Regulation 40 amended, advice by legal advisor at disciplinary inquiries. New Clause 46L, Regulation 41 amended, attendance of legal advisor at ordinary meetings of the Council. New Clause 49A, Regulation 2 amended, interpretation. New Clause 57A, Regulation 15 amended, preliminary investigation committee. New Clause 58A, Regulation 17 amended, complaint or information touching conduct. New Clause 58B, Regulation 18 amended, reference of the complaint or information to the committee. New Clause 58C, Regulation 19 amended, consideration of complaint or information by the committee. New Clause 58D, Regulation 20 amended, determination by committee that no inquiry be held. New Clause 58E, Regulation 21 amended. Determination by committee the inquiry be held. New Clause 58F, Regulation 23 amended. Reference back to committee. New Clause 58G, Regulation 31 amended. Order of procedure. New Clause 58H, Regulation 37 amended. Evidence. New Clause 58I, Regulation 38 amended. Voting. New Clause 58J, Regulation 39 amended. Attendance at disciplinary inquiries. New Clause 58K, Regulation 40 amended. Advised by legal advisor at disciplinary inquiries. New Clause 58L, Regulation 41 amended. Attendance of legal advisor at ordinary meetings of the Council. New Clause 66A, Regulation 5 amended. Section added. New schedule amendment relating to certain expressions in Chinese text. Secretary for Health, you may move the second reading of the new clauses and the new schedule. Chairman, I move the second reading of the new clauses and the new schedule just read out by the clerk. I propose a question to you that the new clauses and the new schedule read out by the clerk be read the second time. I now put the question to you as stated. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. New clauses 5A, 37A, 45A, 46A to 46L, 49A, 57A, 58A to 58L, 66A, and the schedule. Secretary for Health. Chairman, I move that the new clauses and the new schedule just read out by the clerk be added to the bill. I propose a question to you that the new clauses and the new schedule read out by the clerk be added to the bill. I now put the question to you. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. All the proceedings on the Nurses Registration Amendment Bill 2023 have been concluded in Committee of the Whole Council. Council now resumes. Secretary for Health. President, I now report to the Council that the Nurses Registration Amendment Bill 2023 has been passed by Committee of the Whole Council with amendments. I move the motion that this Council adopts the report. And I propose a question to you that the Secretary's motion be passed. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Third reading, Nurses Registration Amendment Bill 2023. Secretary for Health. President, I move that the Nurses Registration Amendment Bill 2023 be read the third time and do pass. I now propose a question to you that the Nurses Registration Amendment Bill 2023 be read the third time and do pass. Does any member wish to speak? I now put the question to you as stated. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Nurses Registration Amendment Bill 2023.
This Council resumes the second reading debate on the Land Compulsory Sale for Redevelopment Amendment Bill 2023. Mr. Andrew Lam, Chairman of the Bills Committee on the bill, will first address the Council on the committee's report. Mr. Andrew Lam. President, as the Chairman of the Bills Committee on the Land Compulsory Sale for Redevelopment Amendment Bill 2023, I report to the Council the key points of the committee's deliberations. The purpose of the bill is to amend the Land Compulsory Sale for Redevelopment Ordinance LCSRO and its subsidiary legislation, as well as the Land Tribunal rules, with a view to updating and streamlining the compulsory sale regime and enhancing support for minority owners affected by compulsory sales. Overall, the BC supports the measures proposed in the bill to encourage the redevelopment of old and dilapidated buildings by the private sector. The committee believes that the government should formulate a comprehensive and long-term strategy to expedite urban renewal, create favorable conditions to attract developers to participate in redevelopment. On the other hand, as lowering the threshold for compulsory sale applications will affect more minority owners, the committee is very concerned about how the rights of these owners will be protected under the new compulsory sale regime. The bill proposes to reduce the threshold for compulsory sale applications for private buildings in all districts according to their age. It also designates area with a high number of old and dilapidated buildings as specified areas, introducing a lower threshold for compulsory sale applications in these areas. Members generally agreed with the proposal to lower the threshold for specified areas. As for non-specified areas, especially for private buildings aged 60 to 69 years, some members considered that the threshold for compulsory sale applications should remain unchanged. The government stated that aging building is a common phenomenon across the territory. Although the urgency of redevelopment in non-specified areas is not as high as in designated areas, non-designated areas also have old and dilapidated buildings that need redevelopment. According to the data as at the end of 2022, about 51% of private buildings aged 60 to 69 years are located in non-designated areas. Therefore, the government believes that it is necessary to appropriately lower the threshold for compulsory sale applications for private buildings aged 60 years or above in non-designated areas to boost redevelopment incentives. Regarding the bill's proposal to specify the list of designated areas in the form of subsidiary legislation, members asked the government to provide a timetable for reviewing and updating the list. Members were particularly concerned that removing certain designated areas might hinder ongoing redevelopment or acquisition projects. The government stated that in order to ensure the timely adjustment of designated area in line with development changes, they would regularly review the redevelopment situation of various old districts and propose amendments as appropriate. The government also promised to consult the panel on development when planning to revise the criteria or list of designated areas. The bill also proposes to provide more flexibility for compulsory sale applications involving multiple adjoining lots to facilitate large-scale redevelopment. Members were concerned that the requirements and procedures specified in the bill for such applications are too complex, which would prolong the time required for the Lands Tribunal to conduct related hearings in the future. Members urged the government to formulate clear guidelines on the technical issues of such applications and to streamline the application procedures as much as possible. The government stated that they would strive to secure additional judicial manpower resources for the Lands Tribunal to handle the expected increase in the compulsory sale applications after the amendment. They will also encourage and support applicants for compulsory sale to engage in mediation with minority owners, allowing more cases to be resolved through mediation rather than litigation. The government also asked the judiciary to consider formulating written rules based on past case management practices as administrative measures after the amended ordinance is implemented for the reference of litigants and other relevant parties. Members pointed out that in compulsory sale applications involving multiple adjoining lots, if the applicant already owns all the undivided shares of a particular lot, they should not be required to apportion the sale proceeds to minority owners based on the existing use value of each property on the lot. Therefore, such applicants should be exempted from preparing a valuation report on the existing use value, EUV, for the relevant lot. To facilitate large-scale redevelopment, members suggested setting a 6-year building covenant period for lots sold under compulsory sale. After considering members' suggestions, the government proposed relevant amendments including extending the building covenant period from 6 years to 7 years. During deliberation, members repeatedly emphasized difficulties and concerns faced by minority owners under the compulsory sale regime and asked the government to expand the scope of services of the proposed support service center for minority owners under compulsory sale to assist minority owners affected by acquisition or compulsory sale. The support center should directly or through district network provide minority owners with relevant information on their rights and protections in the compulsory sale process, ensuring that they received appropriate assistance. The government responded that one of the key tasks of the support service center is to strengthen district publicity and public education, especially in old and dilapidated districts and areas where there are more acquisition. They will proactively connect with district network organizations to reach out to owners. In response to members' suggestion, the dedicated office under the Development Bureau will liaise with the relevant district councils to arrange for the support service center and designated non-government organizations to collaborate with district organizations or resident groups, including district care teams or community care teams, to organize public education activities for local residents, helping minority owners understand their rights and legal protections in the compulsory sale process. In view of the practical situations and numerous provisions involved in the new measures introduced by this amendment, members suggested the government issue supplementary documents and guide to clearly explain the operation and legislative intent behind the provisions. The government undertook that after the bill is passed, it would provide an explanation in the form of a guide for compulsory sale applications involving multiple lots and clearly describe the main provisions of the ordinance in plain language. The government will also update and enrich the practical guidelines in accordance with the implementation of the ordinance to help various stakeholders grasp and understand the content and operation of the provisions. President, this is my report of the BC's deliberation. Here's my personal view on the bill. The bill will affect millions of owners, and there are multiple technical details involved. As the chairman of the BC, I would like to thank the government officials for their explanation and cooperation. I would also like to thank the Secretary for their work and the public deputations for attending our public hearings so that we understand more about the bill and to make our suggestions more practical. This also allows our scrutiny to be more smooth. Over the past 10 years, the redeveloped buildings of URA and private sector account for only 1/6 of the total number of old buildings. In other words, the pace of redevelopment cannot catch up with the rapidly aging building blocks in Hong Kong. In 2042, if we keep the current pace of redevelopment, we need 125 years for us to redevelop all old buildings. We have to extend buildings' lifespan by rehabilitating our buildings, and that's the work that we must undertake. However, that will not allow us to lengthen the lifespan of our buildings. We have to redevelop. 3/4 of the redeveloped buildings are private buildings. Redevelopment must be able to be profitable for private sector to participate in the redevelopment projects. If we do not amend the ordinance, we cannot improve the procedures. There are 4 main directions of the legislative proposal. First, lower the application threshold. Second, allowing more flexibility for multiple adjoining lot applications. 3, streamlining the legal process of compulsory sale regime. And 4th, enhancing support to affected minority owners. The threshold will affect the incentives of the developers in redeveloping private buildings. The threshold was amended in 2010, lowering the threshold from 90% to 80%. 4.6 times more applications were received. By lowering the threshold even further may not drive the number of applications up proportionately, but that would help. When the government proposed the amendment, they proposed to lower the threshold from 80% to 60% across the board. The current proposals adopt two principles. The older the buildings, the lower the threshold. Also, the lower threshold for building in areas with pressing redevelopment needs. They will designate areas with more old and dilapidated buildings as designated areas in order to channel resources to these designated areas. In non-designated areas, there are still old and dilapidated buildings, but there are not as many of them as compared to those in the designated areas. For buildings aged below 50, the threshold will remain at 90%. For buildings aged below 60 but above 50, for those in non-designated area, the threshold will be at 80%, but for those above 60 but below 70 years old, the threshold will be changed from 80% to 65% for those in designated areas. Apart from lowering the threshold, the amendment also proposed to allow more flexibility for multiple adjoining lots applications. For a large-scale site with more potential for development, that would definitely be better than a pencil-like building. But we have to take into account different development scenarios. For development of staircase-connected lots would affect the sales proceeds. So what does staircase-connected buildings or lots mean? It means that the lots may not have DMCs. The new proposal also states that, includes wording such as mixed lots, additional lots, boundary-connected lots. If we don't explain the amendments, it may cause a misunderstanding. Also, if all minority owners with undivided shares do not object, then the Lands Tribunal will not have to require an expert report. They can directly determine the value of the lot and grant an order for sale. Also, if the government lots is vested in the government, or if a lot is vested in the government in the form of bona vacantia, then the lot would be regarded as having filed a no objection notice. By clarifying the provisions, it will reduce disputes. However, there are different combinations of apportionment of sale proceeds under the amendment bill. To reduce disputes, the administration promised to announce practical directions with illustrations of recent cases for explanation. All these will help professionals, developers, and minority owners to better understand the operation of the bill. Even with However, if there are not enough manpower in the land tribunals, that will affect the speed of redevelopment. The administration said that they would increase the manpower of Lands Tribunal. I hope that they can do so as soon as possible. Also, the administration said that they would enhance support to affected minority owners. Bills committee members and I are very much concerned about this. The administration has much support for minority owners. However, there are still disputes. That's because of the minority owners not understanding their rights and protections. Enhancing their understanding would reduce a lot of disputes. A lot of minority owners don't know whom they can seek help from in order to assist them in the redevelopment process, and they may not have enough resources to hire experts. The administration said that they will establish a new company and a dedicated office under the Development Bureau to offer one-stop service to minority owners. The consultation service will not just focus on those in the redevelopment process, but also offer services prior to redevelopment to provide preliminary consultation services to minority owners, including the advice on sales proceeds apportionment. It is also stated in the bill that the minority owners can stay in the redeveloped property for no more than 6 months. President, even after the amendment of the bill, we still have to work on various areas. Apart from the practical guide to be published by the government, the administration will establish this guaranteed loan scheme to help the minority owners, and they will also step up publicity and education. The administration also undertake that they will, through the district councils, promote the provisions that will affect minority owners more extensively. For joint services, the administration will ask the URA to assist the minority owners in this area. I hope that the administration will be able to offer such services as soon as possible. The bill is just a part of the full picture. We have to have other measures in order to arrest urban decay. The administration says that they will consider using the artificial islands sites as decanting land, and they will also provide new planning tools of a transfer of plot ratios in different districts. President, so speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023.
Ms. Chen Yut-ming. Thank you, President. I speak in support of the Land Compulsory Sale for Redevelopment Amendments Bill 2023. We are considering the amendments to the compulsory sale ordinance. At the beginning, the threshold was 90%, and then there was an amendment later in 2012, and the threshold was lowered to 80% for compulsory sale. Today, we are lowering the threshold further to speed up urban renewal. The Bills Committee started work in February. Over 4 months, we had 8 meetings. It shows that members have great concern about the impact of the bill on the community. We would like to achieve a win-win scenario. So that's why we want the administration to make amendments. And I welcome amendments to be proposed by the Secretary because they have taken on board our views and also the views of others during consultation. Now, urban decay is aged buildings is now a common scenario. And after 2030, there will be more than 10,000 old buildings. And over a decade ago, there was a case of collapse of a tenement building in Ma Tau Wai Road. So the lowering of the threshold will certainly help. It will give more incentives to developers to redevelop buildings. And then buildings that people may put in unauthorized building structures, such as converting the light well or even the rear staircase so they could have more space. And then also in old buildings, most of the occupants are elderly persons, and they could not afford to make a repair, so there could be a charge on the whole block. So redevelopment seems to be the only option for buildings in dilapidated state. Now, the bill is meant to serve bigger public interest, but then lowering the threshold is about also the interest of minority owners, especially for buildings that are older than 60 years. The threshold could be lowered to 65% in designated areas, and in undesignated areas, the threshold will be lowered to 70%. We must bear in mind Article 6 of the Basic Law that protects our private property rights. So, as we consider relevant legislative amendments, the government needs to strike a balance between development needs and the interests of minority owners. Now, I hope the administration and this council will follow up on various aspects after passage of the bill. That is, there is a need to report on the effectiveness of the amendment measures. We need to protect the interests of minority owners. Now, the market circumstances change all the time. The interest rate is high now. In recent years, we see that land sales are not that satisfactory. Now, even though the threshold is lowered, the government needs to make use of various tools. to evaluate the effectiveness of the measure after some time. And then owners have formed concerned groups to protect the interests of minority owners, because the minority owners could not compete with developers in terms of resources. So that's why I agree the government needs to protect the interests of minority owners. Under the bill, the Development Bureau will set up an office to offer more statutory protection to minority owners and also give them offer them advisory service. Now the amendments covered various issues, and there may be actual impact on the community. So after the bill the ordinance commences, after some time the government needs to come back to report progress to us. And then we have to consider whether the interests of minority owners are given adequate protection. And also, this amendment covers both designated areas and non-designated areas. And there is a difference of threshold of 5% between buildings in designated and non-designated areas. So, can we really divert resources to designated areas as a result of this differential? And that for old buildings, some of the units are left vacant for a long time, and so we've seen falsification of documents to sell units. From media reports, we see that this have become syndicated criminal activities, and the amount involved is substantial. So that's why criminal elements will try to break the law, will be tempted to break the law. So the government needs to crack down on such activities. Now, the tribunal is responsible for, is the gatekeeper for compulsory sale applications. The number of applications went up from 6 to 28 after the last lowering of threshold. If there are more developers applying for compulsory sale then the Lions Tribunal needs to review its manpower and uses technology to speed up the processing of applications. Thank you. Dr. Simon Lee. Thank you, President. This bill is to lower the threshold for compulsory sale applications in some districts where buildings are old and dilapidated. This is to improve building safety and the living condition of residents. The amendments mostly are to clarify the various scenarios. It does not involve a protection of rights and interests under basic law and the common law jurisdiction. Now, this amendment is rather aggressive. The threshold was lowered from 9% to 65%. Is to be lowered to 65%. So that means that would speed up urban redevelopment. At the same time, we need to be prepared, because we can imagine there will be many more litigation cases and disputes. And the other amendments of the bill have to do with streamlining the process so applications could be processed effectively. There aren't many legal issues involved. It's all a matter of administrative arrangement and striking the right balance. And the amendments to be proposed by the Secretary are really in response to views and concerns expressed by members at Bills Committee meetings. It's just to ensure more precise description. So again, it doesn't involve legal issues. We have valuable land resources. So apart from creating new land, we need to make use of existing land. And as for old buildings, there may be safety hazards. So we need to redevelop these buildings. The bill is to encourage private sector participation in urban redevelopment. For buildings in multiple ownership, the lots could then be redeveloped. So the bill is again about just clarifying the different scenarios to which the bill applies. It does not involve the basic law. Now, in 2023, a policy address, the Chief Executive announced measures to enhance the arrangements for compulsory sale. There is actually an urgency in this bill. We have 160 buildings. We see an increase of 510 buildings that will reach the age of 50 or above. So development does not keep up with the aging of buildings. And we've seen in recent years cases involving old buildings, such as fire. That means usually the design of a building is supposed to last 50 years. So in terms of the facilities, the drainage systems and so on, they are out of date, and that's a hidden hazard. And that the government has launched various schemes to help repair of old buildings, but then building owners cannot reach agreement, and so so these measures cannot really address the problem of aged buildings. Other cities also face the same problems of aged buildings. Why is it that we should need a lower compulsory sale threshold here in Hong Kong than compared to other cities? Now, in other places, the compulsory sale threshold usually is no less than 80%, and there will be other conditions too. Or there has to be imminent need to redevelop a building. So this legislative amendment to substantially lower the threshold is not in line with the usual practice. But then we have to look at the circumstances in Hong Kong and our direction of development. So that's why there's need to do this. Of course, in the process, we need to strike the right balance. We need to support minority owners. Now, we have a dense population with little land, so there's need to have prudent land planning. In old districts, there are many old buildings. They can't really cope with the development we need in Hong Kong, so they are actually a bottleneck for our development. And then we can't do what other places do because we have limited land, so we can't free up. We can't build on new land and then vacate buildings, the population from old land. And then there are now 7 designated areas under the bill, so that we could first give priority to districts or areas with many old buildings, and then we could focus resources on areas that require redevelopment as a matter of urgency. So this is to steer resources towards these areas, and there's also relaxation of various requirements. Now, we need to strike an even better balance for the parties involved, and that in the past decade, 75% of newly built units come from redevelopment projects in the private sector. The rest come from the URA. So we can't just leave it to the market. The government needs to guide development in the market, and the government needs to look for opportunities to work with private developers, and so we could explore measures like a transfer of plot ratio or relaxing plot ratio. That's to create a high value of the land concerned, and then the developers will make good use of our land resources. Well, in Hong Kong, we don't have we don't see dilapidated areas because of our good planning. The government needs to intervene proactively, and the negotiation between the developers and minority owners, so there could be fairness and there's a balanced approach, and then the two parties could reach a consensus soon. Now, as we develop old areas that will promote the development of Hong Kong as a city, and then we will remain and then we will, we have good development, and then there's need to have better communication with developers so that the government's vision can be realized, and at the same time, minority owners' interests are protected. So then we could strike a good balance. Thank you.
Dr. Lo Wai-kok. Thank you, President. The BPA and I support the passage of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. President, to encourage private sector to participate in the development of old and dilapidated buildings, the LCSRO Cap 543 has been implemented since 1996 to help buildings with fragmented titles redevelop their lot. The threshold of compulsory sale was set at no less than 90% on undivided shares, and it is applied to all lots. In 2010 April, the administration amended the Cap 545 notice, that is Cap 545A, to lower the threshold to no less than 80% of all undivided shares. Redevelopment of old and dilapidated buildings was done through private sector and URA. In 2013-2022, the number of redeveloped buildings were about 1,600 buildings. That is about 100 buildings per year. For buildings aged over 50, the number of it went from 4,000 to 9,000. That is, every year there was an increase of some 510 buildings. To put it simply, the pace of redevelopment cannot catch up with the rapidly aging building blocks in Hong Kong. There is imminent need in the society to encourage private sector in the redevelopment of old and dilapidated buildings. The amendment bill is to amend Cap 545 and its subsidiary legislation to expedite consolidation of fragmented titles for the redevelopment of old and dilapidated buildings. The bill proposes to lower the application threshold for a compulsory sale and to channel resources to target old districts with more pressing redevelopment need. The amendment bill proposes to lower the application threshold for private buildings aged over 50 to 70% or 65% from 90%, depending on where the buildings are located. In other words, the older the buildings, the lower the threshold. For buildings in the same age bracket, if they're located in designated areas, then the threshold for a compulsory sale application would be even more lower. The administration will adopt two criteria to identify designated areas, that are the areas with more than 300 buildings aged over 50 and 300 buildings in areas issued with notice under the MBIS mandatory building inspection scheme. For buildings aged between 50 to 59, the threshold will be lowered from 80% to 70%. For buildings aged between 60 and 69, the application threshold for those located in non-designated areas, the threshold will be lowered from 80% to 70%. For those located in designated areas, the threshold will lower from 80% to 65%. For buildings aged between 50 to 59, if they are located in designated areas, the threshold will be lowered from 80% to 70%. For those located in non-designated areas, the percentage will remain unchanged at 80%. The amendment bill also proposes to allow more flexibility for multiple adjoining lots application so that we can amalgamate multiple lots for redevelopment to bring about more sales proceeds. The amendment bills also propose to lower the threshold of compulsory sale for industrial buildings not located within industrial zone from 80% to 70% to expedite the transformation and redevelopment of those industrial buildings. The administration also taken on board the views of the members of the Bills Committee. They proposed a number of amendments. They also extend the building covenant period from 6 years to 7 years. And also, they dispense with the needs to extend the building covenant period for application involving multiple joints or multiple adjoining lot applications. Dr. Tick proposes to amend Clause 14 to keep the industrial buildings not located within industrial zone threshold unchanged and keep the private buildings thresholds for private buildings located in non-designated areas unchanged, as well as for those industrial buildings aged over 30 years old. The threshold should remain unchanged as proposed by Dr. Tick as well. However, we need to transform and redevelop industrial buildings not located within industrial zone. If we keep the percentage unchanged, that will delay our redevelopment process. During the deliberation of the bill, some BC members also said that there is this situation of adverse possession of certain buildings. Some buildings don't have leases, don't have a document on the undivided shares. That is why we should set out how we deal with adverse possession in the bill. I pointed out to the administration that this issue of adverse possession is very complicated. If we deal with it under this bill, I don't think that is very practical. I think that we should wait until when we have more cases before we deal with the issue. Perhaps we should further amend the bill to deal with the issue. The administration agreed with my view, and they undertook that they will look at how the Lands Tribunal handle relevant cases in the future. I also stressed that there are a lot of old and dilapidated buildings in Hong Kong that are beyond repair. If we do not facilitate their development, they may become a ticking time bomb in the community. The administration will facilitate redevelopment of old and dilapidated buildings by proposing the bill, but that's not enough. As I've suggested multiple times, that the government should formulate overall strategy for redevelopment of old and district, and also try to increase the redevelopment value. They should relax the plot ratio and relax the building restrictions and so on to increase the commercial value of various buildings, to create more favorable conditions of redevelopment, to encourage more developers to take part in the redevelopment, to better leverage market forces. The Permanent Secretary who attended the Bills Committee agreed with my views, and they said that the Development Bureau have already conducted a district study on Yau Ma Tei and Mong Kok to allow transfer of plot ratio within the district. They are also conducting a district study on Sham Shui Po and Chun Wan. They try to identify projects with development or redevelopment potential. They will try to see if they can allow transfer of plot ratios across different districts and to encourage public and private partnership in terms of redevelopment. I think that the government is very open-minded, and I applaud them for that. I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. And the proposed amendments to be moved by the Secretary for Development. I so submit. Thank you, President. Mr. Tony Chair, since 2012, I've been a Legislative Council member, and all along I have concerned about the dual aging issue of Hong Kong, that is the aging population and aging buildings. Just like humans, if we regularly maintain the buildings, their lifespan can be extended. However, if the buildings are too old and dilapidated, we may have to redevelop them to improve our living conditions, as well as to inject new impetus into the society. From 2013 to 2022, the URA and the private sector have redeveloped some 1,600 buildings in Hong Kong. That may sound like a lot, but that cannot catch up with the rapidly aging building blocks in Hong Kong because we have over 5,000 buildings aged over 50. That's 3 times the buildings that have been redeveloped. The slow pace of redevelopment is because of fragmented titles of lots. Some owners are out of reach. That is why it's difficult for us to consolidate all titles for redevelopment. In 1999, that is 1/4 of a century ago, the administration put in place the Land Compulsory Sale for Redevelopment Ordinance. It says that if the developer can collect a certain percentage of titles, then upon order issued by the Land Tribunal, they can mandate the sale of the buildings. The threshold used to be set at 90%, and in 2010, the administration relaxed the threshold to 80%. Some people criticized that the lowering of the threshold actually favor the developers and facilitate property hegemony. However, it's still very difficult for private developers to collect all the titles. Some buildings are very old and their owners want to redevelop it. However, because of some owners are out of reach and there are also nailed households, that is why those buildings cannot be redeveloped. Some buildings are mixed-use buildings involving stores and residential flats. Some stores in the buildings want to continue to operate. However, the residential flats owners suffer from the poor living conditions. There could be water seepage and other problems. And sometimes the commercial owners object to the compulsory sale, and that is why those buildings cannot be redeveloped. Also, some owners operate subdivided units, and because they earn a lot from it, and that is why they object to the compulsory sale of certain buildings. All these pose further difficulties for redevelopment. The administration last year proposed to lower the threshold to 70% and 60%. During government consultation, some people are worried that the threshold proposed was too low. After balancing various factors, the administration made a new proposal. They introduced this concept of designated areas and designate different percentage to buildings aged differently and in different areas. For buildings aged over 50, the threshold will be lowered to 70% or 65%. That is higher than the 60% proposed last year. For buildings aged between 60 and 69, the threshold will lower to 70%, and only for those aged above 70 the threshold will be lowered to 65%. I think that the proposed threshold will be able to protect minority owners and facilitate redevelopment. Another proposal of the administration is to introduce more flexibility for multiple adjoining lot applications. This will achieve economy of scale and transfer of plot ratio and increase the development potential of the lots. For old buildings that have maximized their use of plot ratio, they will be able to be redeveloped. And because of a larger redevelopment area, the sales proceed may increase. The flexible use of plot ratio will increase the area of common area that will increase the living environment and conditions, and that will also facilitate commercial activities. I hope that the administration will allow the transfer of plot ratio to take place in different districts. The administration should make use of new areas to increase redevelopment projects and to incentivize developers. Apart from lowering the threshold and allowing more flexibility for multiple adjoining lots applications, the bill also introduces a number of measures to streamline the legal process and enhance support to affected minority owners. Under the Development Bureau, there will be a dedicated office to help minority owners affected by the compulsory sale. The dedicated office will offer independent evaluation and legal advice services. They will encourage the minority owners to engage in mediation, and they will help them search for a replacement flat. For owner-occupiers, they will be able to stay in the redeveloped building for no more than 6 months. This will allow them to purchase a replacement flat or rent another flat. President, I would like to talk about the issue that has not been dealt with under the bill, that is the impact of adverse possession in old districts. Adverse possession is not very uncommon in old districts. Some adverse possessors take the flats of owners that have become out of reach. Some owners have taken advantage of the rear staircase or common areas. These areas do not constitute any undivided shares in the lease, or they do not own any titles. They only have possessory titles. With the lowering of the compulsory sale threshold, especially after introducing the multiple adjoining lot relaxations, the adverse possession cases will decrease. I know that this issue is very complicated. We cannot completely solve it by amending the LCSRO. However, we may empower the Land Tribunal to authorize professionals to assess the redevelopment area so that the Land Tribunals can make a judgment. I'm disappointed in the administration for not doing so. I hope that the Secretary can look into the problem, because this may hinder redevelopment projects. President, I so speak in support of the bill.
Mr. Chan Kin-po. Thank you, President. The Land Compulsory Sale for Redevelopment Amendment Bill C 2023 seeks to promote urban renewal. I support that. According to the bill, for private buildings aged 50 or above, the application threshold for compulsory sale will be lowered from 80% to 70 or 65%, depending on the age of buildings and the locations concerned. And the application thresholds for buildings in designated areas will be lower than those in non-designated areas. Now, for aged buildings, it may not be economical to proceed to repair them. It may be more cost-effective to redevelop these buildings. Now, there are 4 major proposals in this bill, including lowering the threshold, facilitating multiple adjoining lot applications, streamlining the legal process of the compulsory sale regime, as well as enhancing support to affected minority owners. Now, some suggest that the threshold for buildings in non-designated designated areas should remain at 80%, especially those aged 60 to 69, so as to channel redevelopment resources to designated areas. In fact, 38% of buildings have received notices for mandatory building inspection. There is a more pressing need for redevelopment of buildings in the designated areas, but at the same time, for buildings in non-designated areas, there may be problems with dilapidation because of lack of repair. Their condition or state of repair may be worse than buildings in designated areas. So I find the lowering of thresholds for buildings in both designated and non-designated areas suitable. The objective of the bill is to expedite the progress of redevelopment. Some owners may be concerned about whether they would be compelled to sell because the building is aged 50 or above. Now, the Lands Tribunal doesn't approve just any case. It is a stringent gatekeeper. Apart from considering the age of buildings, it also considers the state of repair of buildings in determining whether the order for sale should be granted. If there is no need for redeveloping the building, the Lands Tribunal will not grant such an order for compulsory sale, and the members of the public should be reassured. Dr. Starry. President, I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. I support the second reading of the bill. In relation to the examination of the bill, I must say that I have had mixed feelings. This compulsory sale legislation involves private property. Since its enactment in 1999, the ordinance has remained controversial. In 2010, in order to promote the chances of old buildings being redeveloped for the three specified classes of lots, the application threshold for compulsory sale was lowered from 90% to 80%. Back then, I also helped scrutinize the bill in this council. I understand that the administration made a lot of efforts in consulting stakeholders, and there was a very heated debate in this council relating to this legislative proposal. There were also wide repercussions in the community. I served the Kowloon City constituency in 2004. In 2008, I took part in the electrical election. I served my constituencies, which were Kowloon West, Sam Shui Po, and Yau Chim Mong. These are old districts, and over the years, I have come across various cases of building owners seeking assistance. Now, many owners of aged buildings were forced to sell their buildings because of the compulsory sale regime. I remember receiving a case at my ward office. The owner was an elderly, and the owner was really helpless. Now, as a councillor at the time, I also felt helpless because I was not a professional, so I asked some professionals to help answer the inquiries. At the same time, I've also come across building owners who would like to participate in the redevelopment of the buildings, and they would approach me and ask me to invite the government to help in the redevelopment of buildings, and these are not buildings in the 13 streets but also other places. Now, because of the high application thresholds, I couldn't help the minority owners. Several attempts were actually made in relation to a building in my constituency, to no avail. Over the years, I understand that the URA has kickstarted a number of redevelopment projects, including the one in the 5 streets. Some private developers also successfully acquired title in buildings in the 5 streets. Every time I meet with these building owners, they tell me that they are happier because they are able to move to another flat. So this is an issue close to my heart. I understand that we should not just rely on the Urban Renewal Authority in taking forward the compulsory sale regime. Now, but of course, you're familiar with the 7-year compensation rule. In fact, the financial status of the URA has come under close scrutiny recently. Secretary, I met with you some time ago, and then you have come up with this proposal to lower the application thresholds for compulsory sale so as to leverage on private forces to take forward redevelopment projects. But we need to understand that there is an asymmetry of power between private developers and minority owners. Private developers have the means, they also have channel to receive information, and that is not the case for minority owners. We need to protect the interests of minority owners. Now, Secretary, I understand that you've made a bold move by substantially lowering the threshold for compulsory sale. I understand that with the passage of the bill, more owners of aged buildings will be affected comparing to the last legislative exercise. So I really need to consider this proposal very carefully. I am a member of this Bills Committee because I want to make sure that there will be sufficient safeguards for minority owners. There should also be enhanced support with the lowering of the application thresholds. I thank the administration for taking on board our suggestions. In fact, the administration has taken on board members' suggestions on various occasions, including more legal safeguards, more support measures, as well as giving an undertaking to provide dedicated loan scheme with government guarantee. The dedicated office will also provide free legal advice and valuation office to minority owners, as well as counseling service. Support will also be given to minority owners to find a replacement flat. The administration has also promised to undertake publicity and public education. In fact, the administration has also undertaken that this task should begin as early as possible. You should not wait until compulsory auction begins. Many owners do need help. Many owners dare not bargain with the private developers or intermediaries for fear of being compelled to sell their properties. In the past, even when I was the councillor serving the constituents, I did not have a clear idea about that. So you should make sure that support is given to buildings in the affected areas, and that is the designated areas. The scope is so wide, so Secretary, you should make sure that sufficient support is given to minority owners. With the lowering of the application thresholds, you should make sure that we are able to protect the interests of minority owners. Secretary, I must say that I will be following up on this issue. I will ask you to make regular report to this council after passage of the bill. You should also be able to provide data for our reference. I hope that the data presented to us after the lowering of the threshold will be able to convince us that this is the right way to go, and minority owners will be able to get reasonable compensation. And Secretary, I have been exchanging views with you on urban renewal and redevelopment of aged buildings. Compulsory sale regime is just one of the many options. Secretary, you should continue to monitor the market situation, because at the moment, when we consider protecting minority owners, we do understand that the market is not doing quite well, and there is financial pressure on the URA as well. Secretary, there should be a comprehensive review of planning of the whole area. Where deemed suitable, there should be exchange of plot or transfer of plot ratio across different districts. Sometimes, even leveraging on private forces, you may not be able to acquire the titles, such as the case in 13 streets. The URA is a public body. Together with the government, we should closely monitor the pressing needs of redevelopment for some districts. The URA in the past did not only consider this single factor. There were many factors that they considered in their acquisition proposal. So I hope that Secretary, you can give me an undertaking. A study should be conducted in relation to areas with the most pressing redevelopment needs or redevelopment aspirations. My last point is that we should not confine ourselves to compulsory sale in Hong Kong. So far, only one joint sale application has succeeded. We need to find out why. Secretary, you need to conduct a review. You need to review the joint sale application arrangements to help minority owners, especially in Kowloon City. There are some low rises. I think that instead of waiting for titles to be acquired by private developers, we should help them file joint sale applications. We should take a look at Macau, and they have a decanting site for joint sale applications. In fact, I've also been looking into this arrangement in the mainland. There is relocation arrangements as well as compensation for owners. Of course, these three places differ in terms of the conditions and characteristics, but still, we should not confine ourselves to just one option. We should not just rely on private developers to proceed to compulsory sale. More should be done to explore different ways of urban renewal. I so submit and support the bill.
Dr. Teck Chi Yuen, President. Redevelopment of old districts is crucial to the long-term development of Hong Kong. We have a large number of old buildings that require refurbishment or redevelopment, especially for the 3 new buildings where there is buildings without OCs, property management companies, and so on. So these buildings could be a hidden safety hazard. That's why I support the government's strategy to speed up urban renewal as a whole. On the land compulsory sale for redevelopment amendment bill 2023, I support lowering the threshold in designated areas because that will help to promote the redevelopment of older dilapidated buildings. And then after the passage of the bill, the government is to set up a dedicated office to provide one-stop service, and I support that. That includes a valuation service, legal service, and even counseling service. And then there will also be a loan scheme with government guarantee, so minority owners could be given loans to meet certain expenses. But then we are against lowering the threshold for compulsory sale in non-designated areas. Before minority owners are given adequate protection, we shouldn't lower the threshold too much and too soon. I will explain further in the committee stage as I move my amendments. Now, compulsory sale is about tug of war between developers and minority owners. But developers want to pay less, minority owners want to be paid more. But then this is not a level playing field. The minority owners are usually have less resources, and so often the transaction is not fair. The minority owners are exploited, and with a compulsory sale, minority owners don't have a choice. They don't have the right to determine whether to sell and when to sell their properties. And then the so-called ruling of the Ninth Tribunal is just going through the motion without any bidding. Usually the final auction price is the reserve price. There's only one case with some tender price, the auction price higher than the reserve price, and so these are not real auctions. So it's really unfair to minority owners. And on valuation on valuation, that's actually the crucial part. Now, the government is not giving enough protection to minority owners. Their properties could be their lifetime saving. And if we further lower the threshold, we may further undermine the bargaining power of minority owners. Now, the bill would speed up redevelopment and improve the living condition of owners. In the last amendment exercise in 2010, at the time, the reserve price was about 2.5 times that of the average property price. Now, from information given by the administration, the property price is 1.83 times of reserve price, and so that's a drop, and that covers this 1.83 actually covers cases of 2.5 before 2010. That means in the past decade, the overall price is actually lower than 1.83 times. And maybe half of the cases is lower by 1.2 times, because there are far fewer land sites for redevelopment. So we see a drop in the availability of lots, and also given the current market situation, you can imagine that the ratio will be lower than 1.2 times. Now, many members asked the administration with the sales proceeds apportioned to minority owners, what sort of properties could they buy? The administration said that 60% of owners will be able to buy a similar property in the same district that's under 30 years old. And then what about the remaining 40%? From 2019 to 2022, for most of the compulsory sale cases, owners could only buy properties that are 50 years or older. Now, if the property price is lower than the reserve price by 1.2 times, not 1.83 times, that means minority owners could only buy another property that's at least 50 years old. So, is it really the case that minority owners will see improvement in their living condition? After compulsory sale, minority owners have to move to units older than 50 years. There's no improvement to their living condition. They're just moving from one old building to another old building, and maybe a few years later, they will have to go through compulsory sale again, and it becomes a vicious circle. Now, the market is poor now, and some owners may have to take out a second mortgage, and some properties may have negative maybe in negative equity, and then the banks may call loan. So the government can't ignore these cases, because it's a government act that has led the property become negative equity. Now, I am not totally against compulsory sale, especially some buildings do require redevelopment as soon as possible, but then there are limited redevelopment resources, so priority should be given to areas with urgent needs. Now, the Development Bureau says that the designated areas means places where there are more old buildings. Now, there are over 8,000 old buildings in designated areas that are eligible, but each year there are just 10 or 20 compulsory sale applications each year. So that means there are far more buildings that require development than developers could handle. So that's why for non-designated areas, I believe the existing threshold should be kept. We should take a progressive approach. We don't want more grievances among the public, and that's what a responsible and prudent government should do. The Development Bureau insists that there's need to lower the threshold in non-designated areas, because there are 3,100 buildings that have been issued mandatory building inspection order. And then at Bill's committee meetings, the URA has done the analysis on buildings. Only 4 to 5% of buildings are beyond repair. So, therefore, we should focus on building inspection, and then we could identify the 4 to 5% of buildings, and then we could then designate the area. As for the 95% of the buildings, they won't be affected, and the owners of these units will not be exploited. The government stresses time and again that the object of the bill is to lower the threshold for compulsory sale, so that we could speed up private sector participation in redeveloping old buildings that will address the hidden hazards of buildings and improve people's livelihood. But maybe this is wishful thinking. Well, we honestly believe that developers are buying up old units so that they can improve the living condition of residents, while developers are businessmen. Their aim is to maximize their profit. The property market is not doing well, so developers are being very cautious in buying up and buying land, and we've seen a number of aborted land auction exercises. That means developers won't buy land if there's no money to be made. There's definitely they are not there to improve people's livelihood. Now, there was a case in an old building, and then the owners approached a developer to buy the lot, but then the property said that the plot ratio is already fully used, so they have no interest in that lot. So commercial businesses are there to make profit, but it's important that they do so in a fair manner. If developers could earn reasonable return and owners enjoy reasonable improvement to their living condition, then it will be a win-win situation. But is it ideal, or is it just an illusion? Thank you. Mr. Sunny Tan. Thank you, President. I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. We're seeing a rapidly aging building stock. Buildings department's statistics show that there are now 9,600 buildings aged 50 years or above, and over 3,500 buildings are over 60 years old. And by 2032, there will be 15,800 old buildings older than 50 years. So there's definitely urgency in redevelopment of old buildings. So the bill is to streamline the compulsory sale regime and lower the threshold from 80% to a lower percentage depending on the age of the building and the location of the building. And then there is also further streamlining of the legal process to facilitate compulsory sale applications. I believe the object of the bill is specific. This is a long-term strategy to speed up private sector participation in the redevelopment of old and dilapidated buildings. Then we could resolve the safety issues there, and then people will live in safer and nicer environment. This would benefit the city planning of Hong Kong as a whole. I noticed that there's been extensive consultation before the bill was proposed. The Bills Committee also considered the bill in great detail. The Bureau will set up a dedicated office too after the passage of the bill. So there will be one-stop support service to minority owners. The government will also set up a dedicated loan scheme to help minority owners meet the expenses involved in compulsory sale. So this is striking the right balance. This bill also designates 7 areas: Wan Chai, Yamate, and so on. These are core urban areas. The land resources are really very valuable. So in promoting the redevelopment of old and dilapidated and urban renewal, we are able to meet the housing needs of the public. And we want the government to work with the developers to make good use of these land resources so that we could build iconic buildings and venues for mega events. For example, art galleries, opera houses, and so on. And then we could promote further synergistic development, say with Kai Tak or West Kowloon Cultural District. And then as the government takes forward urban renewal, it could make reference to good successful examples overseas and on the mainland. And then we could do better town planning. Then Hong Kong will be international cosmopolitan city that has sustainable development. I hope the bill. I believe the bill could help the public enjoy better living conditions. Thank you.
Mr. Lau Kwok Fun. Thank you, President. Sorry. Thank you, Deputy President. I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. I think that it's necessary for us to lower the threshold for compulsory sale application, and the administration is creating NDAs, new development areas in the northern metropolis, and they are building more flats in the area. However, there are certain districts in Hong Kong with a lot of old and dilapidated buildings. Under the amendment bill, there are 7 designated areas. These are areas with a lot of old buildings. Aged buildings are potential hazards. There are 2 goals to the amendment bill. First, we want to encourage district rejuvenation so that we can inject impetus into the district for sustainable development. Second, for hazardous buildings of old age, if they are not rehabilitated or maintained well, then by lowering the threshold, they may be able to be redeveloped. There are designated areas and non-designated areas set out in the bill. I think that is necessary. There is a specific goal to the distinction. Non-designated areas are not areas with a lot of old buildings, but there are a certain number of them in those areas. For buildings aged between 60 to 69, as at end 2022, there are about 2,600 of such buildings across the territory. Among them, 51% are located in non-designated areas. So there are quite a lot of old buildings in non-designated areas. For old buildings that are through new buildings, if they are not well maintained, by lowering the threshold, we may be able to redevelop them. I don't think that there is any difference between old buildings located in designated areas and non-designated areas. We have to redevelop them anyway. From 2013 to 2022, in these 10 years' time, for private buildings aged over 50, that's gone from 4,500 to 9,600. By 2032, it will be increased to 15,800. By 2042, that will go up to 22,900. So in the future, we will have more than 10,000 buildings aged over 50. How many buildings have we redeveloped? From 2013 to 2022, URA and private developers have redeveloped only 1,600 buildings. So it means that the pace of redevelopment really cannot catch up with the rapidly aging building blocks in Hong Kong. So we have to come up with ways or tools and also lower the threshold to streamline urban renewal and building redevelopment. If we do not do so, then that will worsen the aging district issue that we have. I hope that the administration will take action immediately upon passage of the bill. At the same time, however, we have to protect the interest of minority owners. Just now, Dr. Sari Lee, Deputy President, talked about how we can protect the interest of minority owners in old buildings. Under the amendment bill, we're not only lowering the threshold, we are allowing more flexibility for multiple adjoining lot applications for compulsory sale. But it's very difficult for us to make relevant calculations and technical assessment. So I think that we have to step up publicity and educate the public about the adjoining lot applications for compulsory sale. It's quite difficult to understand. So we have to educate the minority publics, minority owners, and we have to be transparent. The administration have adopted a number of measures to help minority owners, including the personal loan guarantee scheme offered by the government. The scheme helps minority owners tide over the liquidity gap in litigations. Can we expand the scope of the scheme? Should we increase the loan offered to minority owners? For Macau, the DAB conducted a site visit to Macau. Actually, the Macau government give a guaranteed loan to the minority owners affected by the redevelopment, and they provide a house for minority owners affected by the redevelopment. I think that the administration can offer such arrangement in Kawichao Artificial Islands or Northern Metropolis. I think that on top of the loan guarantee scheme, the administration should also offer some transitional housing for minority owners affected. By this, the owners may be more encouraged to redevelop their buildings. These measures are related to urban renewal strategy that we have. The strategy was formulated in 2011. It's been some 10 years' time since its formulation. I think that we have to update our urban renewal strategy. Since 2011, I know that the administration has conducted the Yangwon district study, for example, along other tasks. They have also introduced new planning tools such as transfer of plot ratio to encourage redevelopment. However, I think that we need a territory-wide urban renewal strategy. Lastly, we may not be able to facilitate redevelopment even after lowering the threshold because of our economic situation. However, we have to support the amendment bill because the financial position of the URA is not as ideal. This year, they have to spend some $60 billion on the projects, but they only have some $10 billion at hand. They may have to issue bonds to raise some $10 to $20 billion. That is why we cannot completely rely on URA to encourage urban renewal. We need to make use of different tools, and we have to have the participation of the private sector to achieve our goals. I speak in support of the bill to lower the threshold. Thank you, Deputy President. Mr. Lam San-kun, thank you. I would like to thank the Permanent Secretary of Development and the Secretary for Development for handling the government lease extension bill and the land compulsory sale for redevelopment amendment bill 2023 in the past 6 months. These two bills are important to stabilize the confidence of the people and the investors, and that will also facilitate the redevelopment of our old districts. The Development Bureau team was very professional, so I have to commend them for their work. During the Bills Committee meetings, the Development Bureau listened carefully to the views of the public and the electrical members. They explained the content of the bill very clearly, which alleviated the concerns of the people. What I remember the most is that the administration made use of PowerPoint slides to explain to the BC members what it means by staircase connected lots. The staircase is not just connected at the floor. For some buildings, people can only walk to another building by crossing the staircase at the roof. This bill is very complicated. I think that even for judges and lawyers, they may not be able to fully understand the bill, even if they just look at the text. The team of the Development Bureau was very professional in explaining the bill. I think that, well, how should the courts of Hong Kong interpret the bill's provisions? What happens if the courts have different interpretations of the bill? Well, they will look at the legislative intent of the bill for interpretation. What the government team and the electrical members said in the Bills Committee would be very important in case of disputes, because our records of meetings may become exhibits in the courts. I think that upon passage of the bill, we can include the PowerPoint slides of the Development Bureau in the e-legislation website, or maybe we can put a hyperlink to the Bills Committee meetings on the e-legislation website so that people can view our meetings to reduce disputes. In the 5th of July, the government leases extension bill was passed, and the lease of lots can be extended indefinitely. If there are breaches of leases of buildings, for example, when there are unauthorized building works, the government may not renew the lease of the lots with such buildings. That is why building rehabilitation is very important. As at 2022, there are some 27% of buildings aged over 70. If these buildings are not rehabilitated or maintained well, they will become ticking time bomb in the community. As the buildings aged, they will need repairment and maintenance. And if the owners do not maintain or repair their buildings in years, then the cost involved for repairment could be very high. I know that the owners have an emotional attachment to their flats after they've lived there for a long time. And some owners, as a result, want to keep their flats despite the dilapidation. However, the buildings may need repairment here and there over the years. I think that the owners should allow the buildings to be redeveloped when it's time. That is why I agree that we should lower the threshold of compulsory sale application, and the administration have balanced the interest of the owners and developers. According to the government's records, the sales proceeds received by the minority owners is better than the market value. As at the end of 2023, in the 165 cases of compulsory sale applications, the amount of sales proceeds apportioned to each minority owners was 1.83 times the market value of the property owned by such owners. The biggest problem with redevelopment is that the URA developers and the government take the lead. The redevelopment needs of the owners are often neglected. For owners living in 38 to 48 Flower Market Road, they are not covered in the redevelopment project of the URA. This is not ideal with a high interest rate and downturn property market. Developers are not interested in redeveloping buildings. Since November 2020, we have recorded 5 aborted auctions. In the first 5 months this year, we don't have even a single compulsory sale auction. In such market, owners of old buildings are not able to sell their flats to developers. We are a free market. The government and the LegCo will consider interests of different parties. The market will also make it balance, and I think that the bill will facilitate the development of the land in our city. I speak in support of the bill.
Mr. Chan Siu-hong. Thank you. Deputy President, I speak in support of Land Compulsory Sale for Redevelopment Amendment Bill 2023, as well as the government's CSAs. It is a very important task to ensure building safety in order to protect people's livelihood. According to the Buildings Department's record for buildings aged 50 or above, between the 10-year period, the number has risen from over 4,000 to 9,600 buildings. Meanwhile, only 600 buildings have been redeveloped. We fail to catch up with urban decay, so we need to expedite the process. Now, the bill seeks to leverage on private developers so as to expedite urban renewal. There are 4 major initiatives in this bill. First, lower the application thresholds, combining the age of buildings and the pressing needs for redevelopment in districts. It introduces this twin concept. At the same time, for industrial buildings aged 30 or above in non-industrial zones, the threshold will be reduced from 80% to 70%. The second initiative is to encourage large-scale redevelopment by multiple adjoining lot applications to enhance land use efficiency. The third one is to streamline legal process of compulsory sale regime. The fourth point is to enhance support to affected minority owners and provide more safeguards to protect interests. There are 7 designated areas, such as Mong Kok, Yau Ma Tei, etc. These are 7 areas with more pressing needs for redevelopment. Now, the respective thresholds for aged buildings will be lowered to 70% and 65% in designated areas, respectively. There are 2,240 such buildings the titles of which could be acquired more easily. Now, for the application thresholds for buildings aged 50 to 59, 60 to 69, and over 70, the respective thresholds would be 70% and 65%, and there are some 2,100 such buildings in non-designated areas. I understand it is the government's objective to channel limited redevelopment resources to areas with more pressing needs for redevelopment. On a regular basis, the government will review the list of designated areas, and then by way of subsidiary legislation, this list can be amended in the future. I hope that the government will conduct regular reviews of the list. There should also be data collected and published in the public domain. Now, this list will affect private acquisition activities, and that the Legislative Council should also be consulted. The application thresholds for different age cohorts of buildings will be lowered to 65%. Comparing to Tokyo and Seoul, the lowest application thresholds for these two places is 67% or so. I think lowering the threshold will incentivize the progress of urban redevelopment. However, if the thresholds are too low, minority owners' interests may be undermined because they will be deprived of the bargaining power and they will not be able to get to benefit from the redevelopment project. According to the Secretary, as at the end of June 2023, of the 165 successful cases for compulsory sale, minority owners were able to get the gain from compulsory sale, which is 1.83 times of the existing use value, and they were also able to purchase a replacement flat aged 30 years or below. This is an important reference for minority owners to better understand whether the pitched price is reasonable. Of course, this 1.83 times ratio may be different depending on market condition. More information should be provided to minority owners, including more support so that proper balance can be struck between the interests of minority owners and redevelopment proposals by private developers. This bill involves the interests of many stakeholders. The bill seeks to strike a proper balance between protecting the interests of minority owners and redevelopment of buildings. We should not give out the perception that we are favoring conglomerates and private developers. I welcome the government's efforts in promoting redevelopment by private developers. After passage of the bill, a dedicated office will be set up to provide one-stop service to minority owners, including valuation, legal advice, counseling, as well as other support services. The government will also roll out a dedicated loan scheme with government guarantee to support minority owners involved in compulsory sale litigation. I also support the new provisions in the bill, which will allow minority owners to stay in their properties after compulsory sale up to 6 months. I also support allowing multiple adjoining lot applications. There isn't any incentive to take forward redevelopment of a single lot, and building pencil-like buildings is not cost-effective from the land use perspective. If we allow multiple adjoining lot applications, in theory, the redevelopment value could be increased, and also minority owners will also benefit from compulsory sale. My concern is safeguards for minority owners to prevent private developers from splitting the lots for separate compulsory sale applications, followed by amalgamation for the adjoining lots, so as to deprive the minority owners of their interests. We need to be able to give minority owners reasonable compensation. A fair and open appeal mechanism will allow minority owners to better safeguard the value of their properties. The aging building stock is a common problem in Hong Kong. I think the government should take the two-pronged approach, that is rehabilitation and redevelopment. I'm happy to see that the government has initiated a study using Kaohsiung artificial islands as the set scenario in the study. We can explore options such as allowing transfer of plot ratios across districts so as to expedite the pace of urban renewal. Finally, I hope that the government will bear in mind the original intent of this bill is to expedite redevelopment and improve people's livelihood. The government should bear in mind to put people's interests as a top priority. I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. Dr. Johnny Ng, Deputy President. Land Compulsory Sale for Redevelopment Amendment Bill 2023 is now before us. It seeks to lower the application thresholds to expedite redevelopment and urban renewal. I support this bill as it will encourage private participation in urban building redevelopment of buildings. I'm also concerned about the interests of affected minority owners and whether adequate support has been given to them. I believe that we should strike a balance between protection of private property and expediting redevelopment. I want to stress 3 points. First, the living conditions of many private buildings are problematic. They are the hotbed for vice activities. According to statistics, there are over 4,000 buildings or 9,600 buildings reaching the certain age in 2021 and over the age of 50, in fact, and the number is expected to rise to 13,900 by 2032. There are also 5,003 new buildings in a poor state of repair in Hong Kong. We should expedite the redevelopment of these buildings. Wang Feng mentioned had a fire early this year, and in fact, earlier the fire safety notice was issued. The owners did not comply with the notice, and as a result, there were casualties. This building also housed some guest houses, and for fire extinguishers, some of them had been expired for more than 2 years, not to mention the state of the dilapidation. There is also the problem of multiple ownership in aged buildings. Many minority owners are no longer traceable. They may be living outside of Hong Kong for a long time. Some owners may have deceased. As a result, the application threshold could not be reached. Minority owners could not get the reasonable compensation. For example, this building making mansion in To Kwa Wan is 60 years of age. There was a proposal from private developers. The acquisition price was $16,000 per square foot. That's 50% higher than the market price. In 2023, however, 8% of owners requested the ask for a price of $18,000. That's 12.5% more. Some owners also insisted not to sell the properties. Some owners were untraceable. All these added to the difficulties in acquiring titles. In the long run, the acquisition cost would go up, and that could hamper the pace of redevelopment, affecting the interests of owners in general. So I do believe it is necessary to lower the application thresholds. We should promote urban renewal so as to improve the living environment of the residents. At the same time, we should protect the interests of owners. For example, there should be safeguards, there should be relocation arrangements. Valuation services should be provided so as to help minority owners get information in the market and reduce information asymmetry between minority owners as well as private developers. As for decanting or relocation, the government should collaborate with the private developers. For example, the scheme could be extended to private projects. A certain ratio of units can be set aside for decanting purposes. Private developers participating in the scheme could be given tax breaks as an incentive to promote urban renewal. We can also encourage more private developers to undertake redevelopment projects. To sum up, lowering the application thresholds could help encourage private developers undertake redevelopment projects. At the same time, we also need to protect the interests of minority owners. There should be a policy change to create favorable conditions for redevelopment of buildings. So submit.
Mr. Kitson Yang, thank you. Now, I work in the district, especially in the old districts. We focus on four issues. One is redevelopment, second, water seepage, and three, fire safety issues, and so on. Now, last month, this council passed a CAP amendments to CAP 344 that will enhance the transparency of owners' corporations and empowering fire service department and buildings department to enter premises to take measures. Well, there's a bill that received its first and second reading last 2 weeks ago, and now we are considering the land compulsory sale for redevelopment amendment bill 2023. I must commend the term of the government. They have the resolution to address all these tough issues. I've been involved in district for over 20 years. Many residents asked me to strive for speeding up the development. Now, I represent the Kowloon Wontasin district. Many residents want to improve their living condition through development. Of course, some owners don't want redevelopment. But then their buildings are getting older. They can't afford a major repair, and these buildings don't even have escalators. And initially, the residents who didn't want redevelopment would now change their mind because as they get older, it's difficult for them to climb upstairs. Now, the bill introduces the concept of designated and non-designated areas. It depends on the types of buildings and the locations of buildings. So the threshold will be lowered from 80% to 70% or 65%, depending on the location. The older the building, the lower the threshold. Now, I support this amendment because it could speed up redevelopment. It could also make placing nails more costly. In Kowloon City, let's say there's a low rise. There are just 10 house units or so. There's no owners corporation. Someone has bought 21% of the titles, and then they rented out the units by turning them into subdivided units to place. The building is so messy. So if you want redevelopment, don't even think about it because I've already placed nails here. If you want to sell the units, you just have to sell to me. And so these are the developers that force or these businesses force people to sell units cheap to them, because they held some 20% of the share. So there's no chance for the owners to go for redevelopment. But now with the threshold lowered, it means there is a high chance of redevelopment of the building. Aging buildings are common in Hong Kong. The criteria for specifying the 7 designated areas are based on certain criteria that is depends on the number of old buildings in each district. Now, Hong Kong is not included as designated. I'm talking about the area near the funeral homes, and some of the buildings there are really old. Maybe they don't meet in terms of the number of buildings that are old. Maybe they don't meet the criteria, but then the buildings that are old are really dilapidated. So the government should have regard instead should consider percentage rather than absolute numbers. So if a certain percentage of the buildings are of a certain age, then the area could be become designated area. So there's a need to keep reviewing the list in a timely manner. And there's Hong Ham, Sampo Kong, Shang Fung Street. We really need to take a good look at these areas because many residents would like to see redevelopment there as soon as possible. The government's lowering the threshold. This is a move in the right direction. We can't just rely on the URA. So we need to rely on market forces. But then the government needs to give more help. For example, after the relocation of the Kai Tak Airport, the building height restrictions been lifted, and so many lots still have surplus plot ratio. And then there are 13 streets, so that's the largest cluster of old buildings. There are multiple ownerships, and private developers cannot take up the project. But the URA said that it will have to save enough resources before it could redevelop 13 streets, so there's no date for redevelopment for 13 streets. Now, after the passage of this bill, maybe the 13 streets could be divided into a few smaller lots, and then it may facilitate redevelopment by either private developers or URA. Now, the government has struck the right balance between redevelopment needs and the interests of minority owners. Dr. Tok Chi Yun wants to keep the threshold of 80% for non-designated areas. I don't agree. Dr. Tek thinks the government is being aggressive, but I don't think so. I don't think the government is doing enough because in 2022 there was a suggestion of a 60% threshold for buildings aged 70 years or older, but now it's been revised to 65%. You know, a redevelopment project may take 8 or 10 years. By the time works actually start, the building may be already 80 years old. So for these really old buildings, I think we could go further. And for buildings, say 60 years old or 50 years old, there's still a high threshold. So can we not lower the threshold further to speed up the redevelopment further? Well, yes, I think the government has tried to balance different views and put forward the amendments. So I support it, although I think the government could go further. Dr. Tek Chi Yun thinks the government should help owners to repair their buildings. Even if we're talking non-designated areas, some of the buildings are in really in despair. For example, the collapse of Ma Tau Wai building was a shock to the people of Hong Kong. We don't want to see the same tragedy again. And some people really live in dire conditions. Even if the government helps owners with repair, their own government could only help so much. And owners, do they have to keep repairing the buildings? And then with major repair, it will cost over several hundreds of thousands of dollars for each unit. Can owners really afford it? If it's so easy to go for repair, then the public won't be yearning for redevelopment, because repair is not really a permanent solution. Now, if we go by Dr. Tek's amendment to keep the existing threshold, these owners will never see improvement to the living condition, because they never get to see redevelopment of their units. Now, I can see Dr. Tek is trying to consider the interest of minority owners. He thinks there is not enough protection to minority owners in this amendment exercise. But actually, there are various measures to protect minority owners. The government is going to set up a dedicated office to give support to minority owners. Same as Dr. Tek, I hope the government will do more. Apart from giving legal support, there could be other support like emotional support, counseling, and so on. Or the government could go a step even further, that is, they will subsidize an independent valuation report to protect the interests of minority owners. So the government could still do more on this. In the past, owners of property sale had difficulties trying to find similar units in the district. It's not so easy to find a suitable unit, and then the unit could be over $20,000 per square foot. But then the compensation is based on market value. If for Toco One, it's just $12,000 to $13,000 per square foot. So they can't find another unit in the same district. They have to move to the new territory, so they're forced to leave the neighborhood that they are familiar with, and it really disrupts their life and their work. So can the government relax the limit on income and so on? Now, maybe when private developers buy up units, maybe these owners should be allowed to buy subsidized housing. So I speak in support of the bill and all the amendments of the government, but I have to oppose Dr. Tek Chi Yun's amendment. Ms. Judy Chen, thank you. I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. Now, in recent years, we have seen dire challenge arising from aged buildings in the older districts. Many of these buildings are not kept in good condition, and there are actually structural safety issues. 2 weeks ago in Kennedy Town, there was a case of concrete slabs falling down, injuring a pedestrian. And a man's head was injured. Fortunately, it was just an injury. There was no fatality. My understanding is that that building is over 60 years old, and that's actually notice served on mandatory building inspection, but that notice is not yet complied with. Now, owners, of course, care very much about their properties because they are their assets, but then with the aging buildings, we are talking about risk to the public. And this risk will only become worse as the buildings become older. Between 2013 and 2022, the number of buildings aged 50 years or above increased substantially from 4,500 to 9,600. And then by 2032, there will be close to 16,000 buildings, or to be exact, 15,800 buildings that will be 50 years or older. So that's why redevelopment buildings is important. It's also sustainable development. But of course, the biggest challenge we face is that the rate of redevelopment cannot keep up with the rate of aging of buildings. So this bill is to address the issue of an aging building stock. It's meant to encourage greater private sector participation in the redevelopment of older dilapidated buildings. I am grateful to the Bureau and the team, because in the course of deliberations, the Bureau took on board some of the suggestions of members. And before we started considering a bill, the Bureau agreed to first hold a public hearing, so we received views from 23 deputations and individuals. And then the Secretary answered questions from each of the deputations. And at every meeting, the Secretary and her team gave detailed explanation to questions raised at the meeting before. Now, the issues like parallel approach with 344, enhancing the role of URA, and then there are also complicated issues. And then the government used illustrations to explain the issue to us. For example, we expressed concern about adverse possession, balancing the rights and interests of minority owners, and how the Land Tribunal serves as a gatekeeper. And then for tenement buildings, what if there are adjoining units? And is there a difference whether there are staircases or not? And then there are also technical issues raised and concerns raised by members. The Bureau gave us clear answers to address our concerns. So that's why at each meeting, the Bureau prepared much information and showed us different scenarios, even past cases to explain issues to us. So we should commend the Bureau for their effort. The bill, of course, is to lower the threshold for compulsory sale application. And the bill is also to streamline the determination of an application by the Lands Bureau. At the same time, the bill seeks to enhance support to minority owners and impose certain redevelopment requirements on lots So this is a comprehensive bill that covers all the factors. At the Bills Committee, we are most concerned about how we could strike a balance between speeding up urban development and protecting minority owners. We want a win-win situation, in particular for minority owners affected by compulsory sale. The government needs to make sure these minority owners receive the support they need in the course of compulsory sale. And the bill also designates 7 areas: Sai Ying Pun, Sheung Wan, Wan Chai, Yau Te, Mong Kok, Cheung Sha Wan, Ma Tau Kwok, and Chun Wan. So the threshold will be even lower for buildings in the designated areas compared to the non-designated areas. Now, even though the threshold is lowered, it doesn't mean it's easy for developers to acquire properties. It's still a drawn-out process. So I would suggest that the government come up with a long-term urban renewal strategy. Now, the 7 designated areas are just the first phase. When we'll have the second and third phase, what plans does the government have on the remaining old districts? We hope the government will come up with a timetable soon, because there are residents living in dangerous old buildings. We must give them hope. We must tell them when they can expect redevelopment of their buildings so their living condition could be improved. So I hope the government will create favorable conditions for redevelopment, and then we could attract more private developers to join in the effort. Now, the object of the bill is to speed up the redevelopment of old buildings in Hong Kong as we take care of the interests of minority owners. So I hope this amendment will help to address the challenge of rapidly aging building stock, and then we're able to see improvement soon to the living condition of the public. So I speak in support of the bill. Thank you.
Mr. Vincent Cheng. Thank you, Deputy President. I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. I also support the CSAs to be moved by the administration. As we all know, we have 9,600 buildings aged over 60 in Hong Kong. It went from 4,500 to 9,600 in the past 10 years. In 2032, we will have more than 15,000 buildings aged over 50, and in 2042, we will have over 22,000 buildings aged over 50. As at end 2023, the Lands Tribunals received 545 cases. Only some 140 cases have been approved. There is great discrepancy between the two figures. The bill is just a tool to expedite redevelopment and urban renewal, coupled with other measures. We want to encourage urban renewal. The Kowloon West district that I serve, Yau Chin Mong, Sham Shui Po, these are the areas with a lot of old and dilapidated buildings. In April, I asked the administration about the distribution of old buildings in the territory. For buildings aged over 15 in Yau Chin Mong, Sham Shui Po, Kowloon West, the old buildings account for over 1/3 of the total number of buildings. They're composed of 3 new buildings and buildings without owners' cooperation. Without support of the administration, the owners are unable to repair and maintain their buildings, and the cement slabs would fall off from the buildings, and they're not able to install fire safety equipment, and the means of escapes are not cleared. The fire broke out in the New Lucky House is just the tip of the iceberg. With a subsidy, even, the repair work cannot start. The owners often say that they would like to wait for redevelopment of the URA instead of repairing and maintaining their buildings. However, developers look at the market situation before they acquire the buildings. As a member of the URA, in the meetings, we often say that we don't have really enough resources. We have conducted the Yamon district study and Shamshui Pochun 1 study. We have commenced the Sai Street Flower Market Road redevelopment project. It is expected the project will be sold at a lower cost, at a price lower than the acquisition road. As acquisition cost, we have started the redevelopment project at Carpenter Road in Kowloon City. It is said that the URA have to issue bond to raise fund. For the redevelopment of 13 streets, the Civil Service Corporation, society, buildings, it takes time. The bill is just one of the tools to speed up urban renewal. It's not the only tool. I'm grateful for the BC members of the bill for completing the scrutiny of the bill. I wanted to participate in the scrutiny. However, I was not allotted a spot. In 2022 August, we visited a tenement building of 7 to 8 stories. Owners of that tenement buildings said that they wanted to redevelop their buildings. Under the amendment bill, the threshold will be lowered from 80% to 70% or 65%. We understand the level and we support it. And there are also different elements included in the process to protect the interest of the minority owners. I will not repeat what the other members have said. I want to raise a few points of concern. The DAB asked the government to set up a dedicated office to support the minority owners affected by the compulsory sale. I know that the Bureau will work on it so that minority owners will have more information and have more support so that their interest will not be undermined. Second, the owners are not completely passive. They sometimes work with the developers to facilitate compulsory sale applications. There are certain deficiencies in joint sale. The administration said that they are reviewing the joint sale arrangement, but are they working on it? Third, there aren't a lot of compulsory sale auctions in the past, and there are a number of aborted auctions. I think that we have to come up with a sustainable arrangement for the URA. Apart from raising fund by issuing bonds, there should be other means to increase the liquidity of the URA. Lastly, a owner told me that from the perspective of the owner of the old building, actually all of the owners in the building want to have the threshold of compulsory sale lower because they don't want to really repair the buildings because they're really beyond repair. They hope that the government will speed up the legal process to lower the threshold for compulsory sale. I know that the Bureau is working on other measures on urban renewal. Thank you. Next, Mr. Lemon Kong. Thank you, Deputy President. The aging building blocks in Hong Kong is getting more serious. According to the Buildings Department, for buildings aged over 50, in the past 10 years, it's gone from 44,500 to 9,600. By 2042, there will be 22,900 buildings over 50 years old. That's 2.5 times of the figures in 2022. For owners living in old buildings, their power cables are old. They are faced with fire hazards and other issues. They also have to fork out high repair and maintenance costs. That is why we have to speed up urban renewal to improve the living conditions of the people. If we can redevelop the entire district, that will solve the aging building issue that we have. However, there are certain challenges to urban renewal. There have been a number of aborted auction of compulsory sale, which shows that the legal process of compulsory sale regime is too complicated. The reserve price setting procedures is too stringent, and it's difficult to consolidate all titles. Under the amendment bill, it is proposed that the threshold will be lowered from 80% to 70% to 65% for buildings aged over 50. And it also allows buildings over 50 years old located in adjoining lots to submit joint applications for compulsory sale. This will encourage the private sector to participate in the redevelopment to expedite its process. In 2015 or 16, I was a Shamshui district councillor. 70% of the owner in a area in Shamshui wanted to redevelop their buildings, but they could not meet the threshold. If we had the threshold lowered back then the Chimsin Lane of Cheung Sa Wan may be very different from what it is right now. By lowering the threshold, we can improve the streetscapes of the districts. Some developers place their nails in the old districts so that the buildings cannot be redeveloped. They ask for a high sale compensation, and it's difficult for minority owners to object to the compulsory sale. There have been a number of nailed districts that can be sold under the compulsory sale regime because of the relaxing of threshold. With the fragmented title, some owners cannot be traced, and the undivided shares owned by the store owner may be too substantial for the minority owners to consolidate 80% of the titles in their buildings. The buildings located in the lots are usually very popular. For the Kim Sin Lane example that I mentioned is one of the places where it's very popular. There are 7 designated areas proposed in the bill. The threshold will be even lower in designated areas in order to channel private sector resources to redevelop the area. There are over 5 designated areas, including Kowloon West, Yamate, Mongkok, Shamshui, and Cheung Sa Wan, that are undergoing district study. I hope that the stakeholders will continue to improve the district study and then speed up the Shamshui district study to start working on urban renewal and improve the urban living environment. President, a lot of minority owners have conflicting feelings about the lowering of the threshold. They are worried that the developers would offer a lower price, making it difficult for them to identify a similar flat in the same district. And the valuation may not be very clear under the compulsory sale regime, and that may affect the interest of the minority owners. This morning, I talked to the owners of the Yaoqingmou district in order to alleviate the concerns of the minority owners. I think that the administration should propose more administrative support for the owners. I know that the Development Bureau will set up a dedicated office and ask the URA to set up a support services center to support the minority owners affected by the compulsory sale regime. They will offer help to them. I hope that these measures will protect the interest of the public and the minority owners to speed up urban renewal and improve the living conditions of the people. I speak in support of the Land Compulsory Sale for Development Amendment Bill 2023.
Professor Priscilla Leung. Deputy President, I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. Same as Deputy President, I had 13 years of experience in direct elections, Now, I served my constituents in Kowloon West, and redevelopment in To Kwa Wan, Kaiming Street, etc., is a very big issue. In 45J Matawai Road, the building collapsed. A fire broke out in Fa Yun Street. All these are due to aged buildings in a dilapidated state because of the buildings not being redeveloped. These things happened, and that is why I support the lowering of the threshold in the bills. Now, together with my fellow party members, Mr. Kissen Young is in fact a electrical member now, and we back then visited different buildings in various streets, and we came across many cases of minority owners not getting reasonable compensation. To many minority owners, their properties are the only assets in their family, and for elderly owners, they may live in a big flat, but then there may be many problems such as water leakage, electrical wiring problems. The former Secretary for Development, Mrs. Carrie Lam, and Mr. Paul Chan, the former Secretary for Development, who is now the Financial Secretary, also visited these premises. These premises are not suitable for habitation, and that is why I support the government's bill in designating some districts such as Mong Kok, Sai Ying, Pun Chun Wan, Wan Chai, Yamate, To Kwa Wan, Cheung Sha Wan, Ma Tau Kok in the bill, because tragedies have happened in these places before. I also support another proposal, and that is for industrial buildings aged 30 or above in non-industrial zones. The threshold should be reduced from 80 to 70% so as to expedite the transformation of industrial buildings. This is a balancing exercise between public and private interests. Now, in Yau Chim Mong, after years of efforts, we floated a proposal for the redevelopment of the whole district. Meanwhile, I fully appreciate the sentiment of many shop operators and owners of commercial space. They have their client base in the district. They don't want to go anywhere else. But still, we need to take things at a macro level, such as better planning for older districts. I'll come to this point later, but I think the crux of the matter is how we strike a balance between the interests of different parties and protect minority owners' interests. The second proposal in the bill is to allow multiple adjoining lot applications. In the past, only adjoining lots connected by common staircase could be is covered. Now, we allow adjoining lot applications not connected by a staircase. Now, say if there is only 90% consent from one building and 80% from another building, then for minority owners, I'm concerned about the protection of their interests in this multiple adjoining lot application. You need to make sure that minority owners also benefit from the redevelopment proposal. But the dollar sign is always a bone of contention. The third proposal is streamlining the legal process of compulsory sale regime. If there is no objection from any of the minority owners, the Lands Tribunal will only need to determine the redevelopment value without having to go through the valuation reports. I understand, of course, if the case is taken to the Lands Tribunal, a lot of manpower resources will be needed because it's always controversial. People tend to argue the value of properties even over a very small sum. So there will be a very keen manpower demand. I remember in 2019, I moved the first motion debate in this council. I talked about how the middle class do not have the means to take the case to court. The same applies to minority owners here. Even though the avenue of litigation is available, it is impractical because this is the scenario we see in our ward offices. Some aggrieved people may come to LegCo to outside the complex to stage a protest. Still, you need to protect the interests of minority owners in order to address the issue. Now, Mrs. Carrie Lam was then the Secretary for Development. I moved an amendment to the motion in 2010 in relation to the amendment to the Land Compulsory Sale Redevelopment Ordinance. Mrs. Carrie Lam emphasized this point on the effectiveness of voluntary mediation. During the debate, two LegCo members, including myself, advocated compulsory mediation in the compulsory sale process. This is a way for private developers to be engaged in the mediation process on a mandatory basis so that a consensus could be reached before the case is taken to the tribunal. In the Lehman Brothers incident, we successfully resorted to mediation, and we also helped promote the setting up of a financial dispute resolution center. I fully agree that this is the way to go because this is really a common theme for us. We lead a team of engineers, lawyers, accountants, and we represent the minority owners in a discussion with private developers so as to strive for reasonable compensation. Now let me read out what Mrs. Carrie Lam said about this mediation center. I understand that members like Priscilla Leung are concerned about the effectiveness of voluntary mediation in 2010, and as such, the government will publish a practice direction for the Lands Tribunal to consider in granting the order for compulsory sale. The tribunal should be satisfied that the majority owner has already taken all reasonable steps to ensure the interests of all undivided shares. If the majority owner refuses to resort to mediation with minority owners, then this is a factor that the Lands Tribunal will consider. This is really the only option for minority owners. They don't have the means. They have to rely on mediation. In fact, after 2019, I've heard this from the mediation profession. After the Lehman Brothers case, we successfully advocated the use of mediation. Even for cases taken to court, they would first go through the mediation process. Now we can set up something like the Financial Dispute Resolution Center for compulsory sale cases, such as the nailed households and some stubborn minority owners. You can invite them to go through the process at the mediation center, because with an independent party's presence, they may be able to reach a consensus. The management of private developers would also like to achieve a consensus. So, Secretary, I think that you should promote mediation for minority owners in compulsory sale cases, especially since we have a lot of trained professionals. Just like arbitrators, we have a list of mediators working for the mediation center. So there are choices for minority owners. I've been following up on this issue for 15 years. I will allow Ms. Eunice Yong to speak, and then I'll draw a line and suspend today's meeting. Mr. Bill Tang. I fully appreciate the efforts made by the team led by Secretary for Development. I'm a member of the Bills Committee. At each meeting, I could feel how meticulous and patient the government officials have been in taking us through the nitty-gritty of the bill. The administration even prepared a PowerPoint to help us understand the bill better, especially when there is already a lot on the plate of the Development Bureau. I really appreciate that. And the administration's team also sat through the public hearing, listening to the views expressed by members of the public and the deputation. Now, this is a very controversial bill involving private property and the interests of many people. I'm a member of the FTU. And we have had reservations about the compulsory sale arrangements because we are worried about the interest of minority owners. By 2030, there'll be 13,000 private buildings aged 50 or above. It is simply impractical to rely on the Urban Renewal Authority to undertake redevelopment. The URA is not tasked with the single mission of redevelopment. It has a lot in its portfolio as well. That is why we should rely on market forces. Now, somebody may say we should wait until the financial position of the URA improves. But that is not practical because dilapidated buildings may bring safety hazards. I'm not even talking about serious cases of the collapse of buildings. For a piece of concrete falling off the building onto a pavement, it's already serious enough, posing a hazard to pedestrians and passers-by, and that is why the FTU is going to support this bill. The bill proposes 4 major amendments. These are major changes. Apart from the lowering of application thresholds, which is easy to understand, the bill also seeks to streamline the legal process of the compulsory sale regime. Professor Priscilla Leung already explained this part. There is also enhanced support to affected minority owners as well as facilitating multiple adjoining lot applications. These 4 proposals will definitely expedite the progress and the extent of redevelopment. Conglomerates as well as other entities may participate in the compulsory sale for redevelopment. So it's for us to consider how we can instill confidence in minority owners. There should be safeguards for minority owners. We should protect their rights to private property. That is why I ask the government to consider this suggestion. Legal aid for minority owners living in that property without other properties for investment. Legal aid should be an avenue available for them to engage in litigation. Now, of course, Professor Priscilla Leung just referred to mediation and that we have a very good culture of mediation. And I know that many people are joining the mediation profession. Still, it's all about public confidence. After passage of the bill, I don't think that there will be any other major change to the urban renewal strategy in the coming 4 to 5 or even 10 years. So whilst we expedite redevelopment, we need to provide better safeguards for minority owners. Now, Hong Kong attaches great importance to the rule of law. That means when it comes to policies or civil disputes, justice is seen to be done. So perhaps this is not the work of the Secretary for Development, but rather the government as a whole. For a minority owner of a property for self-occupation involved in a compulsory sale application, he should be able to apply for legal aid to argue his case in the Lands Tribunal. Of course, we can impose conditions. For example, this minority owner must also take part in the mediation process. Say if there is a dispute over money, perhaps a private developer may come up with a compensation amount that exceeds the amount ordered by the Lands Tribunal. The minority owner may be ordered to pay for the costs. This is a safeguard against abuse of legal aid. If we are able to impose conditions and introduce new requirements in this regime, we can then give proper legal safeguards to minority owners, and that the government will win the heart of the people, for there is justice, and that is the suggestion I've made at the Bills Committee. I don't think mediation is the only option for the public to feel that the government is providing sufficient safeguards for minority owners to take things down the legal route. I look forward to a response from the administration. The other point is that I hope the Development Bureau can step up liaison with the legal profession as well as the engineering sector. Now, after the new regime is put in place, minority owners should be able to get first-hand information as quickly as possible to understand how this law will affect them, so that we let the public feel that the government is serving the people.
Ms. Eunice Yung, President, I speak in support of the Land Compulsory Sale for Redevelopment Amendment Bill 2023. The amendments seek to lower the threshold for compulsory sale application and speed up the pace of redevelopment of old buildings. This is an important bill involving building safety. That's why we need to consider it very carefully. Now we're seeing an aging building stock in Hong Kong. There are already 9,600 buildings that are 50 years or older, and that accounts for 1/3 of all private buildings. And many of the buildings are in a state of disrepair, and the living condition is poor, so it is a hidden danger to the public. But then now the threshold is 80% before it could be an application for compulsory sale. And in many buildings, it's not possible to consolidate ownerships, so the development process is slow. Now, the lowest threshold will be 65%. And in designated areas with older buildings, the threshold is even lower, so that will encourage more owners to activate the redevelopment process. Now, lowering the threshold will allow owners to work together to promote redevelopment. This will improve the living condition. But then in old districts, there are many grassroots households. They have extremely poor living condition. So redevelopment is actually a way out for them to get out of the poor housing condition. So that's why this bill will help to speed up urban renewal. It will promote economic development and is in the interest of people's livelihood. But then we need to address various concerns. Some members spoke on how we could protect the interests of minority owners. Now, after we lower the threshold, minority owners may feel that they're forced to accept compulsory sale. So they will have less bargaining power, especially for elderly owners. They may not be able to find suitable alternative housing. And then shops may also have to stop operations. Now, I'm myself a mediator. I've dealt with cases of mediation involving compulsory sale. Actually, the developer did not come up with many options. The mediation is mostly about the price, whether it's $6.5 million or $7 million. Now, even if a developer can offer you $7 million, you can't buy a similar unit in the same district. And then imagine the old owners, they bought a unit in Kowloon West 30 years ago. Is to them an achievement. But now, with several $million, they simply could not afford another unit in the same district. So they, feel frustrated. And of course, many developers may say that, the competition is really for you to live in the same district. You can go to a further, more remote district. Well, yes, the developer may put it this way, but owners will feel that their interests are affected. So if developers could come up with some more options, maybe if the owners are able to buy other units in the same district, and if developers give minority owners more choices, we should encourage that. Because owners just want to live in the same district because they've lived there for years. To elderly owners in particular, they will have great difficulties adjusting to a new district. So as we consider mediation, we hope developers will come up with more options to minority owners. And then we could speed up the whole process. And then we're able to encourage a compulsory sale because that's the intention of the bill. So lowering the threshold will it really lead to speeding of development? That remains a question. Now, as the developers try to consolidate the unit's ownership, they have to consider various factors such as the scale of redevelopment, the return rate, and then in some districts there's a low plot ratio, and that may not be conducive to encouraging developers to redevelop the buildings. And then there are other complex issues too that may pose a challenge to developers. So if we just lower the threshold and there are no solutions to all the practical difficulties, developers still won't be keen in redeveloping old buildings. So at the end, minority owners' interests are affected, but redevelopment doesn't take place, and then it will just lead to more social conflict. So as we support the bill, we must ask the government to come up with comprehensive policies and measures, and it has to take care of the interests of different parties. Just now, there's mentioned that maybe there should be mandatory remediation service involving the land tribunal. Actually, the land tribunal may issue an order of mediation, and so then there will be need to go through mediation. So minority owners could then seek professional advice on the mediation option. So there's need to give assistance to minority owners on these issues. How do we promote mediation first? That's what the government's been advocating. So before we go to court, there should be mediation, not after we go to court. So how do developers help to promote mediation in the community? That's an important subject. Now, for designated areas with imminent need of redevelopment, we have to consider objective factors such as the state of disrepair of buildings and so on. And we don't want to cast the area too wide. And so we need to consider the needs of these different districts. We have to review the list of designated areas frequently enough. And then at the same time, for grassroots households who are affected by redevelopment, there should be proper arrangement for them. There has to be a clearer compensation and relocation arrangement, for example, transitional housing or removal subsidy. So the minority owners' interests won't be affected by compulsory sale of units. And the URA could work with owners to provide technical support. For example, they could help formulate an initial proposal on redevelopment, and the URA could also help owners to form owners' corporations. And one point must not be overlooked. Compulsory sale is only one way to for urban renewal. The government needs to provide land for redevelopment. There is a need to relax land use suitably, so there are more incentives for developers to go for compulsory sale. And in considering compulsory sale applications, there's need to speed up processing of these applications. The government and the URA should intervene with particularly old buildings. Promoting redevelopment in the old district is about the well-being of the public. This is an important aspect of our development. So with this bill, we're able to speed up urban renewal, but then we must proceed with caution. As we promote development, we have to consider the interests of all parties. There must be a comprehensive policy support. We need to strike a balance between the interests of minority owners and developers. And then we would achieve the objective of the bill to benefit more in the community. Thank you. I suspend the meeting till 9 a.m. tomorrow.